Good morning. Let's call the meeting to order, April 6, 2020. Deschutes County Board of Commissioners, please join us in the Pledge of Allegiance. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Oh, and I do want to make a comment. Thank you to the community for donating blood. Apparently, people have actually answered that call. It is critical, and if you haven't donated blood, please do so. It is it's a very needed commodity in our country at this time. So donating blood, it doesn't hurt that much. It doesn't take that long, and please consider doing it. It's important for our health and our hospitals. Thank you.
Well, and along those lines, Commissioner, I've been trying to schedule myself to give blood, and they're a few weeks out. So the facilities they have, so as I say, staying persistent with it, making sure to come back to it in the next few weeks when it looks like it's tapering off, possibly because it's just the gathering capacity is lessened right now also. But it's good to hear that they're scheduled.
Yes, so that's excellent.
I'd like to make a couple comments too.
Sure.
Are you finished with yours? Opening
Yes.
ones? Okay. So I had a couple of comments. One is I went by my bank on Friday, and it's one of the local banks, and it looks like they are making progress with the PPP, the payroll protection plan applications. The banker that runs that branch, I know somewhat, and she said she'd received over 50 applications on Friday and was going to work over the weekend. So that's the means of people getting payroll reimbursement and mortgage, et cetera. So I think that was good to hear that that's working. I'm happy about that. Second, I'm going to wear my mask today. My wife has been making masks. She's made over 50 now. I think she made 22 this weekend. So she's in home health care. She gives it out to her fellow workers, to people at home that are, a lot of people that she works with are, are more vulnerable probably in the age group and illness issues. And then other senior people that she sees, plus all of our family. So respect for that. I'm going to do that. Also, it does seem like, I know we're going to go into review, but it does seem like our stay-at-home is working in our state, and I'm anxious to hear further reports on that. But when you look at what's going on in other states, it seems like it's doing well. So people in Deschutes County should be proud of that and for their following through with that. Then finally, I was going to mention that I was able to get some metrics that are being measured currently on traffic and airport usage, et cetera, that are pretty interesting. And I don't know if who exactly is putting that together, but it's pretty interesting to see the impact on things that maybe we could share between the commissioners at some point further. So that's all.
Great. Thank you. And I see our sheriff.
Can I have one more item?
Yes.
So confidentiality of disclosure is a state law, so 2017 ORS 433-008. Because I know we've been kind of going back and forth about we're a local health authority as a board of commissioners. We have our health authority staff, and it is in the state law. In the course of an investigation of a reportable disease or disease outbreak, information is confidential and then exempt under some different legalities. So there, what we're seeing from our staff seems to be very, it is following the rules, and it does talk about breaking it out into, groups of 5 and 10 once you have more of a statistical breakout. But, each disease investigation is confidential information by law. So it's just a way to kind of talk about that and learn about it.
So I don't know if we're going to have a discussion about that now, but I want to, if you're going to put that out there, I think we should have a discussion about it sometime, because I think what's been clear to those of us asking questions has been at what point is it of value to the public? And that's what's not been clear to us. And there is a lot of concern. We have 36 cases in our county as of the last I heard. Maybe it's more now.
39.
Okay, 39, according to the Commissioner Adair. So at some point, I think there is a public need to to disclose some of that, and so, I don't know
Well, as I say,
how you got that, but I
yeah, well, I
as
asked,
it's-
I said, okay,
yeah.
well, how do we base this? You know,
Yeah.
how do we base our confidentiality? So, oh, it's right here, state statute. So I'm, you know, I'm
Yeah,
not here to
but we
debate
did
it
talk
today. I was just a starting
what part of
point.
the information is confidential, and what part generally could we use, because we haven't gotten some of that, and Commissioner Dare got some clarification of that from our legal counsel, but maybe we can talk about that under COVID.
Well, yeah, as I say, I mean, let's, you know, have the discussion, maybe learn some stuff offline also. You know, this is our public meeting, but the confidentiality of each of those cases, there's just, you know, some legal lines about what it really looks like. And then, as we're seeing, you know, when there's groups of 5 in some categories, the statistics are coming out, so.
The interesting thing is when you can go on the Central Oregon SOS website and you can see a couple that have let their information out for the public, and they have it, and, you know, they're trying to get through it. So the interesting facts is when you can go out and you can find out more information from the community at times. So it does seem a bit frustrating to us.
Oh, and it's frustrating for everyone, especially in a scenario like this. I mean, this is happening nationally and around the world, obviously.
Okay, well, around the world, the number today was 70,000 deaths worldwide with or without China, however China does their numbers, but 70,000 worldwide. So, and if you look at the modeling from the University of Washington, it's a third of the people are in ICU in New York State than what they projected on April 3rd. So that's good to know that our numbers are less than some of the models. So, you know, I look forward to hearing from our health people today, immediately, in fact. As soon as we get through, we should go on to our consent agenda, please.
Next item, what's citizen input? Is there?
There is no citizen input today. There was one input, and that's related to our agenda, so we'll cover it at that point in time. And,
Is the rule with citizen input that it has to be in writing now? Is that the, if we,
Yes.
I mean, somebody couldn't show up here and give input?
well,
I mean, who,
they could if they should leave it outside the door, I suppose.
We've not,
well, why couldn't they come in the room?
Well, they could.
I guess I'm concerned with people still having, I mean, we're meeting because we think what we're doing, we have important business, so couldn't people come if they wanted to and speak, or has somebody made it? I've never been aware of a decision that was made on that, so.
No, they definitely could. We just have to keep our 10, so if someone did feel important, you know, that it was important, we would just have to make sure we only have 10 or fewer in the room at that time. And it's at the very start of our meeting.
I just don't want everything to be, we're willing to have all of our staff people come in and talk to us at length. If a citizen wanted to be here in person, which is often more effective than an email, they could still. Is that the rule, is that our
Where's our
policy?
legal counsel, do you have, I would think they still could come in. Dave, is there a different ruling?
Commissioner, yeah, the direction I've provided to Sharon is certainly if folks want to provide public comment, they have the option of being there in person, which would of course require coordination with staff to get in the building and actually get in the room based on our numbers. They could also attempt to use the phone-in line during that portion of the meeting, or they could submit written documentation with the understanding that those written documents will be shared with and read by the commissioners, but won't be read aloud during the meeting.
Thank you. Okay, so anyone out there that wants to come in, you are welcome. You know, it'll just take a little teeny bit of navigation, but we can make it happen. So I needed to pull item number 5, the minutes from the 25th. There was something I wanted to add, change that around a bit.
Yeah, I was gonna recommend we pull all three. I haven't had a chance to review them. I was trying to this morning, but there were so many things came up, so.
Okay. So then do we have an emotion for items 1 and 2?
I wondered if the sheriff, I saw him in the hallway, I don't know if he wants to talk a little bit about his agreement. It's kind of a landmark or new direction agreement with Sisters, and I was able to see the details, but maybe he could talk briefly about what is new in the agreement with Sisters, if he's willing to. I see him. We'll put him on the spot.
So with that, I'll move approval of item number 1 on the consent agenda because we've
Yep.
pulled the other items.
Yeah.
Okay, is there a second?
I'll second that.
Further discussion? Commissioner DeBonne?
Yes.
Commissioner Henderson?
Yes.
And the chair votes yes. So item number 1 made it to be pulled and, made it approved. And item number 2 will be the first item of our agenda. Sheriff Nelson, would you like to address the agreement with Sisters?
Thank you, Commissioner. We are ready to have the commission vote on it. The city has agreed to it. We've agreed to it. I think it's going to be great for the community. It's going to be great for the sheriff's office, going to allow some more resources out there. And then the way we have it set up, we'll be opening the stable positions out there for interviews of interested troops. So it's going to look different out there, and I think it's going to be a plus.
Great.
A couple items. So we have the facility under ownership now. So it used to be a rental. So the sheriff's base station in Sisters is a county facility now, which is a real exciting.
I agree. I think that was a great move. I appreciate you all for purchasing that building.
And there's a long history of sheriff's office providing those services for the city of Sisters. There was a police force back in the day.
Yes.
I don't remember the dates, but.
So we've been providing law enforcement services out there since 1999, I believe. I'd have to look at my notes,
I
but
remember the date.
late 90s.
But that's also the case in the city of Lapine, which is really a great opportunity. You know, instead of having another force right there at that city line, which Sisters is about 2 square miles, Lapine is about 7. But having that public safety service, the continuity of the organization, it's just a great opportunity for our citizens.
I agree with you, and I know the great ladies and gentlemen that I work with really enjoy it, and they enjoy working here in our county for all our communities, and these are just some great opportunities.
Great.
Sheriff, looking at the agreement, is this pretty similar to what we do in Lapine in terms of an
So
assigned?
Lapine is set up a little different. So our community down there pays District 2 taxes for rural patrol services. So we provide rural patrol, and then we have an agreement with the city of Lapine to ensure that any concerns over local code enforcement would be able to be handled by the sheriff's office.
So the tax rate was in place as the city became, the city came on after that tax rate. So it's on the line for a city in Lapine, for a city resident to pay the rural patrol rate. So that's very unique. And then the city of Sisters doesn't have a different rate, so this is a contract.
And as a resident of Sisters Country, I want to say I'm excited that this is going to expand what's happening in Sisters. And, I know that Corey reached out a long time ago, and I feel that it's great that you have the continuity of officers that are actually serving there and building relationships in the community. So thank you for doing that.
You're welcome.
And that's the biggest, or one of the biggest changes is that you're going to have assigned, as I read the document, assigned lieutenant and 3 assigned deputies that work specifically in that area.
That's right, Commissioner. The council wanted to have specific deputy sheriffs assigned out there, as well as a lieutenant, so that they had a supervisor out there and a contact who had an office out there. So we'll now go through that process. Of course, the city's been a great partner because it's going to take us a little bit to fill those positions. That always takes a little bit of time, and so we're going to operate under the existing contract until we have those positions in place. The lieutenant position will be filled on July 1st.
Great.
I'd move approval of document number 2020-049, the intergovernmental agreement for law enforcement services with the city of Sisters in Deschutes County.
And I'll second it.
Any further discussion? Commissioner Henderson?
I vote yes.
Commissioner DeBonne?
Yes.
And the chair votes yes, happily. So thank you very much.
Thank you,
Thanks for
Commissioners.
joining us.
Okay, so now we are, Janice, are you on the phone?
Yes, ma'am.
Fabulous.
I am on the phone.
Okay, do you want to bring up your first document?
Yes, the first item is number 6 on your agenda, and it is a request for board approval and signature of OHA contract amendment number 159336. This is a contract with OHA to cover the cost of additional infrastructure, training, and staff time for our parent-child interaction therapy piece of work. The contract is for $171,800 for a biennium beginning 7/1/19 through 6/30/21. It came to us quite late as a result of a couple of things. One was the unusual closure of the legislative session last year, which left some things unattended to, and then this particular contract didn't make it through the first round of getting back to some business and had to go through a second ratification process with OHA and with the legislature. So we received it in January. In effect, it pays for some staff time for staff members who provide parent-child interaction therapy to children and their parents. It pays for some training, some materials and supplies, and also covers some uncovered costs because this is an intervention that the training takes clinicians out of circulation for up to 6 hours a week, so we lose revenue when they're not able to bill for services and they're being trained. And last, it allows us to provide the intervention to up to 5 families that don't have OHP and are otherwise un- or underinsured. That is the gist of it.
Thank you.
Any questions?
So, one question, Commissioner DeBonne here. Partway through the biennium, is this amount kind of prorated, or is this the amount expected? Have we made this commitment generally knowing this was coming in this biennium?
It was prorated this year, and then we are expending the additional dollars in next year's budget to cover more of the staff person's time. They're planning to give us a lump sum payment upon execution of the agreement, I think for the first portion of for this biennium.
So you're saying then we're going to get $85,900? That'll go through June 30th? And then,
Yes,
okay.
yes, yes.
Okay, and we will get that as soon as.
And there's sorry, Commissioner, go ahead.
No, we'll get that as soon as this contract is signed then, and, yes, thank you.
And submitted, yes.
Mr. Anderson, did you have?
And then we actually, Cheryl provided me on Friday with a small budget summary of how we plan to expend the dollars, and I had asked that you get a hard copy of that in your mailboxes, and I think I blind copied you on that as well. But it just outlines that we will spend $45,000 of those dollars this fiscal year and $126,000 next fiscal year so that we expend the entire contract amount.
Great.
With that, I'll move approval or board signature of document number 2020-184, Oregon Health Authority Intergovernmental Agreement 159336.
I'll second that.
Any further discussion? Commissioner DeBonne?
Yes.
Mr. Henderson?
Yes.
And the chair votes yes. Thank you, Janice. Do you want to go to the next one?
I think the next one's
The next one, item number 7 got pulled. We
Correct.
found some numbers of the document that needed to be addressed and edited. So that got pulled. We'll resubmit later. Item number 8 is a contract amendment. We are requesting board signature and approval. The document is numbered 159163-8. This is dollars added to Service Element 66, which pays for substance use, basically for substance use, recovery, prevention, and gambling services during the biennium. And this particular amendment was intended to fund the implementation of a project that OHA is calling Prime Plus Peer Project. This is the long-awaited contract amendment with funds to pay for peer support services in the emergency department. It finally arrived at the end of February and is before you now for approval. We will receive a lump sum payment again upon execution of the contract. The total amount is for $480,000. The contract period goes through the end of next fiscal year, June 30th, 2021, but I believe we have permission to extend it for a 2-year period, which is what was originally budgeted. The planned expenditure for this particular item is a pass-through contract to Best Care, who is providing these services currently in the Madras and Redmond ED. And we will not be implementing that contract until things calm down in terms of the pandemic event that we're experiencing right now, because obviously putting peers in the ED currently is likely not going to happen and not wise. The state is aware of that and patient with our development process.
So I have a question.
And that sums it up.
Janice,
Yes.
Phil, I have a question. So this is for the biennium also?
This is also for the biennium.
So by the time the pandemic is done, the first year of the biennium could easily be done. So
Correct.
will you put all 480,000 into the second year?
Well, our intention is to be able to extend it over an 18-month to 2-year period, and I believe we will be able to extend past the end of the biennium.
So that'd be something you're checking on at this point?
We have already checked on it, and we had assurances about this year because they approached us this past summer, and it took 10 months to actually get the amendment. So we've been having ongoing conversations about the ability to extend outside of the contract period. So we're going to have to, again, address that issue because obviously the services are going to be delayed considerably.
So this is really an expansion of funding from what you expected during the budget meetings we had, and this was a kind of an increased funding that the legislature wanted or approved. Is that accurate?
Partly accurate. This is money that OHA received probably going on 2 years ago now as part of the opioid omnibus package of funding to address overdose and addiction. And we were contacted in the summer of last year by OHA letting us know that they had some unexpended funds and would we be interested in maybe offering this service, and we said yes and began to plan for how to deliver. And it just took an incredibly long time to actually get the contract amendment from OHA. We were unwilling to implement without a contract executed.
Yeah. So this wasn't really, this wasn't the legislature increasing funding, this was OHA, as you said, has some funds from the federal government for the opioid crisis. So it could be just a one cycle expenditure from the state.
It absolutely could be a one-cycle expenditure, and that is, to be frank, part of our decision to offer this as a contract
So,
rather than create FTE.
Janice, Exhibit C,
Yes,
it shows the effective dates for both of the $240,000 as 2/1/2020 to 9/30/2020. Is that what we're looking at? Is 480,000 that's, going through the end of September of this year?
my document says December 31st, 2020.
Exhibit C.
Let me take a look.
Exhibit C? up there?
Yes, I see it. Yes, that probably relates to the federal fiscal year for the funds.
Oh, do you want to check on that for me?
Absolutely. I mean, I'm sure that the date is correct. That would be because the dollars were federal dollars, and the budget period from the Fed's perspective ends on 9/30/2020. But my understanding is we have permission to expend through the end of the biennium at a minimum.
Okay.
But I will double check. I will get back to you on that.
Commissioner DeBonne, did you have any questions?
No, it just sounds like, this is something that could have happened a while ago and it's finally happening, and now we're going to be on hold during this emergency department situation. But it'll be good to kind of get this transaction complete, because then it's an extension with dollars in hand instead of a commitment to dollars.
Okay.
Correct.
With all of those considerations, thoughts involved, I'd move approval of document number 2020-214, Oregon Health Authority Intergovernmental Agreement 159163-8.
And I'll second it.
Any further discussion? Commissioner Henderson?
I vote yes.
Commissioner DeBonne?
Yes.
And the chair votes yes. Thank you, Janice.
Thank you.
Thank you, Commissioners. I am signing off.
Okay,
Have a good day.
yes, thank you. Oh my gosh, I should have asked her about the county, our suicides. Okay. All right, Janice, we'll talk to you later. Okay, so it's,
Already gone.
I know.
We could probably get her back, though, if you want to. I mean,
Well,
we can do it during the
We'll see if
COVID.
anyone else brings it up. Maybe
Well,
he will bring it up or someone else will bring it up. Okay. Dr. Fawcett, it's like almost 10:30. Samantha, do you want to see if we can get him on the line? Dr. Richard Fawcett is supposed to be just joining us to give us his community feel. I guess I am 3 minutes early.
Move it around here.
Let's see. Did Nathan leave? Samantha, were you able to reach him? Thanks. No, she's got him, I believe. Dr. Conway, in the meantime, is Dr. Nahad Sadir Azodi, is he a doctor? I noticed that one letter said Mr., and I was just wondering, is he a doctor? Okay, because on the Executive Leadership Council, they're introducing him as doctor on that. Okay, all right. Okay, all right, well, maybe that's, we should let Kathy know then? Is that who does the Leadership Council agenda? Okay, all right, thank you. Okay. Okay, all right. Is Nathan here? Okay, so maybe should we ask Nathan to come in? He had said he had to do 10:30. Please, yes. Dr. Fawcett may have to come in. We were told he was only available at 10:30, And so we're trying to check in with him. But go ahead. You're here in the room, so we'd like to hear from you.
Yeah, I'll probably defer most of the update to Dr. Fossa. I know he's been properly briefed, and being the county health officer, he probably has the best perspective related to the course of cases and the epidemiology component of this. You know, our report today, really, I'm just going to focus on, we did get our allotment from the Strategic National Stockpile. We're in the process of today disseminating a large portion of that, probably over the next coming days, to our partners. Regardless of what we provide, the demand is going to be higher than the supply, so we're working through trying to equitably share that, you know, and base it on priority needs with our healthcare providers. We are now, with the allotment from the Strategic National Stockpile, we are over about 13,000 N95 masks, which will get us probably through the next, hoping the next couple weeks, but any significant surge obviously would deplete that rather quickly. And then we have a number of about 1,500 gowns, some face shields, and a lot of gloves. We did get a lot of gloves, which was probably, although helpful, probably not what we needed the most, but we'll take it. And then we also did get some surgical masks for.
So can you give us those numbers, please?
So currently our inventory is 11,297 surgical masks, 13,061 N95 masks, 1,565 gowns, 864 face shields, 7,600. I'm not sure if this is pairs. I'm going to hope this is pairs of nitrile gloves, and then 48,000 latex and vinyl gloves. The challenge with the latex is we really that's a last resort to utilize latex because so many people have latex allergies.
Place it. Here I am.
Are those latex or nitrile?
These are free.
Oh.
These are nitrile.
Yeah, probably almost what you have is nitrile anymore, just because it doesn't have the latex allergy. So, but in a bind that, we used to use latex all the time, but the best practice is to not use them if you don't have
I
them.
went to the place on Olney and 3rd Street there, the store there, I forget what it's called now, grocery outlet, and to buy, because my wife uses them and we use them, and we've got now three boxes of each. And I'd gone there early in the day, and then I went back, or I'd gone the day before, and they were almost out of the nitriles. They were out of the mediums and nitriles, but latex is still quite a supply there, so it must be the public is going with the nitrile also.
Yeah, I mean, if you're using them for personal use and you're not working on a patient that might have a latex allergy, and you don't have a latex allergy, latex is perfectly fine. I mean, it certainly is a good barrier, but
Yourself, yeah.
the concern is if I'm working with a patient that has a latex allergy, we just try to avoid that. So
20% of the population has a latex
Yeah.
allergy, and I am one of that 20%.
are you? Yeah.
Yes, so these are expired gloves. It said 2017. They were from my husband's office, and I've gone through the whole box now. So you could change your gloves like 100 times a day if you really thought about it.
Yeah, I mean, and short of providing patient care or needing to handle potentially contaminated documents, good old hand washing is probably a great alternative to gloves if you don't have them. So,
Can you, on the masks, so you get 13,000, you say that's from the National Stockpile.
that is a combination of sources, but the largest amount is from the Strategic National Stockpile.
So do you then distribute those to a variety of people or entities, or how's it work?
Yeah, we have a resource request system set up to where qualifying entities, and we're reaching out to those entities through our networks and through our liaisons with the incident management team as well as our operations section to be able to facilitate those resource requests. I'll be honest with you, lots of times the resource requests come in and we do not provide the full request because obviously organizations or agencies are looking what they're going to need over the next significant amount of time, and we just do not have the supply to be able to provide that, so we're supplying them usually a smaller amount, and that allows us some surge capacity to be able to provide based on critical need when the surge happens.
Well, that's
I-
great.
I hate to interrupt you, Nathan, and I know this is really important, but Dr. Fawcett is actually on the line now.
Absolutely.
Would you mind if he just gets
Yes.
his report?
No, I know
Have a
he's
few
seeing
seconds?
patients, so we should defer to him.
Okay.
Yeah, absolutely.
Okay, great. Yes, he is seeing patients. Dr. Fawcett, are you available now to give us your report, please?
Yeah, I'm here. I'm sorry, I had a call that just came in. I apologize. I was listening in, and then I had a call. So anyway, I apologize. Lots of things going on. So I missed that opening statement. I was listening to the gentleman just before, and I apologize. Is this Commissioner Adair? Is that you? I take it I missed that.
Oh, it is Commissioner Adair speaking, and I know you promised us you could be on at 10:30. Nathan was just giving us a brief update on the stockpile sources that we have now in our county that arrived on Friday, I believe. But if you want to give us your health report
Sure.
at this moment, we would like to hear from you.
Yeah, no problem. Thank you very much. Thank you for inviting me. I am the Deschutes County Health Officer. I'm also an infectious disease physician, and I think all of you I've met with before. Thank you again for having me. We to date have, including over the weekend, 39 positive cases in Deschutes County for COVID-19. The negative tests continue to accumulate in a more accurate fashion. We now have about, as of this morning, 542 negative tests. That probably does not include all of the negative tests at the University of Washington laboratories. And we're working on that with the hospital. We continue to assist the clinics, urgent cares, in particular, in getting people tested. We think that's very important. The testing from almost all of these centers, and we've spoken last week, I think, briefly about the different clinics. So High Lakes, BNC Summit, some of the urgent cares, certainly St. Charles Media Care are offering testing. We, in addition, are seeing patients at the hospital, I myself and some of the other consultants, but the majority of the work at the hospital is being done by the hospitalists and the intensive, the ICU physicians. It's difficult to know exactly how many cases we have at the hospital currently. As of the end of last week, we had 11 patients, the total that had been admitted. There are many more that are still in what we call a pending status or a rule-out status, where their tests are unfortunately still pending. The turnover, the turnaround for those test results recently, in my experience, has been about 3 to 4 days, sometimes 2 to 3 days, and most of those tests are still being run at University of Washington. These are patients in the hospital in Bend, so the turnaround's a little bit faster, but still there are quite a few patients where there's a suspicion for the possibility of COVID-19 infection, but we're not able to confirm it right away until they've been in the hospital for a couple of days, if not longer. Some of those patients are in the ICU. I believe as of the end of last week, 3 or 4 were on ventilators, and maybe 1 or 2 were also in the ICU, not on ventilators, but requiring monitoring for severe symptoms. I haven't checked this morning. I apologize. I'm not aware of any deaths. We are also now tallying the numbers of COVID-19 patients who have recovered, and that there should be an update on that coming through our county website. As you're aware, one of the challenges in the hospital is the inventory of PPE, or personal protective equipment. The hospital has been very proactive regarding this, and is concerned about the inventory, although what I'm aware of from the end of last week, still not in a dire shortage, but there is a concern going into the next couple of weeks that could get worse. One of the effects of the testing taking a while to get results back is that all of these patients who come in with a suspicion of having COVID-19 infection and who are tested, they go into either droplet or airborne isolation and stay, of course, in isolation until a test comes back negative. So that does use up a reasonable amount of the PPE. So we are working on ways, I know discussions with the hospital and with the state to improve that turnaround for testing. And I think lastly, I think we are hopefully going to be seeing in the next week or two some positive effect in terms of case frequency and hospital admissions from social distancing. I think this is our best defense and offense against this infection at this time, and I appreciate everything everybody's doing in the community to follow suit and to be careful to stay 6 feet or more away from other folks and to stay at home. So that's been a difficult thing, I know, for everybody across the country, but I really believe that this is the most important thing we can do proactively. There are other interesting issues regarding treatments that are being researched right now, but these potential treatments are not going to be available or even confirmed to be reliably effective for another several months at least, if not much longer. So that's my overall update. And if you have questions, I'd be happy to take them.
I'm wondering, how many ventilators do we have in Deschutes County currently? You know?
I don't know that perfectly. As of about 3 or 4 weeks ago, my understanding was that they had almost as many ventilators as they had ICU rooms, beds available, and so that was in the order of 25, 26, 27, something like that, and then there was a purchase of another 8 ventilators beyond that. So the hospital's been very proactive in a number of ways, and one of their preparations was to, as you know, to cancel elective surgeries and also to move patients in the hospital in Bend who are not positive for COVID-19 or suspected to have that infection to Redmond if possible. Even patients who are ICU patients, I think some of those patients, if they don't require specialty care, were transferred to Redmond. So what they're trying to do is to free up ICU rooms and to free up ventilators as well in the hospital in Bend, and that'll continue.
Okay, how many ICU rooms do we have in Deschutes County? Does anyone know?
Well, yeah,
We
I
have 270
hate to say wrong.
in the hospital.
Right. I mean, the intention is to keep the COVID-19 patients, especially the ones that are severely ill, in the hospital in Bend. We have ICU beds in Redmond as well. There's, I think, about 28, 29 ICU beds. Again, I'm not sure of that number exactly, but somewhere in the upper 20s to maybe low 30s. There are also some rooms in what's called the PCU on the second floor of the new building in Bend that can be converted into rooms accessible for ventilator use.
Okay. Yeah, that was a nice addition to the hospital. So,
Right. The new ICU is in the first floor of that new wing. So the ICU, almost doubled in size when they built the new wing. But there's an additional floor on top of that called the progressive care unit for step-down types of patients. And as I understand, some of those rooms can be converted into ICU rooms if need be. I don't think that's being done currently, but it could be done if need be.
okay. Thank you very much. Do you have any questions?
Yeah, I do. So, Dr. Fawcett, this is Commissioner Henderson. Thanks for joining us today. So we've heard about this testing, the negative tests and the positive tests. Last Monday, I guess, is when we realized or learned that not all the negatives are listed on the OHA website. I did the math on positive versus negative, and it looks like it's 7.2% of those tested are positive. So I'm always curious. I mean, I know it's really just the most important thing is how many positives we have in the county, but people do look at the statistics. So how many more do you think you might add in from University of Washington?
Yeah, so my understanding is that, this was, I know we talked about this last week briefly, and I apologize for not being active in that conversation, but I think Heather Geisner and Dr. Conway were able to go over that in a detailed fashion. But in general, what's reportable to the state as a positive test. In this situation, negative tests are very important. I think we all agree with that. But for some reason, with getting these negative results from the University of Washington, they were coming back to St. Charles Lab. And the St. Charles Lab, as far as I know, is the only laboratory in this region that's using University of Washington for these COVID-19 tests. But for some reason, the negatives were not getting to OHA. That is actively changing, although not all of those results have been updated yet. I think as of this morning, the negative tests were 542, and positives, including some cases from the weekend that turned positive over the weekend, were 39. Did you do the math on those numbers?
Yeah.
Commissioner Henderson,
Don't you put the 39 over the 581?
It's 542.
No, but that's negative tests, so you add them
No,
together.
I thought it was all of them.
No,
Okay.
you'd add them together. so you
Okay,
have it
6.7%, so it's still higher than the percentages.
Yeah.
So my question was really just how many more
Sure.
negatives do you think there might be? And it's been a week now that we've known this. And I guess my interest is that it seems like St. Charles somebody there would know how many tests were sent to University of Washington, so we'd have an estimate.
Yes.
I think that's correct. I think as of Thursday or Friday of last week, I heard an unofficial number of negative tests in the range of 400 or so. And at that time, we already knew we had already, at least 200 confirmed negative. So I'm concerned that not all of them have been put onto the OHA website at this point. But they continue to add up. So the numbers of negative tests are going to come into that website at a higher rate than they would otherwise, if that makes sense, because some of these are tests that came back, a week or more ago. So that's true. It needs to be updated more quickly. There is a point person at the hospital that's been helping us with this. I know our epidemiologist has also been helpful with this too. So they're definitely working on it. I don't understand really why we can't get them all in essentially a big dump, so to speak, so we get those numbers in there right away. And I'm not sure if there's something going on the OHA side that might be part of the problem, but I could find out exactly when that will be updated in an accurate, timely way.
Well, and I'm
Up-to-date way.
I think that'd be great if you could find a time when we might know the real numbers. I'm not as concerned of what's put through the OHA system is just knowing the truth. And so if it's 200 more, it seems like the hospital would know how many, there's somebody that sends these things in and they just count how many they send each day and they'd have a rough number maybe. But, if you're waiting for the exact number, what's the saying about don't wait for the perfect in place of the good? I mean, I just think it's important that locally, because people they know what's going on nationally, internationally, other states, et cetera. So it'd just be interesting to know if our percentages are higher than or lower than other states, roughly. We're not.
Yeah, I agree. Right, or compared to other counties as well.
Yeah, other county, great idea. Yeah, great point. So,
I would hope.
So go ahead.
No, I agree totally with Commissioner Henderson. I feel like people are very, very nervous, but if they would actually see that Deschutes County's number, because you have to fit all those parameters in order to get the test to begin with, they won't even give a lot of people the test. And so if you have to fit all those parameters and you've got the temperature and everything and you come back negative still, I just think it would make people feel a little better about our current situation. So just want to remove some of the panic that we're dealing with on a daily basis. So getting those
There is a possibility that that number is known at the hospital. and I could look into that and try to find out what the discrepancy between the total negative tests today are and what the total number at the hospitals. That's something I could look into.
Thank you, Dr. Fawcett.
And acknowledging, I mean, this was mentioned last week, and I think Incident Command kind of knows about this. We all know that it's going to be valuable to know both the numerator and the denominator of this message. We're hearing that. So I'm sure, it's kind of one of those to-do items in the incident management also. So I'm just hesitant to task the doctor with making him go do it if it's part of a project already.
Yeah, I'll follow up with Heather too, because I know our team has been working on it specifically at that same point.
Yeah.
If you're
might
going to
wanna
talk,
get
you
on-
have to get a microphone, please.
Yeah, so George Conway is saying that people are working on it, yeah.
The issue is that the obligation is to report positive tests.
I think you need to be closer.
The obligation is to report positive tests, the statutory obligation for notifiable diseases, and the specimens that St. Charles was sending to UW didn't have the county labels on them. So having to go back and reconstruct that, but there was a long discussion latter part of last week about this. It is being resolved. I believe that it's being taken care of prospectively, and they're working to resolve it after the
Good.
fact.
Okay.
So, and my thought here is just, it'd be awkward to task the doctor with something that's already happening, just because.
I like what the doctor said, because it seems like he's interested in resolving it, so that's why I was enthusiastic about him. I don't understand why St. Charles just doesn't tell us how many they sent in and do the math, and I don't want it resolved when it's over, the crisis is over. So it's been a week, and it seems like this is important information. We've made it clear to you, Dr. Conway, that we think it's important information. So I, for one, Commissioner, would like to get it done. And I know it may be St. Charles, but if we need to ask St. Charles differently, but it's been a week. And you can drive across the country and back in a week, so.
And to hear about the fact that we've had 5 suicides in our county in the last 2 weeks. In fact, someone I talked to this morning knew someone had committed suicide. People are panicked, and we need those numbers. So I think it's important if we can say on the nightly news that, hey, guess what? Deschutes County is only 3% positives of those extremely difficult parameters even to become tested. So, just calm the environment down. I think it's critical for our county, our state, and our nation. So, anyway, thank you. Thank you, Dr. Fawcett. Did you have anything else you want to say to him? Thank you so much, Dr. Fawcett, for being available this morning. Thank you for being our Deputy Health Officer for Deschutes County. And
I have something else.
oh, you have something else?
Yeah,
Okay.
so Dr. Fawcett, one other question, or point I want to make is that I'm glad you're working on the number of COVID patients that are recovering, because I think that also will be helpful to people to know that people are. I heard from a friend whose mother-in-law was put in that facility in Lebanon, and, that was 15 or 18 people got sick, 3 died, but he said that they'd heard that, as of now, they have 13 people have recovered, including one that was a 105-year-old gentleman that had been in World War II. So it's good to know the recovery rates, and that's, I think people will be glad to hear that too, so.
Yes, the 100.
Yeah, no, I agree.
That's amazing.
I agree.
So, yes, he was in World War II, and, I think he's like 104 or something, and it was just great seeing him interviewed in the middle of the night last week on Fox and Friends. It was, he definitely said, hey, I got over it, you can kick it. So, inspiring. Nathan, do you want to go back?
That's my pleasure, and I'm happy to look into that.
Thank you.
Doctor.
Thank you.
Yes, recovering is great.
I don't know what else I had necessarily to share. I know we kind of jumped around a little bit. I would
We were
just,
talking about PPE, and
Yeah.
we'll
Yes.
switch gears here. So that partnership, making sure people have what they need day to day, is the best place to be, I would deduce, because at some point there'll be just that next shipment, Small or large shipment
Yeah.
is going to help, obviously, but getting people what they need day to day is the best plan. At this
and obviously, we're encouraging our partners to continue to look at other sources and try to buy the PPE through their normal channels, because we recognize that what we have is really a small fraction of what we could potentially need. I mean, the hospital's needs for PPE alone dwarf our cash supply. So I know the hospital worked over the weekend with State Department of Administrative Services as well as St. Charles and their buying group, trying to procure and acquire more additional PPE for them as well as for the county to be able to share with some of our smaller partners. But you know, it is probably one of the single greatest challenges of this event is sourcing high demand equipment and supplies. So we've been working really hard on it, and I would say in conversations with other counties, at least if as diligent, if not more so than the average. So I'm proud of the team that what we're doing.
So I want to know, we talked about ordering things about 3 weeks ago. What's the status of those orders? Do we have an ETA on anything that we ordered? And how many ventilators did Deschutes County order?
So Deschutes County ordered 30 ventilators. That includes 20 transport ventilators, which are operate on a high-pressure O2 system, so they don't require power, and then 10 more of a conventional style ventilator, which has a little bit more features. But the transport ventilators are do have your basic adjusting for tidal volume in pediatric or adult or and they're really designed mainly to be utilized in an ambulance during transport. But there's some evidence to suggest that for either patients that maybe don't need the higher level ventilator, or we get into a situation where we just don't have a choice, those are an option, and those are quite a bit. They were, at least the time when we ordered, they were quite a bit more available. I would say, I think at this point, nothing is available on the market. So I think we're supposed to get those shipments. I believe the date on those was April 11th.
That's this week.
Yeah. So, but having what we found out is, we ordered quite a bit of materials over Amazon, and Amazon paused all those deliveries. And so now we're having to go back and fill out more forms to ensure that we're a government agency supporting healthcare to be able to get those shipments on order, and then through other vendors. So it is, I'll tell you, it's the wild, wild west out there as far as getting personal protective equipment in general. The market out there is very volatile, and you have people outbidding others. And so that was one of the reasons why we were trying to act a little bit more nimbly, because the normal procurement process would be you'd go out, you'd find a vendor, you'd get a quote. Well, by the time you got through the process of getting that, the price had changed or it's no longer available. So we're hoping, initially our order was supposed to be for 10,000 N95 masks on Friday. I was told 10 to 12 days, and I don't have an updated on that other than that the mask style that we were getting, it was no longer available, so we're converting to a different style of mask, which we did test and actually worked great. So it's just, like I said, it's not the ideal circumstances for acquiring PPE or anything for that matter.
So, with regard to masks, are any requests being made by stores or restaurants to supply masks to their workers? Because a lot of people are still going to those places, and if people are asymptomatic or they're before they've got pre-symptomatic, I guess is the other word I've heard now, they may still be sick.
Yeah. I can tell you that we do not have any ability to supply those places. I would certainly encourage the organizations that are open, like the Targets and the Walmarts and even the grocery stores that might have their normal supply chains. They may actually be able to source those for their staff, and I think we would certainly encourage that. I think also the homemade mask, the guidance out from the CDC related to everyone wearing them, I think as that's rolling out, I think modeling that in the grocery store and modeling that with our retail establishments would probably be well advised. And I got a text update on the St. Charles negative test numbers, so
Oh, good.
looks like and this might actually be similar to what Dr. Fawcett gave. So I think we're at 492 cumulative negatives from St. Charles. But as Dr. Conway mentioned, St. Charles treats patients from multiple counties. And so initially that not noting what county that was that's kind of the going back and having to individually probably investigate each one of those. But now moving forward, everything from last week on, we are getting, so moving forward. So as we progress, our data will be a lot more accurate.
Okay, so if it's 492 from St. Charles, and he's saying.
I think we had 198 or 168.
Yeah, that were not from UW. The tricky part is that we have, as Dr. Fawcett, we have a number of negative tests that come in from Quest and LabCorp, in particular, some from the State Public Health Lab. Then from St. Charles, those negative tests are mainly Deschutes County residents, but not all of them. Some of them are coming from St. Charles Pineville, maybe from Mosaic Medical Clinic, I believe still using the St. Charles lab. So some of those 490 some odd negatives are not Deschutes County residents, so that needs to be sorted out as well.
Well, Dr. Fawcett, then, is that 492, or Nathan, if you know, is there more to come, or is that everybody they think is negative? I mean, not more to come.
I think what they have is probably up to date, and sorting out which of those 492 are Deschutes County residents is probably taking longer than it should. I don't think we're very far from the total, but we may be 100 off. If you add 492 to 100, and I think it's 190 non-UW tests, but then you have to subtract some, 10, 20 or something for Cook County, Jefferson County residents. So I think it's not I don't think it's 542. I think it probably actually is a bit higher. But that's something where we should be able to get those numbers pretty quickly. And as you mentioned, our task was to get this done as soon as possible. So we are 5 days from the last meeting now. But I think we're getting pretty close. And I'm happy to check with St. Charles and with Jenny and people at the health department, since I'm there every day anyway, to see how close we are.
Great. That'd be awesome.
Thank you.
I do think, I believe there is also a point on the, I think we're going to be updating a press release related to the mask guidance that I believe the commissioners were going to weigh in on. Yeah, so and I know that is timely. They're wanting to get that out by 11, so I don't know if you wanted to hear from Morgan on that.
We would.
Okay.
So you're done with yours then?
I think so, but I can stick around for questions.
Okay, thank you. Thanks, Nathan. Morgan, did you want to update the commissioners?
Sure. Hi, can you hear me okay?
Perfectly. Thank you.
Wonderful. And I'm sorry, did I understand that right, that you'd like me to discuss the information about the masking?
Yes.
First? Okay, wonderful. So in response to a number of public questions and the guidance that CDC and OHA issued, updating their guidance around masking and face covering, we have drafted a press release that I believe is available for you. Do you have copies in hand?
We do now.
Wonderful. So I was wondering if it would be possible to take this opportunity to review the draft and receive your feedback and answer any questions you may have for us.
That'd be fine. Thank you.
Thank you.
So did you want to go ahead? Or did you want us to, it's 4 pages.
Oh, I'm sorry. I thought you were reviewing it. Really the main things in here to get across are that the guidance has changed. And Dr. Conway did update one section on page 2, really stressing that the guidance in the beginning was to preserve masks, specifically N95 and surgical masks, so hospital grade masks for physicians and healthcare providers who must be treating infected individuals. And what we want the community to understand is the change in guidance, but also that this guidance is to protect other individuals. So if I'm wearing a mask, a face covering, the intent of that is to prevent me from spreading the infection if I am infected and am not showing symptoms. So it's not to prevent me from contracting the infection from an infected individual. So really just making sure that the public understands what these face coverings can and can't do, but also the importance of taking this new step to help protect our fellow community members from infection.
Okay, so we're talking about the public policy on this is, and I've heard this from the CDC since the start, but the fact is that the 3 ways you catch the disease are your eyes, your mouth, or your nose. And if you have your nose and your mouth covered most of the time when you're in public, you're less likely to get the germs from other people in your nose or your mouth. And that's simply true. And that's why people automatically do this, and they're doing it the rest of the state. So I don't know why we're being timid about this. It's good both ways. I don't agree with and lots of other people don't agree, that it's only outgoing germs that we're preventing. And there was a great article in editorial yesterday in the paper about how there are 4 reasons to wear masks, and a fourth, and that was included. So I don't know why we're trying to limit the value of it, because I don't think it's true. And so maybe we need to talk about this some more. Maybe we need to get this done in the afternoon. It's a 4-page document that we've just been given, but that's my take on the message.
Commissioner Henderson, Dr. Foster, just briefly, I think I tend to agree with what you said. I think part of why there's an emphasis on the community wearing masks, the type of non medical grade masks, it has to do with the fact that if you're in close contact with somebody who's infected, that perhaps the mask itself that is homemade or something is going to be more porous, and so could potentially then lead to transmission because it's not as reliable as say an N95. But that's a technical point. I mean, just because we're wearing a homemade mask, it doesn't mean that we should be getting really close to people and talking to them at the same time. So I think your point is I would agree with it. I just think these masks, of course, are not as reliable as, say, an N95 that maybe you might wear in the hospital.
So there's a proposal for this to be a press release midday today, right now, basically, or?
Yeah, and I apologize. I'll take the credit or the blame. I didn't realize that was on your agenda to review prior to it going out. So otherwise, we would have pushed that up a little higher priority. So, but ideally, we try to get these out at certain times of the day, and they were hoping to get it out by 11, which we're now behind that. But
Oh, we missed it.
yeah, I think the reality of it is earlier in the day that you can get these out, the more the better it allows not only our partners to be able to share that, but it is better for the news cycle to be able to get that information out to the public.
Well, and what I see is it's just the social norm or the culture of wearing a mask. I have seen it in Hawaii and trips and people in airports. I mean, you see it more and more these days. So it's just something that generally Americans have resisted or not accepted, or not that there's stigma behind it, but it just hasn't been across our community. So what I'm seeing here is kind of 3 different sections talking about the introduction of what and why, some specific bullet points about wearing the mask, and then also guidance about how to make these masks. So, with these 3 sections, I'm supportive of getting this word out. As I say, I don't have a mask for myself at this point. I'll make sure to start getting one just for those grocery store trips. And you do want to, give some confidence to the person at the register that you're thinking about your safety and their safety.
So I was at the 5 grocery stores this weekend, and so a lot of the older citizens are already doing it. Some are using other things, but I think it's beginning to grow like it has in other countries. There was an interesting article last night about Marty Lunan, the basketball player from Redmond whose dad runs the
Who used to live in
fair.
Bologna. Yes.
Anyway, yeah, and he came back to America, and that was his comment, that in Italy, where he'd been, everybody wore masks and gloves, and here he got in the airport in New York, there weren't. So I think it's important that we get it out, but I think it's important we get the message out, and I want to make sure we get it right. I don't want to say it doesn't help you, I mean, so I don't know if we just modify it here on the go, or we are reconvening it in the afternoon, where is there anything else we'd want to change, or any other emphasis we'd want to make? You know,
Actually, I was told that you need to wash them in hot water,
yeah,
and all the masks that, the people I know that are making them, they are to be washed in hot water. That was something that was suggested, and then they say on the third page, masks must be made from a washable material such as fabric. Well, okay, like cotton or something, I mean, just saying fabric, is that a good idea? I mean, shouldn't you, I mean, it's gotta be washable, a washable fabric instead of like
Yeah.
page 3. I just thought such as fabric, washable
It
fabric
doesn't say in
material.
here, it doesn't have to be hot water?
It just says to wash them, where does it say? A washing machine will suffice. It doesn't say hot water, and I honestly believe it needs to be hot.
I believe it too. I washed
Yeah.
my mask last night that way, and I think.
I think that, and maybe Dr. Foss could weigh into, or Dr. Conway, but I think probably hot water is advisable as a abundance of caution. But my understanding is that this particular virus, the lipid shell or whatever, actually degrades with the soap. So probably just washing it normally is probably okay. But I would certainly make them to be used with
That's
hot
fair.
washer and use hot water and when you wash it. But I think probably the drying of it is actually going to be hotter than the water in the washer. So.
You think so? Oh, you can always.
This is Morgan.
Yes, Morgan.
I just wanted to add that statement was directly copied from CDC guidance. Those Q&As are just pulled verbatim from what CDC released.
Okay, well, they've said a lot of things over the last 2 months, such as you don't need to wear a mask and, different things. So I just know that washing,
I'd be in favor of taking some time to look at this and getting out this afternoon. I think hot water is better than cold water, so why wouldn't we recommend people to do that? I mean, there's people that are in this is serious, grassroots effort that's going on, because people know they can't get the medical mask, they can't get, at the store, they can't get it from the normal provider. So there's quite an industry. If you read, there was 500 masks made by one entity. There's lots of people doing this, and you can see it when you're out. And I think we give them the best advice we can, not just.
and what if you sneeze into your mask? Okay, so we're talking about one virus, but what if you sneeze into your mask and you don't wash it where you killed those germs and they're not the other germs? You don't want to put that mask back on. So, there's a lot of bugs out there and a lot of people are allergic right now. So, thank you, Jennifer.
So I support this as written. I don't know that, I support the news cycle as the Joint Information Center is working. That's how I'm starting with this concept. If they've got a kind of a cycle and a little list of items that they want to get out to the community, midday is the time to do it, so it can be picked up by the news cycle. So I'm just hesitant to think we want to wait too long if we're looking at this.
Well, and I think I captured it. We can potentially address the one quote referencing the known effective. We could probably modify that to make that a little bit more. It's Dr. Conway's quote, so I'd want to be careful. But I think we can adjust that to be a little bit more inclusive of what you'd mentioned regarding it may protect the wearer as well.
Yeah.
I,
Sorry, but there's no science to back that statement at all.
Okay.
That's why it's cautiously parsed. This is again back to what Dr. Fauci and Dr. Birx have been saying publicly. There's been no systematic testing. The homemade masks can be very porous or not. So it's very clear that they can retain particles, but it's not clear that they will provide any measurable protection from droplets coming from someone else.
So with that statement, I support the highlighted words here. Crook, Deschutes, and Jefferson counties encourage residents to cover up in public. I mean, so I'm just trying to get to a point where this is, if we're taking time to approve it as a board,
Yeah.
showing support. I mean, do you really want to wordsmith it yet this afternoon, a couple hours from now?
Well, I like what Nathan suggested. I think Dr. Conway's very timid about what he says is true and isn't. And people know the difference, and that's why they do it. And so we can argue the science, but they're recommending it, the CDC. There's no need to clarify that it doesn't help you personally. That people are
So as
smart.
it's written is appropriate is my conclusion.
No, it's not written as appropriate, I don't think, and I don't think we need to include that. So,
Okay, on the third page, how does one safely sterilize or clean a cloth fabric covering? A washing machine should suffice and properly? No, it should be a hot or warm. I mean, you're way better off if you do, so many things you wear now are all cold water wash. You know, they shrink, they fade, they're all cold water. But I really think people need to get back to actually knowing that they're killing some germs. So that would be my one I would ask on page 3 that it would be either hot or warm.
But, I mean, when you get down to it, killing germs is different than destroying a virus. And if the virus is destroyed with just soap and water, no matter what the temperature.
I'm talking about you're
we're
putting
making
something back on your
statements.
face, Tony, that's, you've worn it and you might have sneezed into it or something else. You need to actually clean it before you put that back on your face, you know,
Which
for
is the
other
guidance,
things.
to wash it.
Washing-
Commissioners, if I could say something, just from my own opinion, I don't want to get too far away from what the CDC would be recommending, and I do absolutely value and respect your comments regarding some of the, some of the things that you've mentioned. My only concern as, serving you as your sheriff is if we get too far away from what the messaging is, we run into an issue with inconsistency in messaging. So I do absolutely value what we're talking about in the water temperature of trying to sanitize these masks, but there are some folks that may or may not have access to that type of a washing situation, and I believe what you're trying to do is trying to get more people to participate in it. If we can get this press release out and basically just let everyone know, hey, start wearing these masks like you mentioned, Commissioner. I don't know the exact science behind the masks like you mentioned. I would think that me using one of those masks might prevent some type of environmental situation where I wouldn't be exposed to something either. And our office is getting ready to roll these homemade masks out, and you'd be more than welcome to one as well, Commissioner. They've been donated to us, so that's my concern. I just wanted to weigh in just to, briefly on that.
well, I agree with what you're saying, but the CDC started out this whole pandemic saying you don't need masks.
True.
Then miraculously, a month into it, they decide, oh, they're wrong. So why wouldn't they, we don't know if that's going to happen. So I'm not at all afraid to say that we think it's a good idea. Now, that doesn't mean everybody's going to do it. As to whether hot water or cold water, I think hot water is preferred to wash anything. And so I would just put that
Maybe you have
language
the
in
answer
there.
there.
So,
Maybe preferred.
so-
You might.
yeah, I mean,
preferred.
this is all
Hot water.
better than the alternative stuff. So not washing it is not as good as washing it. Washing in hot water is better than washing in cold water. I mean, everything's like that. We should all get the N95, respirators. And, but since we don't all have that, we're going back to kind of grassroots self-protection is how I feel.
Right, and I totally appreciate that.
Dr. Fawcett did agree with that it would have some effect, so.
And I
we have a
do-
medical disagreement.
I do know you all know the world of politics as well, and as things roll out, and I know that this is something new and different. So the CDC, because I've watched the same updates and briefings you all have with the nation, and I do know that it's a fluid and dynamic situation,
And so I do respect that. And yeah, they have done an about face. Sorry, that thing's driving me crazy. They have done an about face on that. It's just that it's a dynamic situation, and we'll probably adjust some of our maneuvers. And now that we have the population down in the jail, there's some different things that we'll try as it unfolds. So, not trying to disagree with any of you. I'm just saying I get concerned if when our office is co-incident command at the Emergency Operations Center, I get concerned about consistency of messaging. I absolutely respect the fact that the commission oversees the Board of Public Health and not trying to be disrespectful. I just want to stay consistent in messaging.
Well, as someone who's been married to a physician for almost 35 years, he said to me, wash things in hot water. Now, he went to medical school, he practiced, he never got any kind of infections as an ENT until we had children. Because, you know, you're touching your kids, and that's where people get into trouble.
And they go to school.
Yeah, and they go to, and all those bugs. So I'm just saying, he's saying,
Right.
I don't know why we can't
I
have
don't
preferring
see
hot
why
water.
it hurts that we can say, users should consider using the warmest water available
Right.
to wash their masks.
Yeah,
That way it doesn't limit those that maybe for whatever reason, they don't have hot water in their house. We still want them to wash it with their, so I think we can add a sentence to that, which is not in defiance of CDC guidance, it's an additional.
Yeah.
I think it's an additional clarification.
Before, well, and Commissioner, I just want you to understand where I'm coming from on this. It's I agree totally and have a tremendous amount of respect for Dr. Bob. And so if we were to say something like preferred, I would be in line with that. It's just, I won't normally weigh in except when it has to do with our office. So I totally
Okay, well-
respect what you're all saying.
I bet you have hot water in your, the lunchroom, because we were in there. The lunchroom at the jail, remember everything that you're washing? And I bet you're there washing it in hot water.
Commissioner, please don't mistake what I'm saying. I have
Okay,
a tremendous amount of respect for what you're talking about. At the end of the day, I want to ensure the messaging is consistent and not too far off of the messaging that's already occurring. So I think the sergeant has a great suggestion and recommendation, and I'd ask you to consider that.
well, I'm fine with that, adding that. I just think it's,
And we can also change that fabric.
well, it just seems a little, should be made from washable fabric.
We can make, I think that's an easy
Yes.
adjustment to make. And I just want a point of order, and I'll let Dr. Conway weigh in. Kirk and Jefferson's already approved it, they're waiting on us apparently to send it out. So
Okay,
Well, you know, I just want to talk about this urgency thing. We didn't even know this was coming, so it comes up to a meeting, a 4-page draft that we've never seen before, and we're in the business of trying to communicate with the public. That's what we do. So we're the last ones to know, which is not unusual in our positions, but the fact that Crook and Jefferson did it already, who knows if anybody even asked any questions? Who knows whether they haven't had very many cases there. So I get what you're saying, but I think it's important to get it right. And
Oh, and I-
we weren't, I got 100 emails this weekend from people concerned about COVID things. I didn't get one saying, we're gonna do a message on Monday morning. Here's what we're thinking of, what do you think? So we're giving information on the run here about what we think should be in it. And I would move, we take out the paragraph that said it starts with the assumption at the time. The second one, Conway stressed, because I don't think it's important to have it in there. And then we do the additions that Commissioner Adair has talked about. But it's not, maybe this is as good as you want to get. I would also wonder about, there were, in the first one, the CDC now recommends, on the first page, wearing a cloth mask in public settings where other social distancing are difficult to maintain, such as grocery stores, workplaces, and interactions with others outside your home. Well, what about specifically restaurants? Because if you go to a drive-through restaurant, you'll often see the people that could be infected making your food, and they're handing it to you. And we're encouraging people to go to restaurants, but is that somewhere we should be encouraging people to use masks if they can get them?
Can you?
I think I would agree with that. Yeah.
I mean, usually they're wearing gloves, of course, but yeah, they're not wearing masks, because I do a lot of takeout.
Yeah, I think, and I apologize, Commissioner, the intent wasn't this to run urgency, to run you over with urgency. I think the urgency is that our folks in the JIC worked all weekend, basically, as the CDC guidance was coming in towards the end of the week, and their intent is to try to get this message out from local voices as soon as possible so that we're falling in step with the best guidance that we have from the federal government. I think and I think probably the reason why is I think we're taking an extra step here in bringing this to the board as opposed to, I believe in the other counties, the message was approved by the public health directors and didn't necessarily go to the board. So I think this is an extra step that we're going to include you in the messaging. And so that's probably
just
why.
in coming here, we've made 3 significant improvements in my mind. So I think your time hasn't been wasted asking our opinions on this, so.
Absolutely not.
And did you all get emailed this earlier? Did you get emailed this document earlier, or is this the
This is
first
the
time?
first time I've seen it.
Well, in the next time, can we make sure we just email it to them ahead of time?
Yeah,
Then
absolutely.
I'll give you extra time to digest it.
Well, if it was done, I'm just saying, really, and it's just a philosophy of mine, is that I don't care that we just got it at, whatever, 11 o'clock today, but that's when we start looking at it. So we need some time to think about it too, because this is seen as the messaging
I agree.
from the county, which is the health authority, and it's not the work product just of certain specific individuals, so
And
it's
just to
county.
paraphrase what the sergeant said, don't feel rushed like you have to have this out. Make sure that it's balanced and I've seen masks popping up, so
You can
if
just
it needs
note it-
to wait, it can wait.
Nathan, down below, it says, choose a fabric that can handle high temperatures and bleach without shrinking. So a lot of times you need to repeat these things so people get it, and that's why I'm saying.
I think, Commissioner, I think that's an excellent recommendation. I think that's something we can add to this messaging that would be consistent throughout the
It's
document.
consistent with the document, I
Absolutely,
believe.
absolutely. And thank you for catching that too, by the way.
Well, I am the queen of the laundry in my house. Who
I ruin the laundry, so I'm not.
I know you're not. Okay, yeah, I've heard that excuse. Oh, boy.
I'm sticking to it.
That was
So
in
do
the
we need a
manual.
motion then? Are we okay with that? Can you add it somewhere, the restaurants? Commissioner Henderson's point is really extremely well taken, that it would be good if you go in the restaurant that you have a mask on, but also that the people that are serving food have a mask on? Is that what we're talking about?
Yeah, and
I
actually,
mean-
that's a useful addition.
Okay, great.
I'll put it in the second paragraph.
Thank you so much.
Actually, I think I could point out the way
Tim,
that this typically works.
Yes, Morgan?
I just want to make sure that I captured everything that was discussed. So we're modifying and removing the comment about Conway stressed. We're adding information about restaurants. We're notating to consider using the warmest water available when laundering, and then adding additional information about what type of fabric to use. Is that accurate?
Well, you just have to change, that one line was kind of rather redundant. Masks should be made from washable fabric. That's what they have to be made of. They can't be made of plastic, they can't be made of metal, they have to be made of fabric that can actually, the line below it says, handle high temperatures. So,
Yes.
I just felt like that needed to be repeated. And then, yes, something we need to add about
Okay.
restaurants.
Okay, wonderful, thank you.
What you're saying, just to be specific, is the sentence is masks must be made from washable materials such as fabric, but not all fabric is washable. Isn't that true?
Well,
Like-
you're gonna go to mohair velvet or something?
I'm not suggesting anything, but that seemed like that's what you were saying.
Washable fabric, yeah, it's gotta be washable, and it's gotta be able to, take a high temperature.
So you could just add in the word washable, from washable fabric,
Yes.
washable materials such as washable fabric.
Yes.
Okay.
Yes, and I believe we can add, CDC gives the example of an old T-shirt or a bandana, so I will look at adding that as well for specific examples.
Right. I know, it was very
Well,
interesting.
they're wearing them. I saw them yesterday
Yeah.
in the stores.
In the market, people actually didn't have gloves on, but had masks on. Now, I've been told that really you need to have your gloves on, especially when you're handling like shopping carts and you're in the market. So it was kind of interesting. Some people had both, and then there are other people that just had one or the other. But yes, so and thank you for the people that are working in those markets, because they're doing a very critical job as far as getting the food actually to us to get on our table. So thank you very much.
Thank you.
So, okay, Morgan, did you have anything else?
Would you like any updates on metrics from the Joint Information Center?
Do you have any that we haven't heard yet? Sure.
I can update you. So the Deschutes County COVID-19 webpage has had 30,000 page views in the past week and 105,000 in the past month. Our daily case count report prepared by Dr. Faith, our epidemiologist, has just about 10,000 subscribers now. The Cohen Twitter in the past 28 days has had 102,000 impressions, and the Facebook has had 76,000. And the call center continues to answer calls from the community Monday through Friday, 8 a.m. to 6:30 p.m. And they're averaging around 150 calls a day. And the main themes of the call center continue to be questions around symptoms testing, what individuals should or shouldn't be doing around social distancing, mental health resources, and then of note, the questions about employer and employee do's and don'ts have decreased significantly. We believe that's because we've been putting out additional information around that. And those are our metric updates.
Right. So it sounds like we're having a lot of people following the information you're putting out there. Appreciate that.
Thank you.
Thank you. So Nathan, have you found out anything about our order that's supposed to come in on Friday?
No, sorry.
Well, you can look on your phone. Maybe they sent you a little. Okay, nothing? I was thinking like you were maybe we're going to find something really good news for us.
No,
to be able to share with our public.
I don't have anything for you. I'm just communicating some logistics around the messaging here. So.
Okay, all right, thank you. Is Nahat on the phone? Is he on today? Our new public health director?
Yes, Commissioner, I'm on the call.
Oh, you are? Okay, well, welcome. I'm sure you're very happy you're here and featured. Is there anything you would like to let us know that you've been made aware of since you've started your job, 3 days ago or something?
Thank you, Commissioner, for the opportunity. Actually, I only joined a few minutes ago because I've been in orientation all morning.
Okay.
So I caught the last bit of the excellent conversation. So at this point, I thank you for the opportunity, and I look forward to future interactions. Over.
Okay, great. Thank you very much. I'm glad you're doing your orientation so that you can really dig in and get to work then for our community. Hillary isn't on today, is she? Did we hear from Hillary? Did anybody? We were going to thank Hillary. I know she's staying on for a little bit, but she has served her 30 years with Deschutes County, Hillary Sorrentino, and she's, she's been an amazing leader for public health, and thank goodness she'll be hanging around because we're going to probably still need her.
I don't know if she's asked to be on our calls or not, but.
She was asked today.
Oh, she was, okay.
Sharon had asked her.
Oh, great. Well, yeah, I really appreciate what she's done and been a good leader and long-term service, so it's really been good. I've enjoyed working with her in public health, so been a strong advocate. And people don't see what goes on in our budget meetings, but I know since I've been here in the budget meetings, she's made good proposals and things we paid attention to. So public health is seen as a real important part of our responsibilities here. So thank you.
Yes, funding for public health had gone down, and Hillary really made us as commissioners aware of what was happening, and that was actually prior to our pandemic. So, thank you, Hillary, for taking all that time last year and explaining to us how important public health is and our responsibilities. So if you're not on the call today, I hope you hear these kind words and appreciative words of your many decades of service to Deschutes County.
I agree.
Thank you, Commissioner DeWoe. Okay, so Dr. Conway, did you have anything you needed to add this morning?
No, not really. I did answer a question that,
I think you need to be closer to it.
I did answer a question that Commissioner Henderson asked about testing and antibody testing, and the antibody tests using non-approved FDA regimens are not reportable to the state.
So yeah, I appreciate you responding back. So I'll give a little background. A doctor had approached me that had gotten a testing kits. She's ordered 500. She has 100 of them, and they're apparently they determine whether you have any what's it called, antibodies being developed in your body to fight the disease, which would indicate you had the disease either after it's over or while you're fighting, et cetera. What I guess I've learned, Dr. Conway, is that there's two companies that have been approved, something Shine and Henry Schein and something called Celex, that have been given a short-term. And so it's just a blood test, and you put it in I guess a chemical that indicates it. And then there's others that aren't. It's interesting that apparently some doctors are using this, but the official authorities aren't. And so is that kind of how you understand it as well?
I think the issue is more what the application of this test is. That the antibody tests, even Celex and the Shine, when Shine is a vendor for, are for antibodies, and antibodies are typically created within a person's body 7 to 10 days after active infection with this. So it's not an early diagnostic test such as the PCR tests. The main way that antibodies are seen to be likely used are either to follow to see whether or not healthcare workers have converted if they've been exposed but not symptomatic, and also for testing of large populations to see what the course of the viral infections are. But it's because it's a lagging indicator of infection, it's not regarded as suitable to catch infection early enough to prevent active transmission.
Yeah, so I kind of understand that, but what is interesting to me is that, so you have say this is the range of the start of a disease and the end of a disease. The start of the disease, the antibody test doesn't pick it up until your body starts fighting the disease. Then when you have the disease, it picks it up when you're fighting it and after you fought it. So this part of it, it does catch. So I'm wondering why there are people I know that have been very sick that couldn't get tested, that might want to know if they actually had it, which is the case in this particular doctor. She tested 2 people that are already recovered, she tested many, but 2 of them tested positive. So that does add to our information base. It's a different information base, but why wouldn't that be as relevant? I mean, it's just this part from the time they're fighting the disease till it's over, it catches those. We know it doesn't catch these, so why not do both if we can? Because apparently these are more available right now, and they're quick. You get the blood test and it's done. So
actually, I agree with basically what you said, and I think that this is another application, given that we have such a shortage of the more accurate, earlier clinical tests. So I don't disagree with that. My reply to you was about the notifiable disease statutes. And notifiable disease statutes do not accept tests that are acquired using an unlicensed test kit, that's all. Now these two,
well, I didn't realize that, just so you know. I didn't realize you were just commenting on that. So would it be good for us to encourage these kind of tests, or?
I actually don't know how OHA is interpreting the antibody. They've only become available in the last few days commercially, so I don't know whether or not they're going to modify or whether or not they have to modify the notifiable disease. But the specific thing we checked on was the person that contacted you and asked to report these, and OHA deemed that under the notifiable disease statutes, testing done, if it was, as it were, off license or for unlicensed kits, was not reportable. So it's just a fine point in the reporting process. The flip side is that if I were to be asked, is this a useful tool in containing the epidemic, I would say yes, especially if it's readily available when the other tests are not. The best test that we should have, and that unfortunately we don't have, and I honestly don't know why we don't have it at scale, would be either a more automated test for antigen than the PCR or a pure antigen test. But those did take a long time to develop for other viruses like HIV. So in the interim, I think that this is this is potentially very useful information. And you're correct that you could still have antibody. You could have antibody already at the time that you're still clinically ill. So it's better than no information. But once again, because it's a lagging indicator after people develop illness or after they've been exposed 7 to 10 days post taking the virus into their body, it's not the ideal way of detecting it because it's not early.
But I thought part of the problem of this pandemic is the fact that a lot of people can walk around and they don't even have any symptoms.
I wholeheartedly agree. And as I said, had I been asked that question, I think this is a very useful tool. And actually, I spent a lot of the weekend discussing this and serosurveillance with OHA.
Okay, I don't know what, I mean, I'd have to read my email, but I wasn't really asking a very limited question. I was really asking, is this, you had told us about needing more testing, and we've, as lay people, we're trying to help with that. And so I'm saying, is this something that might work? Part of the answer would be yes, but we can't report to OHA. Then we have to decide, well, do we want to encourage it anyway? Because the impression that I know this doctor's gotten is that the county is not interested in that testing.
Excellent.
So that's what I've been communicated. So it's just a communication thing, so maybe we should have talked about it. I didn't know that.
I thought I was answering the question asked, which was, that we were asked, the person that provided this information to you asked if they could report this, and I was providing the rationale for or answering that, which has to do with notifiable diseases. Now, as far as a broader application for this, what I'd have to say is that it's less than ideal, but it's better than nothing, and that's, I think that we have to adapt to it.
Let me add to it, if I could, Dr. Foster. I just wanted to say I was on a conference call last week with the state regarding testing. I think the overall message, strong message, is that we need more testing in every part of the state. So that really is encouraged, but we just need testing that's licensed, that's approved. That's the key here. This was not an approved test, and Dr. Conway was able to decipher that very clearly when we met last week, George. And so we need more testing. We just need testing that we can rely on in terms of its accuracy and vetting.
I think the other thing that's happened is there's been a lot of recommendations brought out based on the ostensible or promised availability of different kinds of testing, and then it didn't materialize. So I think that what authorities are doing now is they're waiting to see what's actually available before recommending something that's just going to disappoint everybody because it hasn't materialized. Thanks.
Thank you. Thank you, Dr. Conway. Okay, Sheriff Nelson, did you want to say anything else?
No, I was just here for the, my understanding you were going to discuss community events possibly.
Yes, we are. First, we need to follow up on discussion of order number 2020-017. Dave, are you available?
Yes, Commissioners, I'm here.
Okay.
in response to some of the input that the board received in the aftermath of adopting 2020-017, I did have communications with a couple of the chiefs, Black Butte and Sun River, and also with our district attorney, John Hummel, and we have drafted for you I believe it's they identified it as 2020-018, but I'm being told that number's taken. It would have to be 021. But in any event, we've drafted an additional order that speaks to enforcement of the initial order and specifies a path whereby the district attorney, in conjunction with law enforcement, would be able to prosecute violations as criminal infractions or criminal misdemeanors, actually, and also identifies with some more specificity the civil code enforcement process and what the potential fines could be and who they could be directed at. And that was sent to you folks on Friday. So I hope you have it down there. If not, I can have somebody run some copies down to you.
I believe we all have it. Thank you very much.
A lot of, there's some citizens out there very much looking for this. We saw some email traffic this weekend, some specific rentals that are happening still. I know that we had a discussion after our first order about fractional ownership, townhomes, and I really appreciate the fact that, I guess, working from the DA to the public safety to people on the ground, having somebody be able to call and say, please look into this, because that's the scenario that we got right away. Right after we put this in place, we had people contacting us saying, well, I want somebody to go do something over there, which is probably pretty awkward for public safety also, especially in this environment where who's got masks and some protective equipment, or who's going to keep our social distancing, even though that it's a home rental, different versions of companies renting. We've heard from the community, some of the business players saying that the phones have stopped ringing, but of course there's always going to be somebody going to take it a little far, and it sounds like there might have been a party in Sun River at a house this last weekend, which we sure heard about. So I'm just laying out kind of the scenario as we've seen it. But yeah, knowing that the district attorney, and thank you very much, Dave, for bringing this back to, the public health emergency from the governor's order is what we're tracing this to. The fact that it's a violation, if it can be determined to be a violation.
Dave, you mentioned that you had met with John Hummel and Black Butte Ranch, and who was the other person? I'm sorry, I missed that.
Chief Darling from Sun River called me, as did Chief Kelly from Black Butte Ranch, and then I reached out to District Attorney Hummel.
Okay, thank you.
So I guess there's several parts to what Dave's created here. One is why we have the right to do it. That's kind of number one. Second is what the penalties are going to be. And then the third is when it goes into effect. So I had a conversation with Chief Darling this morning. Haven't talked really with Sheriff Nelson, who you're responsible at Eagle Crest, aren't you? Yes. Yeah. So those have been the two main ones we've been besieged with comments, and it's hard to sort through them all because we got a lot this weekend. One individual sent, I think, 12 to us, and it's good to get that, but it's hard to sort through all the concerns. But one of the things I think is important is to know who is over, how much of a problem it is at these resorts, who's doing it. What Chief Darling communicated to me was that most of the local property management companies, rental companies, are on top of this, but there's still the capacity, I think, to do out-of-area rental companies that rent houses from individuals in Sun River, Eagle Crest, wherever. So one would be is how do we get that notice out? Whatever we're going to do, how do we get notice to them? And then I suggested to him, well, why don't we get the assessor's office to get the property owners' information so we can do a mass mailing. And I don't know if the assessor has emails or phone numbers, but apparently it's limited to certain identifiable houses seem to be busy or changing. So maybe we could specifically call those owners if we have that. But I think whatever we do, we're going to have to give notice to people that they might be facing a penalty, Because if you live in Seattle and own a house down here and have rented it for 10 years, and you may not even know this is is a policy, and so that would be an issue of the violations. But the other question is, what is this amount? And then the second would be, do you treat the renters the same as the owners? Is the renter, I live somewhere else, I decide I want to go to Sun River, I have no idea about Sun River except I see it's pretty and it's spring, and how would I know that it's a violation for me to rent a unit? So I guess I look at it, it's more the homeowner's problem than it is really the renters, and so that's a thought I have. So those are some comments, just random comments, but there's a lot to this if we go into an enforcement mechanism.
Yes, $500 on both sides, the renter and the owner.
But should both get the penalty? Do we want to start that policy? Do we need to make sure we give notice to people that this is,
And Commissioner, to your point, I always think it's a good idea to give notice where you can or educate. And what our office is doing in line with the governor's guidance through the State Sheriff's Association was focus on education and voluntary compliance, and no strict focus on enforcement. And we all know there are some folks that just are not going to have a regard for the rules. We're lucky that that's a smaller number of people, and it is good to be able to have a consequence there if folks aren't going to follow the rules. But I think that would be in line with starting the education, and then as these occurrences pop up, our office, of course, will respond to every call for service. And I know I talked to the chief, and his office does the same. So we could go out there and try and take care of that issue or concern, because we'll go to every call for service. And if you get those emails at the time, please feel free, forward them, call me up. I'll get them forwarded to our office and make sure they've also called the non-emergency 911, because sometimes those folks don't have it full circle. We want to make sure we get called at the time to catch those folks when they're doing that type of behavior.
Sheriff, could you give that non-emergency number right now?
Sure, 541-693-6911.
Okay, 541-693-6911. That is the non-emergency. Thank you very much.
You're welcome.
So I wonder if it'd be possible to have, you have a lot of deputies, have somebody that are identified people that are become kind of the short-term experts on dealing with these, or is that what you're doing now? Is it hard to, it'd be nice to, I think I know talking to Chief Darling, who spends his time in Sun River, he said his officers could literally tell you which houses. I said, well, that'd be a good place to go get a hold of the homeowners. That may be true in Eagle Crest. I don't know if Pronghorn or Tethro have any of this going on, but any of the ones that would be in your jurisdiction.
If you give us a little guidance, we'll look into that. I'll talk to my teammates and we'll see what we can do in that arena.
I had a call today from the Inn of the Seventh Mountain in that neighborhood. I think it's Kangaroo Loop. Does that sound correct?
Okay.
Anyway, there are a lot of rentals on that street.
Yes, give us a call, because then we can start doing some proactive patrols out there and driving through the area and seeing what we see or hear.
And making our citizens feel more comfortable that, their health and safety
Correct.
is being respected.
Correct.
And is this the number that citizens could call to further, if they think there's a overnight rental going on 3 houses down, they could call this number, the 541-693-6911, and that would be something that, if it's in your jurisdiction, you would look into. If it's
Yes, we'll go to every call for service, and we would, in law enforcement, we approach some of these things a little bit delicately and make sure we have reasonable suspicion or probable cause to do some certain things. So, but if they are having some just absolute issues, we want the calls so we can go in and take care of those issues.
So Tom, I'd asked Chief Darling that he was going to talk to James Lewis anyway, so about this kind of messaging and things about how to get the message out. And so I don't know if he was gonna ask James to call Scott, about what information does the assessor's office have, you know, and because James is familiar with us, it's probably easy to do, but I think that'd be a good thing for us to do, to see what the capacity would be to notify people. I mean, I'm concerned with notification in part because, one, we've encouraged tourism and recreation use of our communities forever. It's a lot of our income, so we don't want people to feel badly treated. Just, I want to be kind of professional but firm is what my view.
Commissioner, I understand what you're saying. That's like, to put a little bit more detail in what you'd mentioned before, it's, from our office's standpoint, if someone is renting a unit and doing appropriate social distancing, I understand very much the spirit of the law versus the letter of the law. And so what I would really like folks to let us know about is if there's no compliance with social distancing, like a very loud, obnoxious, drunken party, and it's putting our citizens or neighbors at risk, and so that's the type of thing that I'm talking about. So I very much understand what you're saying, that, hey, if they're, you know, if they're not a major issue against the executive order, I completely respect and understand what you're saying.
Commissioners, if I could speak to notification, it's obviously a great point. There may be a way to get even a quicker direct communication with the renters through our TRT registry. We have records of people who pay TRT, who are transient lodging tax, the room tax, and that we could communicate with more directly. I know on Friday, Greg Munn, that's housed in our finance department, as you all know, forwarded the order that you passed last week to the big operators, to the VRBOs, to the Vicassas, where they have a direct relationship with the property owner and rent on their behalf. In that case, it's a little more difficult to communicate directly with the property owner. However, we've asked for the cooperation of the big boys who rent on behalf of owners for their cooperation in this. So we will follow up. I'm not sure that we have phone numbers or emails for within our assessment database. We'll certainly check if we do, but if there's a way that we can kind of target the ones who are renters as opposed to all property owners in the rural county, we'll look into doing that and try and be as efficient and quick as we can.
Well, and I don't know how many lots it is, but I mean, it could be a letter to every, I mean, we have the addresses of the owners of each lot in Sun River, so we could do a letter if we can't do emails or whatever. It's, I mean, that wouldn't, I mean, just a professional letter saying, in case you don't know, this has been passed in Deschutes County. It went into effect last week. Here's the, penalties that are coming. People have, most of these houses are substantial investments for people, so they would be, receptive to that in terms of wanting to hear it, I think. You're saying you don't think we have email or phone numbers at the county, at the property?
I'm not aware that we do. We'll check into that quickly, and again, with the idea of getting this word out quickly, but we may, like I said, it may be faster to work directly through our TRT registry on those who rent themselves and through the rental management companies to at least put them on notice, deliver that notice, exactly what the order says.
Excellent. Thank you, Tom.
So what does everybody think about the amount of the fine and then fining both the occupant and the owner, or creating the right to do that? It sounds like we're not automatically instituted against everybody. I mean, in other words, the sheriff's not. In Rhode Island, what I read the story was that they were going door to door, arresting people, New Yorkers that were in Rhode Island doing, with overnight rentals. And I don't think we want to do that. if we can talk people to go home, and that's what I guess happened on that Tournament 14 house, was the people did check out and went home. I mean, they responded to where they were asked to do, so.
We want them to come back when it's
Yeah.
safe.
Right.
Yes, so we really need to be polite, but, we're just following what our governor has ordered.
Well, I think we're very blessed to be in the situation that we are at this point. If things change, then maybe the commission has a different priority if things were to not be looking as hopeful.
Well, yeah, as I say, I want to thank, our legal counsel for putting this together, making all those connections, really tracing back to, okay, how do we map a violation to the current system? And that's what this states, because we really have this authority now. I mean, if an officer was like, okay, well, shelter-in-place order, public health law, here it is. This is the paragraph that could be cited now here in Deschutes County. So I do support that. And then code enforcement, if that's going to be a slowly escalating system, we all understand that, education first, cure the violation, and move forward. So just having this written up is valuable there also. As I say, I don't know that we would see that being utilized, but seeing it on paper as a property owner sure helps to understand what we are serious, and we can go there if we need to. So I support both those clauses, and this is basically adding, more teeth to that first order. I guess this is amending that order officially is what this is.
Do you support both the renter and the homeowner being possibly fined?
Yeah, so is that in words somewhere?
That's how it's and
Where?
it's 500 per day up to each adult maintaining the occupancy and also imposed on the adult owning the house.
Yeah, okay.
So that's pretty heavy, don't you think?
And one option there, commissioners, would be, and we had talked about that at the staff level, the first clause in that section indicates may be enforced by these civil penalties. And so arguably that makes it somewhat discretionary, but you could definitely clarify that by having it read and or imposed against each owner, so that it would be imposed by a penalty of $500 against each adult maintaining occupancy and or against each adult vested in ownership.
So who exercises the discretion?
Yes.
In that case, it would be code enforcement.
Oh, gosh.
Yeah, I mean,
And I suspect that would have a component of education to it as well. I don't know if Nick's on the line, but his code enforcement folks, always try to get voluntary compliance first. And, code enforcement is a relatively long, drawn-out process, certainly compared to any type of criminal prosecution. So, and typically they're very successful in getting that type of compliance.
and I support.
This is Nick Lelak. Yes, that's correct.
Thank you, Nick.
I support those words in there because that's a scenario somebody would have to aggressively work for and hold on to if we got to that point where somebody's staying in a house and the property owner's been notified and they're not asking them to leave. So I support that.
Well, so what was the decision that was made to do it through county code enforcement rather than through through the law enforcement agencies?
Commissioner, we could enforce that.
Actually, we have both. So the number one would be the process for law enforcement that would then channel through to the district attorney. And item two would be the civil code enforcement process.
I just think it's really important to give notice to people, and I like what you were saying, Tom, that we can tell the big players, the rental market, this needs to go to them as soon as it's signed, so that they know, or a nice cover letter or something, but if they weren't aware that we were really trying to keep our rural community, the unincorporated part of Deschutes County, following the orders. So I think notice is critical.
So what about including after, may be imposed against each adult in violation, and also, after notice of violation or something? Should they have a right to be notified first before you could do that? The other side about, well, we're gonna do this education, but as soon as we pass this order, there are people wanting just to act on the order. The people we're saying could be liable, particularly the owners, are substantial participants in our economy, even though they don't live here. I mean, they, particularly with regard to the county, they pay a lot of taxes, so it's really as important to notify them as the rental agencies. I don't know, a couple different thoughts there. What should we be giving? Should we have the word after notice, or, and I don't know what Nick's thinking he would do. Is he sending somebody out, or is the sheriff calling county code enforcement to go out, or is the sheriff going, deputies going out, or how's that gonna work?
As far as the sheriff's office concerned, Commissioner, more often than not, we get called to loud parties, is how this would start. And so there might be a time when we'd take enforcement action if we were in an MIP situation or a furnishing situation. But as it goes toward this particular order, we would try and do the education and voluntary compliance in most cases, rather than moving right to enforcement.
Nick, what do you think about that? Thanks for clarification.
We haven't discussed the logistics yet of what our role is, but we're ready to assist however the sheriff's department would like. We can utilize all of our contacts, but I think Tom and others have better contacts for notifying everybody about what the enforcement actions are. But we just haven't discussed the logistics. We stand ready to help in any way.
I like adding that and or, because maybe, depending on the situation, do both sides of the transaction need to be penalized?
So I had to build a house that had 3 couples owned the house, and there's all adults, so that would be 6 people have a vested interest, I think, in the house, and it's in the Sun River Caldera area. So would that be $3,000 a penalty per day?
That certainly could happen in that scenario, yes.
You're saying for the people that own the house, then?
Yeah,
all 6 of them.
I mean, yeah.
Rented it out to somebody else.
Which they have done historically, because that's
That's what we do.
real common, yeah. So some people might pay.
No, I'm sorry, I was going to say, I think in practice, on the ones that would, the civil enforcement piece, that would funnel through either a county hearings officer or the circuit court. And I think in either instance, certainly the folks with ownership interests, would have a pretty good argument to make that it probably would be excessive for a $3,000 daily fine. Could be the hearings officer or the court would break the 500 amongst 6 of them. There's generally a lot of discretion that decision maker is going to exercise in that scenario. This is giving you the stick to kind of get some level of compliance, and those very few that don't typically play nice, that it's going to be a factor for the hearings officer or the judge to decide, at least through the civil code enforcement process, what type of fine to issue based on the type of conduct.
Commissioners, if I could offer a suggestion.
Sure.
The code enforcement and community development in the sheriff's office already work very closely on the cases that CDD collects. The sheriff's office is the enforcement arm in terms of delivering a citation, in some cases other documents related to a case. But So I don't want to get too far in front of them, but one idea is, since you've got provisions in this order for both renters and owners, that a logical sort of demarcation would be for the sheriff's office to respond to a complaint for a renter occupying a unit, deliver the education, the warning, whatever is appropriate from the sheriff's perspective. But then CDD could be sort of the backup in terms of the owner, that they can send their sort of a modified version of a notice of violation to the property owner, and this is where the normal collaboration between the sheriff's office and CDD could come into play, whether it's a repeat, say, call where they're there and now it's time to involve the owner, or CDD could do that sort of that lift behind the scenes in collaboration with the sheriff's office, or as a sort of an automatic notice, that there was a renter in their unit in violation of the order along those lines, but then leave kind of the mechanical or the logistical details between those two entities on that coordination aspect of it. But that kind of covers both ends and provides you a path, particularly, as I said, with those that may be repeat incidents that the sheriff's obligated to respond to.
Did you have any?
So, just acknowledging that, we're here with this proposed order. It would be done under emergency and go into enforcement as soon as we take this action. So this is, once again, that scenario where we're, not really doing a public hearing. We're, reaching out to public safety, Black Butte Ranch, Sun River. Thanks for representing Eagle Crest. And hopefully this is just going to be in place for 6 weeks, because the next thing is, some people are going to want it to be in place even longer because, maybe it's still out there. So there's going to be a day of reckoning when we get some community public pressure for, well, let's keep that in place so I don't have to worry about what's being rented next to me. So I'm just thinking the next step is going to be interesting also.
Yes, this is till May 15th.
Mm-hmm. And if we've lowered a spike and, if it's 18 months before we have a vaccine or something, we're going to have some residents that are going to want us to keep it there this whole time. So I'm just saying there's implications about what we're doing, and there's going to be future decisions also. And I'm supportive of this. I'm just referring to the date that it's going to expire. If we put all this in place, what's going to be following on?
I would like to add that one or on item 2. I would hope that we wouldn't get there, but I feel like, you'll know, you go and you have the education with the renter and you explain to them what the situation is, and hopefully they understand. And then, you've got the owner, and maybe the renter says, well, I'm staying here, I'm one of those people that I don't care what you're saying, I'm staying here, I already rented it. But then the owner is like, oh, they're so, they're trying to do their best. So I think we need to be respectful of both sides of the equation.
Yeah, I'm fine with giving that flexibility that, I guess the renters could be the one that gets charged with the violation, but not the owner because the owner didn't know about it, or vice versa. I'm still having trouble with the idea that each adult vested in ownership and each adult maintaining it. So there was, at the house at Tournament, apparently there was 16 people or something staying there, what we heard, and so that's $8,000 a day of penalties. I guess I don't know. I always think about how we keep our economy strong in the long run, and so there is, I know there's a call now for people to be eliminated or from these overnight rentals, and we've done that with the policy, but I also don't want to create a punishing scenario where people say, well, we're just not going to go visit there, and people decide things like that. I mean, I thought about that when Tillamook County did it. Would that make people decide to go to Newport instead? just as, well, I remember when I tried to go to Tillamook, and I got fined, and then I had to go through this whole process. I finally got it resolved, but I'm never going back there again. So
Exactly.
we don't want that, I don't think, here as a policy, so,
Can you set a maximum fine?
yeah, maybe, well, that'd be an idea, yeah, just put a maximum fine, or, I don't know, I'd look to legal counsel to come up with something.
Yes.
This is Nick. If I can just offer, in CDD, our maximum daily fine for a property, regardless of how many violations it may have, is $2,000.
Magic number just popped right out.
Maximum, and so are you saying that on both sides of it, it would be 1,000? Because I'm saying and/or, so are you saying 1,000 for the renter side and 1,000 for the owners then? How would you look at this, Nick?
That's a good question. I was just in terms of $2,000 a day for the property. We haven't been to that level of detail, but certainly that makes sense. 1,000 each, sure.
And I would hate to even have to charge that. But that's a lot better than.
And we rarely.
Is there any, Commissioner Anderson, are you?
I like that idea of the, $1,000 on either side and, 2,000 maximum. I do think, I don't know if there's rentals that go for more than 1,000, there might be, but 1,000 is enough that it would make an impact on either side, I think. There wouldn't be many people that would blatantly violate that. I don't know, maybe 16 people would do it, pony up. Well, there's our rent and here's our penalty we're gonna find. But we want, something that's effective. So I'd suggest that be rewritten. The other thing I wonder about is this issue of going effective immediately. I mean, so that puts, again, homeowners that have spent, a lot of money in these properties could be immediately in violation of something they never knew about. So is there some kind of a grace period where we try to get the word out further that not only did we prohibit it last week, this week we put a fine on it?
And it is.
There's hundreds of
For
millions of
public-
dollars.
Public schools, this is their vacation time.
Mhm.
And what if they've already rented that house to bring their family here, from Portland, wherever?
Yeah,
Yeah.
we have had some emails like that.
Yes.
Well, both of these provisions, though, basically could be concluded today. Is this correct, Dave? As in, if an officer was out there and there's just a really bad situation and Nick Lilac and code enforcement was called, both of these tools are available today. We're just kind of documenting with the DA's buy-in, the fact that, oh yeah, this is the path as defined so the world can see it.
Yeah, that's correct. I believe the code enforcement piece, without a specificity of a dollar penalty, is inherent in the county's emergency order. I believe that the path for law enforcement and criminal prosecution is also there, but this language that Mr. Hummel provided makes that crystal clear, so there's no doubt or challenge on the backside to that. So it could very well be we're already there. I believe we are, but this takes that away and adds a little more specificity on the fine piece. I did work up what I think I heard the commissioners indicating on the code enforcement piece. I could read that to you right now if you would like.
Please do.
Okay, so now item number 2 there would read, in addition to enforcement as authorized by section 1 above, violations of BOCC Order 2020-017 may be enforced by actions instituted by county code enforcement process, providing a daily civil penalty of up to $1,000 per day, imposed incrementally against each adult maintaining occupancy in violation of Order 2020-017, and or also imposed incrementally against each adult vested with any ownership interest other than a security interest in the subject housing unit.
Great.
Any questions?
I think that that reads good. It puts a cap. It's gonna look like we just raised the penalty from 500 to 1,000.
Yes.
But, which really wasn't my intent, but we're really saying it,
Usually, it isn't an individual, so it's usually two anyways, at least, two people.
yeah.
So I was getting back to the fact that, should we put another date other than immediate?
Yeah. Well, so you may have felt that this has been in place all along, council, but I voted yes on this, and I had no idea there was a penalty in place. I thought that was why we put that one whereas in there. So if we didn't know it here as the authors of it, I'm pretty sure that the owners out there and the renters didn't know it, that there was a penalty risk. So so I'm in favor of some kind of a delay. But I don't know how long, because we're trying to get compliance. But these people have invested a lot of money in these places, and they're not gonna be happy if they get a fine of something they've never heard of. Because they've been through to get one of these houses, you have to go through a lot of process, and they know a lot about these properties, so I don't know if it's Friday or Monday, or maybe Friday, I don't know.
Well, if you put a letter out, and you say it might take a week for everybody to get the letter, and we, of course, are gonna focus heavily on education to any loud party or ruckus type calls we get called to, outside of the normal course of holding them accountable for whatever they're doing. So if you send the letter out and you have that education piece, you could make it effective. And I don't know how far in advance folks have to cancel these rentals, or what the normal rate is for canceling the rentals.
Well, there's people that want us to cancel go just kick people out today. I mean, that's really what and I just think.
And I understand that.
That's challenging.
Right, I do understand that.
Or it could be that, I don't know, a limit on the violation. I don't know. Dave, do you have any suggestions on this?
Really within the full discretion of the board on how soon you want it to be effective. You could change effective immediately, indicate it's effective at 12:01 a.m. on blank date, and you fill in the date. I will say, I think on the issue of, the concern of catching people blindsided, I'm confident that law enforcement and code enforcement are going to, make an effort to inform people and educate people first. And I think the overwhelming majority are going to comply when confronted in that manner. The one or two that might not comply immediately would be the ones that these enforcement mechanisms would address. At least that's my take. I know the sheriff, obviously, he and his folks, can weigh in, and Nick can likewise for code enforcement. But that's sort of my anecdotal observation. And again, if the board wants to provide a date, we'll plug that date into this order and can get it down there for your signature immediately.
Well, Friday's the 10th, and Monday is the 13th. So do we give them, till Friday? I mean, so let's say somebody's rented a house in Sun River, they're driving down from, let's say Kirkland, right? Washington, and they have no idea that we have shut it down here. Is that enough time for them to find out? Probably. If that letter goes out to the rental agencies of our community, they need to be notified so they don't
Do you have
spend 5 hours driving here.
Scott on a text or on a phone? Can you text Scott and ask him what his capacity is to identify the property owners? I mean, there's thousands of them in this, that come under this, but.
Well, yeah, I can ask Scott. I mean, all Scott would have would just be a database of the rural property owners.
That's what I mean, though. But that's the ones we would send a notice to, wouldn't it?
And that would be expensive, because, we do the same thing once a year with the tax bills, and it's pretty spendy. What I was.
Like 10,000 expended, it's over 100,000.
Tens of thousands, I would guess, but I can ask Scott to participate. What I was suggesting was a more targeted approach, where we just go do the TRT.
I get that, but if I'm an owner of an $800,000 house, and you tell me that, well, you tried to notify me through the rental agency, but it turned out I didn't use a rental agency that's on our list or something, or whatever, I would be mad that no effort was made to notify me. So that's all I'm saying. So I guess it's, do we have a database? How much would it cost to do a mailing? The whole thing would be worth looking at, because this is an extreme measure. We're telling people they can't rent their properties that they may have been renting for many years. It's, I don't know. I guess I'd just like to know how much it would be.
And actually, that would be Greg, who's the tax collector, that the tax office mails out the statements each year, so, I can,
I don't know who has it. I was just,
jump on it if he's not watching already and hearing.
Okay.
Commissioners, this is Greg Munn. I'm on the line.
Thank you.
Have you been listening to the whole discussion, Greg?
Yes, I have.
So, a couple of questions there in terms of the cost to do a mailing to rural property owners, and also the possibilities with respect to notification through our TRT database, either to individuals or the big rental companies.
yeah, and I do a subset of those in resorts versus those generally, or, pick the areas where the most of the rentals are. There's probably a lot of neighborhoods you wouldn't have to do very many, and there's some that you would. So I guess, do the most likely first, and if I was designing a mailing, because maybe we only need to do half of what is actually a rural property. A lot of rural property owners on 80 acres probably aren't renting their house out. And they probably would know.
Who's next door and watching, and how much enforcement that neighbor might want. So I gotta be careful about that. Fair and equitable distribution of information.
Yeah, I agree with that, but if somebody has an 80-acre parcel, they're less likely maybe to be complained about than in the resort.
We don't wanna give staff, here's a marker, and decide where you wanna send this. That is just kind of a.
So you'd rather pay for an entire mailing or
No,
not?
I would support transient room tax notification back, and then, please notify your property owner if there's any questions, or have your property attorney call if you have any questions.
We should have legally been getting transient room taxes from these rental homes,
Yeah.
correct? We should have been. So, that's, if it makes sense then, those people we should have access to them just by them paying the room tax on some level, should we not?
We should, except for the rental companies, the Vicasas, the VRBOs.
But if we send the information to them, they can distribute it to the applicable owners.
My thinking.
Yeah.
And then the next step here is, let's do this in partnership, because the next step is how are we gonna get everybody back online? Or are we really, are we gonna see a change in this whole industry for a long term? Because some of those properties, if they're rented out, to cover the bills, or if somebody, because we've already heard somebody contact us, said, please shut it down officially so I can apply to my insurance company to get reimbursed for the loss of revenue. So
Right.
I'm just saying, the next step there is gonna be how long, when can we get back online as in partnership to make the money flow? That's the whole economy, obviously.
Another part of this, if we want to look at mailing, that maybe it'd be worth looking at, is for somebody decided to send us all we got postcards in the mail. I assume everyone got them, because I don't know why I got them, but of what you're supposed to do with the COVID-19 crisis. Anybody get those in the mail?
Government?
Maybe it was from the federal
was the
government, but
federal
somebody,
government.
but that may be a lot cheaper than doing letters. It might be 5 cents instead of 15 cents, or whatever so that'd be another simple way to do it, is, in case you don't know it, we've passed, this is in effect, so, anyway.
We did the postcards like that for the judges, that we had people, and the office just made these cute little postcards, and they were mailed out, so.
Is it cheaper?
It was, I put a full stamp on it, but other than that, I'm sure there's a cheaper way for postage, but then usually that postage takes too long. We really want this notification out like yesterday, or last Friday. so people know, and if they've rented out their homes for Easter weekend, it's, and our weather's what, it's supposed to be 70 degrees this week, by the end of the week? So it's going to be phenomenal weather here. And people will want to be here. I don't know. So, decision, do you want it effective Friday, the 10th, or do you want it effective the 13th, a week from today?
Oh, I support immediately.
You support immediately, okay. Commissioner Henderson, what do you think?
I don't know if the 10th is any better than, or the 13th is any better than today. I guess I'm inclined to do effective immediately as long as we, do the enforcement the way we've talked about it with law enforcement, that we're not looking for opportunities to find violations and we're doing education. I don't know how it'll be received, but I don't know that there's a, I don't know if things are gonna go up or down as risks this week or what, but.
And Commissioner, I can tell you, we'll be out there and enforcing in the spirit of what you all intended. You're intending this for the troublemakers that are coming here as a way to be able to keep the peace and help keep that social distancing going forward. So we're not going to be going out there and citing and arresting or being heavy-handed about it. It's going to be about education.
Please don't take them to jail, right?
And correct.
Where you're trying to get rid of
Correct.
people in the jail?
Exactly.
And you take these. No,
Correct,
that doesn't make
Commissioner.
sense.
And so we will approach it from education and voluntary compliance.
Well, this is also a tool for that concerned individual with some activity in their neighborhood. Well, okay, what's going on over here? Gives you a reason to have that conversation for both parties to be able to say, okay, if it's not following some standards and rules, there could be enforcement. So it's for the neighborhoods also.
Right.
So do we have a motion then for this?
Sure, yeah. I'll move approval of order number 2020-21, is it now?
Correct.
An order amending order 2020-17 regarding prohibition of tourist travel and lodging within unincorporated Deschutes County, effective upon passage.
Effective immediately.
Yep.
Okay.
And you're making that motion to, as
With-
amended.
As
Yeah,
amended.
so some words that we had changed, yes.
Yes.
Dave's paragraph, item 2.
Okay, I'll second that.
Any further discussion? Commissioner DeBonne?
Yes.
Commissioner Henderson?
Yes.
Okay. Chair votes yes.
If you had an issue with it, you should have, you should
No,
have
I
said
just
what
feel,
you're-
I just think about the people that have owned the home, and they deserve as much respectful notification as possible, so.
Which is what I was saying. So are you in favor of us seeing what we can do to notify people
Well,
quickly and
yeah, I
and
want people-
thoroughly?
I think that's what we really suggested today, that people need to be notified. So that, today, the 6th, so we're talking like 5 weeks of this in effect through May 15th. And I know our law enforcement will be very respectful. So, thank you. So now we're at item, the special events outdoor mass gathering discussion. I know, we're gonna get. Okay, so.
Not sure who's taking the lead on this, if you want me to start out?
Yes, please.
Okay. For the record, Eric Kropp, Deputy County Administrator. I think to start out the discussion, it's important to note that there's really two types of events that are approved by the county. One are the outdoor mass gatherings, OMGs, that there's a public hearing, CDD, works on the event application that comes before the board. There's a public hearing, and then the commissioners make a decision. The second type of events are the events, and these tend to be more of the bike races, the marathons, the triathlons, the events that come through risk management and are reviewed and approved administratively. That process involves risk management sends out the application to the sheriff's office, the road department, community development, and other impacted departments. That's reviewed by staff from those different departments and offices. And then I sign those as the county's risk manager. Those type of events, there's a table that was handed out to the board that shows the list of upcoming events. And so just to set the table, I wanted to clarify the two different types of events. As you can see from the table handed out, there's a couple of upcoming events that have been canceled by the event organizer. The Bend Marathon and Half Marathon was scheduled for April 19th. That was canceled. Also, the Cascade Gravel Grinder, which is a bike race, was canceled by the event organizer. The other thing I would add is these events are for events that travel through the county. So if an event is entirely in the city of Bend, then they go through the city of Bend event application. If an event goes through the city, if an event crosses a county road or impacts a public right-of-way of the county, that's when it's required to have an event permit through the county. And then many events go from federal land through the city, through the county. Those event organizers apply for multiple events from those various jurisdictions. Then I don't have anything to add at this point. Additionally,
I did notice that we have a wedding in August, and I thought is it because it's at a special location that it's on our list?
yes, on that particular one, the location, which I'm not sure where it is, the land use would not allow a wedding, but people can apply for an event permit and get approval once every 90 days for that type of event.
Great. Well, I think we're all in the same spot as a community. You know, when is it going to be appropriate to have, you think of a bicycle race is maybe a little different than a running race, but it's going to be a lot different than a wedding reception in somebody's grassy, front or backyard. So I know everybody is trying to process April, May, June, July. When's going to be appropriate to draw a line for different types of events?
And I tell you, I mean, from my standpoint, Commissioner, it's how much can the sheriff's office really help out and do what I feel we would need to do through some of these events. And then, of course, like you mentioned, bringing folks into this area. And so when I look at, and I know there's a couple of different models, and hopefully because everybody seems to be following the lead of the governor's executive order around here and paying attention to social distancing and some of the precautionary measures, my hope would be that we'd be in a better position. But some of the peaking models that I've seen put Oregon around May 2nd or May 6th, but some of the others show that the curve doesn't even start to lessen until you get into June or July. And so I haven't changed my recommendation at all. I'd like to see nothing go on through the month of June. That would still be my recommendation, that those event permits would be canceled, that you have the authority over.
Are we being asked today to cancel things, or are you just loading us, Eric, about things that, the first two have been canceled by the organizers?
That's correct.
So are we being asked to do anything with this list, or you're just kind of informing us of what's on the docket?
I'm mainly informing you what's on the docket. There have been discussions from the sheriff's office about what to do with events, and it's up for board discussion.
Did you realize the LA Marathon was run March 8th? March 8th. They ran that marathon. And my granddaughter was at it. So I know. I'm like, well. And look at, and then you look at what happened with Mardi Gras the end of February. Right. So, but somehow, LA County's numbers aren't really doing much. I know, it's fascinating.
Commissioners, this is Dave. I can note that I did forward you folks last week a draft order that would cancel outdoor mass gatherings that have been approved by the county through a date certain. I put in as a placeholder August 15th. I did not include events in that. I just limited to outdoor mass gatherings under the thinking that the outdoor mass gatherings are much more involved. As Eric indicated, they include quite a bit of work at the staff level from community development, sheriff's office, environmental health, and outside agencies such as local fire jurisdictions, and they're vetted through a Board of Commissioner public process, as opposed to, say, the events that, as Eric indicated, they're primarily to make sure we're not going to be causing conflicts with county roads and to make sure there's appropriate insurance coverage should something go amiss in one of those events on a county property. So that's certainly something that's out there before you as well. I can resend that or have someone bring that draft order down to you. But legal definitely distinguishes between outdoor mass gatherings and more simple events.
What was the date that you said?
August 15th.
What was the magic of August 15th?
It was just a placeholder, Commissioner. I believe, and Nick could probably jump in on this, I believe the only outdoor mass gathering permit that has been approved that is yet to have the event occur is one that's set for the middle of June. And so I just grabbed August 15th as a placeholder. But again, understanding there's a lot more moving parts at the county level with an outdoor mass gathering than there is with what I refer to more as a simple event.
So I'd be in favor of getting copies of that because I don't think it's in my pile now, and we could look at it this afternoon.
Okay.
Is that?
That's fine.
Because rather than bring it down, we got a couple more things. It's
Yes.
almost one. So
Yeah, we need to get, okay, we need to see that again.
And what does, there's the other one that's typically applied for, I can't remember when it's held, the one, it's in Tumalo. What's it called?
Sports education one.
Yeah, it's Adaptive Sports, I think, is the beneficiary of it, maybe, or, okay. I'd be in favor of looking at it this afternoon.
Okay, thank you.
Okay, Commissioners,
Yes?
question. This is Howard Koff, and I'm on the phone on behalf of the Four Peaks Music Festival. And my question is, I did have some comments relative to Four Peaks specifically as the outdoor mass gathering that's been referred to for the middle of June. Would you prefer I just hold those comments till this afternoon? Will I still be able to then be on the call then, or would you prefer to handle it now? Just, just let me know.
Please. It'd be better.
Okay. And do I use the same call-in number?
Could we call or text you when we're getting close to it in the agenda? Or do you want, so you don't have to stay on the phone for hours? Or do you want to, should we do that?
Yes.
Okay, what number should we
you can, 541 388 3882, and I'll also give my cell phone in case something happens to that number. And my cell phone is 310.
It's a public meeting if you want to stand by on all those numbers.
Yeah, that's enough.
I'm sorry, say that again?
It's a public meeting and it's recorded and broadcast. If you want to just stand by and providing all those numbers, I'm just giving you the opportunity.
We'll have Samantha call you for your other number.
Yeah.
Okay.
I get it. I appreciate that. Thank you very much.
Thank you. So.
Bye.
Temporary policy. Is that something that we could start it right after lunch?
Sure. Kathleen's on the line for that, but she can dial back in after
Okay.
lunch.
Okay, all right. So,
Thank you all, as always.
Thank you.
Hang in there.
Thanks for coming and joining us.
Appreciate you all.
As
Okay.
always. Thanks.
so, should we come back at 1:15 then? Is that close enough? 30 minutes? How's the group feel? Thumbs up? Thumbs down? Okay, so we'll reconvene then at 1:15. Thank you very much. Sorry we ran a bit over. Okay,
There
well,
we go, thank you.
we will open up the meeting again, continuation of our meeting. And we did want to, walking up the stairs, I realized that I wanted to renegotiate our public order for the rentals in unincorporated Deschutes County. I wanted to ask for a vote on that, or another motion. We did pass it with an immediately notifying, and I just don't feel that's correct. Commissioner Henderson, is there anything you can say?
You mean are you talking about the effective date or the?
Right, the effective date.
What's the proposal?
The proposal, it was going to be immediately effective.
And what do you want to do?
I wanted to make it effective on 12 a.m. on Friday, the 10th of April. I just feel like we owe the people, the owners of those properties that have been paying property tax here probably for a long time, they need to have more of a notification before we make it effective. Even with our sheriff doing education, I just think it's just a more of a polite way to handle it as a business.
Well, I was kind of on the fence about doing effective immediately or spanning it out. I'm all right with doing it Friday. I think it gives notice, at least the paper will get out the notice, so some people will see it there. So they're not immediately in violation of that.
And
Can we get, what's that?
the paper, I thought they weren't going to be printing at all, and now I guess it's only Mondays they're not printing. So, yes, so that would give time for a hard copy in the paper to get out.
We're having to get a paper tomorrow?
Yes, we are.
I didn't think we were either. I thought that it was all over starting today.
Someone tried to tell me it's only on Mondays. Megan did. Megan told me that.
I did not understand that.
I didn't either.
Either.
Yes, it was confusing, wasn't it?
Yeah, I've talked.
Okay, so that means it could get in the paper prior to,
I wasn't gonna recycle my newspapers anymore, thinking those were valuable, the last few that were printed.
Oh,
Doing a Monday paper, but it's the,
online only.
and not the normal online where you just look up an article, it's the actual whole paper that
Formatted.
you can zoom in on. And you'd have to be on a desktop to effectively.
I've been getting that for a while. They send out a little email that says, the bulletin is available today, and you can go there but it's not as easy as reading the paper.
So, yeah, you guys
so-
are proposing changing emergency order we already voted on, I'm not in
Right.
support of that.
Okay, all right. Well, do I as chair make the motion? Then I move that we change the effective date to Friday, the 10th of April at 12:01 a.m.
I'm okay with
I
that.
did talk to legal about it. Dave, are you on?
I am.
Okay, so, I made the motion. Is that a second?
I'll second it.
Any further discussion?
Do we need a majority vote, or is it gonna matter? I mean, I'd just rather not change a vote that we already taken.
Well, now,
These are board emergency orders. It's not an ordinance, so it doesn't require unanimity.
Okay, yeah, so, just for that purpose, I don't wanna change.
okay, all right.
Okay.
So, I made the motion, so chair votes yes.
I'll vote yes.
Okay, and
Fine with
Commissioner
me.
Vaughn?
No.
No. Okay, therefore, it does pass 2-1. Samantha, thank you very much. So I will feel better about letting people know. So thank you. All right, so now we need to go to our mass gathering.
Are we able to get,
So we have the paper, Dave provided it at our desk, did you get that, Commissioner Henderson?
yes, I did.
Make sure we're on the same page now. Now it's a proposed order for outdoor mass gatherings specifically. So I had Ann Gayworth from Lapine Chamber, Frontier Days Director, very interested in this item, and I said, well, I don't know exactly what we're doing, but now it's very much outdoor mass gatherings, so just for people to understand.
Is Frontier Days a mass gathering?
No, it's in the city, it may be, but it's not under.
No, it's event permit that goes through the city of Lapine and through Deschutes Risk Management.
So that acknowledges that the table we looked at earlier, none of these are outdoor mass gatherings. Even though the Cascade Lakes relay is a couple thousand people, it's really just a moving stream of people, very different than a field of campers.
Correct.
Okay, so this, okay, so the date has on this document is August 15th, 2020.
Yes, and Commissioner, that was just a placeholder. There's nothing magic about that. Do with it as you please if you choose to move forward at all with the order.
I'd be reluctant to do a date past the county fair, because it seems like if we put this in place, we should be planning to not have the fair, and we haven't really gotten there far yet. I don't know what, is there a magic date for the fair, or?
Commissioner, the fair dates have already been scheduled, but we are, in fact, having started to have conversations at the staff level. I know Greg intends to talk to both the board commissioners as well as the Fair and Expo Board and the Fair Association about holding the fair this year. It is certainly a question that's up for debate.
But do you think we're going to decide that in April, or do you think we're going to decide it in May, or?
I think we're going to need to decide fairly quickly, because a lot of those contracts are, in discussion as we speak in terms of the entertainment and the carnival. So I wouldn't imagine it'd be any later than May, and it may be sooner.
Is it, the entertainment, what was the other thing you said?
Carnival and some of the other, big contracts that are associated with the fair.
But they must be facing this everywhere, the carnivals and even the performances,
Imagine
entertainers.
Yeah.
Well, I'd hate to cancel it if we're able to have it, and we're already going to lose the revenue of everything else this year up through May and June. I don't know. I just think we should move this date before the fair, so we don't feel like we have to do the fair if we're doing this. So I'd suggest we move it back to July sometime. I mean, that's still 3.5 months from now. We'll see what happens with it. So that'd be my suggestion.
July sometime, like,
Well, I'm starting the conversation. I'm not, it could be July 15th, it could be July, what days are the fair scheduled right now?
I want to say it's either the last or the second to last day of July.
I think it's like the 28th through the 2nd or something.
Something like that. And I would note that, of course you know this, that the fair is inside the city limits of Redmond, so this order wouldn't directly affect it. But the spirit, in looking at the fair in the light of the other mass gatherings would seem certainly appropriate.
Oh, April, May, June.
The 29th.
Why don't we do it through July 24th then? That's the prior Friday. That'd be my recommendation. It's almost 4 months from now.
Well, and anything.
Is Howard, did we get Howard on the phone?
No, Howard?
Weren't we supposed to call him when we were going to take this up?
Yes, I am here.
Thank you.
He wanted to say some things about this.
Can you hear me?
Yes.
Hello, can you hear me?
Yes, we can.
Okay. Did you have something else you want to say, or do you want me to kind of summarize what the position of Four Peaks is?
You can summarize, please.
Okay. I had a phone call, I think after one of your last hearings, from Commissioner Henderson and also from Commissioner DeBone. And so, Commissioner Adair, this will be an opportunity then for me to bring you up to date, so you know, because it's been somewhat piecemealed. You all had the opportunity to hear from Sheriff Shane Nelson, who recommended that mass gatherings through June be canceled. Certainly what validates his statement to do so, when you look at the Waterfront Blues Festival, which was 32 years in the running in Portland, that was scheduled for July 2nd to the 5th, which was canceled. And of course, we all know the Olympic Summer Games from July 24th to August 9th have been canceled. And then I was kind of surprised recently when the Forest Service closed all of their sites in Oregon through September 30th, and that the state parks are closed indefinitely, and that the governor's order is enforced until it's terminated by the governor. And so, in addition to that official information, Dark Eden Security Company announced that they are not going to work any further mass gatherings for the rest of this entire year. Of course, they're the security company that's on the permit for Four Peaks Music Festival. And you can find their statement on their website. And so our concern is securing the commitment of any security company at this point, which could be approved by the sheriff 30 days prior to the festival, which is probably then impossible. In addition, I got a phone call Saturday from Tom Stevenson, of obviously representing the Stevenson family, who own the ranch where the festival occurs, and he explained that their family, it's a large family, 4 generations currently alive that own the ranch. They're certainly questioning whether it's in the public interest to have the festival, and have realized that it's not something they really want on their ranch. Yet, and of course, their concerns are, you know, safety and health of the community. And so they said, but you know what, we have a contract. I don't know that we could just cancel our site or you can cancel your site, but the contract does say very specifically that if the festival is canceled by the county, that they then have to refund to Four Peaks the entire rent prepayment as well as the damage deposit. And so they're looking for this to be canceled, even in light of the fact that they know they have to refund those deposits. I think the biggest thing, excuse me, is that at this point, there's a strong sense of urgency. We've been getting emails from a lot of ticket holders who are out of work and are requesting and really need refunds now. Four Peaks, they've advanced substantial money in deposits on, as an example, the lease for the property. They've expended substantial deposits to bands, other suppliers, and in the very near future here are obligated for additional sums to other suppliers. But if they could recover the deposits, then they could mitigate their losses and be in a position to refund 100% of the money to ticket holders immediately. And that's certainly what would be the right thing to do. And so, any further delay here in the county canceling the festival could make it more difficult for Four Peaks to provide full refunds, and also could negatively affect the 13 years of goodwill that Four Peaks has established in the community. You've all seen how over the years Four Peaks has supported all of the policies and directives of all of the government agencies and cooperated with all of the various regulatory bodies in the county. These are unprecedented times, which require unprecedented actions. And so we want to be on record as applauding your leadership and the leadership of Sheriff Shane Nelson, who's recommending cancellation of the festival. And it's all being done because you recognize the health and the safety of the community is the absolute priority, and that therefore the mass gatherings in June do need to be canceled. And so with that, I'm available to answer any questions.
Thank you. Thank you very much. Okay. I don't really want to go to July. I'd rather go to June 30th. I just, you know, I'm just waiting to see how the numbers come down, but we'll know by the end of April where our numbers are. And I really want to see where the numbers come down. So I would prefer June 30th for this document. August 15th makes me.
I'm fine with that, because our power to close these mass gatherings down, say there were other ones that were coming, and we talked about the adaptive sports, I can't remember when that is, but our power is because of emergency, it's not because it's good business. So in our best estimate, going through June, it's easy to see this pandemic going through June, but it's hard to see it further until we see more. I mean, remember, 3 months, that's 3 months from now. 3 months ago, the world looked very different, so, yeah.
But it's all the preparation, down payments, scheduling, logistics, which none of that can happen with any certainty right now. So that's how I conclude that, this is probably appropriate at this time. Basically, we are talking about this one large community event, which has been wonderful in our community, so that's the byproduct of it. And then June 30th, that was the date I was going to propose also.
Well, we must have been on the same.
There you go. I mean, because it's just kind of, and it's, I mean, we're talking about our summer here too. Outdoor mass gathering being that, multi-day event in, co-located space. That does sound like something we probably should stop right now. And then, people won't be applying for these if people aren't going to want to gather, I guess, it could be a natural business cycle.
Well, then again, you have to think about the LA Marathon and all those thousands of people together, and if they don't really have the crush, I'm not sure how warm of a day that was when they had the marathon, but, maybe the facts are, we'll know more.
Yeah.
We'll definitely know more, and, okay, so.
We're barely a month into it.
Yes, exactly.
I have a question so I agree with the date also. Dave, shouldn't we put something in one of the whereases, or maybe the resolution, but I think it's a whereas, that one of our big criteria to do outdoor mass gatherings is health and safety. And so we'd approved it on health and safety, but the health and safety issues changed. So it seems like that we should mention that as one of the whereases.
Certainly, we could draft up some language for your consideration.
I just see it as one, because that's the thing that ties it to the why we issued it to begin with and why we're revoking it now. So I'm supportive of the resolution. It's extraordinary circumstances. Do you feel, Dave, that we have any kind of liability on this, or is it? It seems like we wouldn't, but.
Well, probably the generic response I can give there is these are really uncharted territories that all governments are in with these emergency orders, and you're an attorney yourself, so the reality is anybody can sue anybody anytime for anything, and I guess we'll find out at some point down the road whether any of these actions result in anything of that nature.
Okay.
So you proposed a new whereas. Do you want to stand by or just?
Oh, well, I didn't have the specific wording. It's something along the lines of, whereas one of the criteria we use in approving outward mass gatherings is health and safety, or whatever it says in that statute, one of the purposes of the revocation of this is
Oh, yeah.
the recognition, as stated in all the other whereases, that as stated herein or something, conditions have changed, or something like that. Is is that okay?
Well, yeah, I mean, I support that concept. I was just trying to get to.
I hadn't written
Or
anything
a
up.
future vote, yeah.
Yeah. Can you come up with some wording, Dave?
Yes, sir, I'm working on it, and I'll get something put together here real quickly.
Okay, so you have enough direction at the moment?
Yes, I'll get something down there to you here in the next 15 minutes.
Thank you very much. Okay, so is Kathleen on regarding the temporary policy?
I'm here.
Okay.
There's another part about the events, separate from the outdoor mass gathering. I don't know if you want to address that now or after Kathleen.
Okay. Well, go ahead, we'll do it now. Sorry, Kathleen.
As I mentioned, there's a number of events that come through risk management for administrative processing. Those event permits go through the various departments and offices. I guess the options for the board are, does the board want to limit the events based on a time certain, just like the outdoor mass gatherings? Alternatively, staff can continue to process these event applications and either inform the event organizers that they must comply with the governor's order in terms of social distancing, or staff could take it to the next level and ask that the event organizer submit their social distancing plan for review, and the approval of the event application could be contingent upon the event organizer having a solid social distancing plan for their event. Those are some options that I see for the board.
So you're talking about the King of the Castle, those events?
Yes, and also I'm in email communication with the sheriff's office, and there's a statement from the sheriff. The sheriff has apparently stated to the board, the sheriff's office position, that all events should be canceled through June. So that was what the sheriff mentioned this morning while he was here.
Made a point that there's a little bit of public safety support no matter what happens, even if not bad things are happening, there's a presence, and bringing people from out of town. Sheltering in place is a lot different than driving from somewhere to go to a running or bicycle event.
Through June 30th again, we're talking about?
Yes.
Okay. Well, it would be consistent with this other order if we did the same day. Any other comments?
Well, are you saying that we're affirmatively canceling all these, or we're taking the lead in that? Because in the other one we just did, they wanted to cancel. I mean, they're supportive of it, so we're not causing an immediate friction. I mean, some of these, I don't know what the world will look like June 19th through 21st, and I don't know if they need 3 months to set it up, or whether, I don't know how long anything, so it seems like we need to know something about those events. The mass gatherings, we've made a certain assumption on, but I don't know some of these.
In our communication with the event organizers, the King of the Castle side-by-side desert race, the event organizer plans on holding that. Pacific Crest Endurance Sports Festival, that's in Sun River. They're looking at possibly postponing it, but no decision has been made from Pacific Crest. And then we haven't heard from the others.
Well, maybe then we should, we don't have to do this today, right? We could do this in a week, or we could do it at our time.
Yeah, see, there's about 4 different, organizations, I'm thinking, that are, different groups putting these on. So I would support having a discussion with, Pacific Crest specifically. That's Sun River and the Central Oregon Visitors Association. So I'd love to talk to them about that.
Yeah, at this point, probably the time critical one is the May 2nd and 3rd King of the Castle side-by-side race. That's the next event on the list. which is in the.
That's a motor vehicle, side-by-side, off-road.
Correct. Majority of it is taking place at, and maybe all of it might be on BLM, on the Milliken off-road or OHV track.
So 185 attendees or participants?
That's, yeah, attendance, that would be the drivers, and also they have people that kind of serve as a pit crew, for lack of a better term, but people that, kind of a team.
Okay.
Well, that'd be a great conversation to have with, what does this event look like? Is it people coming from, tri-state area? Is it a lot of camping? Is it multiple days? I don't know any details.
This is a multi-day event. I'm not sure if there's camping. There's different types of races that go on, and I don't know the extent of how far people will come for it.
Why do they need a permit from us if it's all on federal land?
If it impacts our county road system, and I forwarded this to our road department for review, whether or not it requires a county permit, since it's occurring on BLM. But if it impacts a county right-of-way or county road, that's when we require an event permit.
So you haven't actually talked to them?
We've been in email communication with the event organizer. And also, at the request of Chair Adair, I did email the event organizers on this list to let them know that the board was having this discussion today, so that they were informed.
Oh, good. Thank you.
What is the Schillings Garden Market? Is that the one out off by Deschutes Junction? Or where is this?
I believe that's
Like
the location.
Out on Old Bend or something? You mean the Shillings?
Well, there's a what I'd call nursery it's kind of off the old, it used to be Pleasant Ridge or whatever it was is it that road that?
I know it's the nursery. I'll look it up real quick.
Because I think I was there last year, and so if that's where it is. But I think they have music, and it's kind of like probably people, chairs. I mean, that would.
They sell flowers for Mother's Day?
Yeah, I think that's right. I think that's
They sell flowers every day.
But it's a Mother's Day event. They bring
Yes.
people out. It's spring. And
It is Old Redmond Highway.
Yeah, it's,
Well, that's maybe
east of
different than what I'm thinking of. But anyway, I mean, both of those need to be decided fairly soon. Are they? So what'd you say the feedback was, that they're thinking about canceling, or they aren't thinking about canceling?
The side-by-side race, they're planning on continuing it. And the last I heard, Schillings plans on moving forward as well.
They've got a note on their website on how they intend to deal with the coronavirus and the governor's order.
So, yeah, I'm not ready to act on this today. Let's leave this out there.
I know there was a lot of concern with that horse event that, to me, is one of the easier places to say 6 feet apart is.
Oh, the barrel
And yet
racing
it was
event.
apparently, it still got a lot of bad press and I was talking to somebody when the governor called him because she was upset about it and because she'd read about it, so. If that was not lawful under the governor's order, I don't know how these would be, so I guess I'm willing to wait also until next week.
okay, so am I. So consistently, we can wait till next week, Gary?
Yes, I'll let the event organizers know.
Okay, great. Thank you. Okay, Kathleen. Sorry for the,
No problem. There's a lot to cover.
okay.
So wanted to just give a quick update that the policy has gone out to employees. There are detailed guidelines as well as forms, and we have actually had quite a few questions coming into the HR team on this benefit, as well as we've received our first application, which we imagine additional will, roll in. And communication to department leadership on the board's decision to have any exclusions run through HR and legal, that also has gone out. So all of that information has, went out last week. And really just wanted to check in, is there anything that I can answer specific to any of the provisions or details around the policy?
One that I have is still from last week, is I still would like to know what parts of that policy were taken basically verbatim from the federal law and which ones were created by somebody in Deschutes County, so I know what we chose as an option and what was required by law.
Sure. So there are two. There were two main components to the policy that were allowed for within the policy, and the direction that Deschutes County went with the policy. One was the emergency responders and health care providers. So the law does allow for the exemption for that under the FFCRA. And the definitions themselves were taken directly from the law. However, we removed positions that did not apply to Deschutes County. So that would be one component that we took the language from the law, however, adjusted it appropriately to apply to the work that's done by Deschutes County. The second piece is go ahead.
Well, we don't have it in front of us, so we're just doing it by memory. I was just saying sometime I'd like it, and maybe somebody could take a full copy and they could underline the stuff that was verbatim federal law, and then we'll figure out what the rest of it is.
That's what we'd like, is a copy so it's clearly, we can tell what is word for word from the federal law, and then how it was, changed to fit Deschutes County. So if you could get that to us,
sure.
That would be great.
Yeah, because it's hard to follow it,
Yes.
It's a pretty long document.
So if you can do that, Kathleen, that would be excellent.
Okay.
So, it's just a little bit early to really have a detail about, what's going to evolve here, putting it in place last week. So thank you for the update. From my point of view, keep us informed. I'd love to know, and probably just one-on-one meeting if something gets exciting. And Eric does good at keeping us informed. But for the employees, we wanted to make sure they have the opportunity to be at home, take time off, quarantine if necessary, and follow all the laws and regulations as they're on the books.
And plant their garden.
And, oh yeah, there you go, yeah.
Don't forget to put your gardens in now. I saw that in the paper. And I'm like, yes.
We're going to wait another month in La Pine.
Well, you could plant them inside. Yes, that's usually what you have to do. So, all right, Kathleen, thank you so much. Let's go on.
Hey, thanks.
Do we have any BOCC updates? Anybody?
So I got a couple items. So there was a notification about Burning going to be closed this Friday. When I first heard about it, I was thinking, oh man, I don't want it to be closed yet. But really, this is in response to COVID-19, first responder availability, just in case things. And they mentioned that it could. This is Chief Supkis in La Pine said that maybe it could be open before the summer really comes. So this is a choice that was made by the Fire Chiefs Association.
I did hear
Friday.
it didn't apply to farmers, though.
So yeah, and agriculture, maybe some field burning that still people like to do, and agriculture is exempt. So that was another point. You're right.
Right. It's not that they like to do; it's that they need to get rid of the little critters that come up in the spring, right before the orchard grass is growing, as I was explained.
So another item for us. LCDC Planning Commission seat. So we saw a note from Nick Lilac getting request for application. I had mentioned it during a phone call. Some of the Eastern Oregon County Commissioners, just to making sure that those guys hear about that. We haven't talked about it, so I just want to make sure we're comparing notes. I'm really honored that Deschutes County Planning Director would be in the mix right off the bat here. So I don't know if there's any other thoughts. I don't know how much of a support specifically from the board. I guess is there a decision point, authorizing him to do that as an employee of the county, or what do we want to do with that?
Well, I mean, I think Nick sent the note to each of you, and I believe each of you have responded to him in different ways. So, as he said in the note, the director reached out to him directly and asked him to apply and insinuated that it was he's not soliciting applications from anyone else. So Nick just wanted you all three to be aware of that and assess whether you were supportive of not. There's no formal endorsement that's required or no.
So yeah, just a discussion. If there's any. So as I say, I mean, it's an interesting dynamic. I'd love to see our planning director be in the middle of that, just making sure if it's an Eastern Oregon person, if it's the right person.
Right.
How much time does that take away from
Only 40 hours a week or so.
his regular job?
Well, I asked him that when he first brought it up, and I mean, Nick, as you know, works very long hours anyway, including many evening meetings and so forth. I don't think either Nick or I could look at you and say it won't have some effect just because of the preparatory time that's involved in some of the material that comes to him as a commissioner. But is it going to be a large effect? No, I don't think so. And weighed against the benefit of having, someone who's works for this elected body having a seat at the table. I guess that's sort of the trade-off that you would evaluate in your mind.
Well, especially in this time of a worldwide pandemic, I mean, land use might have just had its trigger for a big old discussion about what does it mean in the state of Oregon.
You mean?
It might be better to spread out than get more dense.
That's right.
Gee, what do you think?
But I mean, and some people come to that conclusion, but other people don't want to have that conversation. So it'll just be interesting to see if there's.
I'm surprised though that I guess, I'm interested in pursuing it. It seems like as a appointment, I'm surprised the director of an agency picks his own his own supervising board. So, it seems a little, I think it's appointed by the governor. So,
and I think it's confirmed, isn't it, by the Senate as well?
So I'm supportive. I guess it's just quick discussion amongst us.
Yeah. I can't remember if I shared what I wrote. I don't think I've seen what the other commissioners wrote about it, so.
I just asked for a little bit of a couple paragraphs or a couple sentences and to share, which is to say, when I was on the phone call the other day, it really wasn't the time to dive into that topic very much, but I did lay it out there for people to hear those words, so I haven't even been able to share all that with the other commissioners yet. But it's a good Eastern Oregon County Association conversation too.
Yeah. Well, I think we're going to need to have that because they, because they brought it up without knowing who was being considered, and we might want to introduce him to the group, so to speak, and explain why.
Less populated counties that may look at us as the big boys, right?
Yeah. I'm sure they do.
I know.
The good news is Nick has excellent relationships with a lot of the county directors. I know, especially like Baker County and things. So that's really a testament to how hard that man works. So, but the fact that we had Catherine and now if we have Nick, they're going to go, excuse me, and you know how there's another couple 100 miles going east, right?
Yeah.
So I can understand why they would not be. They'll have to learn to love Nick.
Okay, well, one more on a different topic then. So there was a outreach asking us to maybe put on paper some requests to the governor's office about just kind of, fair and equitable distribution of dollars from the federal government during this COVID event, so and we've heard about this a few different times, a large populated area can request direct allocation from federal dollars, then the rest gets distributed by the governor's office. So I haven't started the process, I just put a note down to make sure we just lay it out here a little bit.
Yeah, that's a great topic. I don't know how we deal with it. Because I've seen the requests from East Oregon counties, and I'm not quite sure what other people are thinking about. I talked to Mark Owen about it last week after our phone call. He's the representative, East Bay County Commissioner, and Harney County, new representative there. And I asked him, I said, well, how much is the shortfall going to be in the governor's budget, in the state budget? And he think it's going to be $2 billion in this quarter. Well, is it possible the state is going to want to just say, well, the way we're going to spread the money to the counties or the cities is we're going to keep ourselves solvent.
Yeah.
And because his idea was somewhat, what I was thinking is you'd spread a certain amount to each county, like a base level. He said 5 million to each county, that'd be 36 times 150 million of it. And then maybe there's other bases but I see our immediate need would be the things like, that we're gonna lose immediately, like the gas tax, our county fair budget's gonna be, if we keep everybody employed, and I don't know what the expenses, I don't know how that comes out, and so should we put those in? But I'm in favor of doing a joint effort. So I don't know I'm interested in what everybody's thoughts are.
We could ask, just like we did for our front doors and our facilities, what do we see that's coming? It's, this is bad, it's, revenue stopped right here. We're still gonna have public services expected by our citizens. So we could do that quick little analysis internally. And then also, maybe it's really just truly healthcare. If the medical providers are not providing other services or other billable services and doing all things for this pandemic, maybe everything just revolves around keeping our healthcare system floating. And, so that may be a high-level decision before we even figure out,
Well, kind of like we did with the sheriff's office, where we said we're gonna set aside 500,000 for these kinds of expenses. Maybe we make a list of those. One of the ones that I learned about last week is that the hospitals lined up 3 different motels, and somebody had asked me to see if they could get in the queue for putting their healthcare workers up. Well, if the hospitals aren't making any money, maybe that would be something that this money could be going to, is because people don't want to go home because they've been working it all day. And so we could come up with a list, I guess. I don't know if all the stuff that Nathan and that whole group are doing is spending more money than we'd spend otherwise, or how much more money. I've never seen, I don't know if there's a budget for that, or.
Yeah, that's true. Maybe they've already started the process, because they are keeping track of expenses, but then also what are the.
But I think we'd be asking the state, it'd be the best for us to ask the state for the money, but are they keeping a budget of things we wouldn't have spent otherwise, or?
I'm certain they are. I've not asked Nathan that question directly, but part of the protocol for eventually requesting FEMA reimbursement is to keep very careful records of every dollar that is spent in response to the incident, in this case the pandemic. So I'm certain that they are.
So who's the keeper?
Commissioners?
Yes?
Commissioners, this is Greg Munn on the line here. And we are actually coordinating with Nathan and the EOC on keeping track of not only the external expenditures that we make, but also time spent by staff. So we have a system down where we collect it all in finance and are working very closely with them.
Okay, so what have we spent to date? Do you have a number?
I was going to ask the same thing.
Going off the top of my head, but I can get you in a few minutes.
Yeah.
We're roughly a month into it, not quite a month, I guess.
Okay, give me a couple minutes and I'll get back to you.
Right.
I talked to Senator Finley this morning at 7, and he said, before we have a special session, he said that the state government really needs to know, okay, where are we at? What have we lost? What have we lost? He said that number needs to be pulled together by the state. Apparently, Deschutes County can buy ventilators and the governor can send, the other ventilators to New York.
Well, yeah, so that's an interesting decision. I didn't know we bought or ordered 30, but what
It was
what are
on,
we gonna
it
do
was
with
on
the
that
ma-
order form.
No, he said it today too, but I just wonder what are we gonna do after this with those 30
Right.
ventilators? Are they just go in a storage unit or, I mean, I don't know, how much do they cost?
Some of them are ambulance ones, so they were a lot less expensive than what the original quote was. The other ones, I believe, were like, remember, we allocated $500,000 and it was within that allocation.
Was that part of that
That was
money?
part of those numbers. I have it with me if you want me to pull it
No,
out.
that's, I got it too.
And then talking to Senator Bonham, or not Senator Bonham, Representative Bonham, the other day, he really felt like we were better off trying to negotiate with the governor and getting things done than asking for the special session. So he thought.
I agree with that.
He thought we would be way ahead, so politically speaking.
But it still goes back to Tony's question. of
Right.
What things do we wanna get reimbursed for or?
Well, there's,
Or,
it's
and,
legal.
just like Greg Bunn in Finance is working out, how do we account for what we're spending, what we wouldn't have spent otherwise, and what's not gonna get funded in the near future, you know, cause once we have that map a little bit, then a governor can start to look at it, or whoever in the Office of Finance, can say, oh yeah, that makes sense, and we know it's about X, you know, of millions of dollars, or whatever the numbers are starting to be. So it's really putting a system in place to be able to evaluate how
Yeah.
much we might need, or what's appropriate to backfill where.
Okay, and then you did see that, what was it?
Which is probably gonna keep us busy for the next couple of years. I mean, that's gonna be the job of everybody now, is to really figure out what's, you know, where's critical needs, if, you know, cause once it's past the medical, then it's gonna be people's just housing, food and shelter, the basics. You know, and hopefully government isn't gonna keep buying that for people, but we can get an economy going too.
Yeah,
But
well, that's,
we do have a national food stamp program, though. I did want to bring that up. And 3 years ago, when 46 states went down in the nation on the number of people on food stamps, Oregon went up. So I'm wondering where that number is now, and have people from the last 2 weeks actually applied for their food stamps? I haven't seen any of those numbers yet. I don't know, but that is, it's a significant program nationally, or, you know, that people in Deschutes County can get food stamps. And it's just.
well, you know, we had that, you know, issue with the press wanting to know what the immediate impacts are. I guess that's what I think we need to do, is go through all of our departments and say what's immediately impacted. You know, not just from revenues, but from costs, or, you know, and have a summary of that, because it's,
What are
like,
fixed expenses, what are variable expenses?
Okay, so we know our gas revenue is down because people are going around to fill up gas stations and they can't even fill them up, you know, because nobody, relatively speaking, is driving. So, I mean,
yeah.
that's pretty.
Well, so when this came up about how much we'd lose on gas taxes, I asked, the sheriff over the weekend, and he got me a report that Nathan had, that they're creating a whole report of traffic and, well, of all the different measurements. Utility bills, they don't have a lot, there's a lot of gaps, and we should get it for all of us. But driving is down almost 50%, and I think it'll be, you know, so.
I think it's down more than that, right?
Well, this is actually, locations. They have locations on 97 that they measured, and then they have other things around they showed actual charts day to day. I must have a monitor out there. But yeah, I think it's between 50 and 75 in the city of Bend. But anyway, the point is, there is some measuring going on that way that's interesting.
And then you look at our property tax bill and the part that we're actually responsible for, what is that, like only 17% or something? That's all we can really, like, by reducing our portion, help our community, like, recover and, you know, get back into the economic swing of things. Whereas, you know, there's a lot of other charges on property tax bills that I think are incredibly impactful, or they're going to be impactful.
Well, and so I would propose that we just start to do some analysis. I mean, we don't need to put too much structure around it right now, but just look for those costs that are being incurred, plus the estimates of what may be going down, which is exactly what the media was asking about. But if we can start a little system where we start to, and this is with the budget work is being done too, probably.
Well,
Commissioner's good point. Actually, this weekend, I began sketching out sort of a continuity of operations sort of request to each department. We've already gone through the exercise of defining, what we believe our essential services are by department, just in terms of building closures and, immediate impacts. But what we need to add to that is the funding streams that support each of those essential services, and what this pandemic in the future, to the best we can, means in terms of how those revenue streams are affected, and put those two things together so we can determine individualized plans for each department. So that's kind of, it's committed to paper, but I haven't sent out that request yet. I have a meeting with Greg on Wednesday morning. I wanted to go through it with him. But, for example, the Fair and Expo department is the most immediately impacted by this pandemic, where their revenue tap almost got shut off. They do have some coming in through the RV park and some of their, the RV rental space and so forth, but and matched up against what they need to be doing, must be doing, and so forth over the next few months, and have an individualized plan for that department. But that's probably the most extreme case. But in the case of whether it's gas tax or a property tax funded operation like the district attorney, or health, assessor, so forth, what that means, and the various other revenue streams we had, again, matched up with how they're supported, and if we need to be making changes in the short, medium, long term. It is tied into the budget, but that budget, as you know, doesn't begin till July 1st, and we may need to be taking actions much sooner than July 1st in terms of how we, what we
We've
do
got a
and how
whole
we
quarter
support it.
here that we're going to be looking at numbers that are going to be incredibly impacted. So, and the one thing I do want to mention on tape is that the 4-H and FFA auction, we have got to have that happen one way or another. I don't know how we do it, but, those kids are going to spend a lot of time with their animals. I know they've already had to invest in them. I just, that brought in $1.5 million last year for the kid, the youth of Deschutes County.
This gets the issue of the planning for the, the fair. To me, I could see a fair where we didn't have entertainment, and maybe we still had a carnival, but we did have some activities if things get cleaned up some before it. So it may be a limited fair as opposed to
I just think that's.
No, I agree with you. I think that those
Our
are
kids have
important things.
they've lost their schooling, they've lost a lot, and, I don't want to take that away from them, and I want it to be as successful for them and their efforts as possible. I did have a question. Mosaic Medical that's in the Courtney building, how long of a lease do they have?
Commissioners, I don't know off the top of my head, but I can certainly.
Can you let me know on that one? Okay, thank you.
Hey, Commissioners, this is Greg Munn. I got some information for you.
Thank you, Greg.
Okay, so as of today, we have committed to spend, in other words, we've put in orders for, or have spent some of this, up to $225,000. We've logged collectively 590 hours. And I wanted to give you some information.
For that?
Say again?
Do you know the billable rate for the 590 hours?
No, I don't. It would just be across the board. It's all of the staff that's working through the EOC.
Is it billed per person then, actually their actual hours?
We're just logging the hours right now.
Okay.
So at some point, what we want to do is just create a mechanism to capture all of that. And then when it comes time to claim reimbursement, we'll sort through. We have everybody's names. We know everybody that's been working on the project. We'll be able to sort out the cost side of it later. I also wanted to give you cost of mailing that came up earlier. So we identified approximately 34,000 properties that had a residence or had a structure on them. And the cost to send out a mailing to those would be about $23,000. On the TRT data side, in the TRT database, we have 867 accounts total. 728 of those we have email addresses for. The cost to send a letter through the mail to the 867 accounts would be about $600.
Greg, are you saying that there's 867 accounts in total, but you have email addresses for 728, or are you adding those two together?
No, the 728 is a subset of the 867.
Okay. So, all right.
So, well, I'd be in favor of emailing all you have, and then I'd be in favor of mailing all those. But again, that may be the most direct way to get it to the rental places, but the people we really owe a duty to is the property owners. What about if you took out, just did the resorts and the highly rented areas, maybe the areas south of Sun River, and you eliminated some of the just EFU properties or whatever that probably have less of those as a starting point? Would that be maybe half, or was it probably less than 34,000 properties?
Yeah, I think that would be true, but the ability to sort those out into which ones we should mail to or not mail to, we probably need to get GIS folks involved.
That doesn't, I mean, even if we went the whole thing, it wouldn't bother me to, I mean, that seems like that'd be a responsible thing to do, to send all, you just have to do a tactful letter about you're being, sent this letter because you own property in rural Deschutes County. If you're do short-term rentals, please be advised of the following, and there's fines of this, and we're doing our best to get a hold of anyone. If you know anybody else that, that has it, might, just some kind of tactful letter. The other would be, is that with I've got to believe a mass mailing to those addresses on a card would be cheaper than did you do some kind of commercial rates, or?
Oh, through
We
Moonlight?
reached out.
Moonlight would be a good place to go.
What's that?
That's who we went to. So we got quotes from Moonlight.
So is that with an envelope, or, I mean, is there a different rate for just a card? I'm just throwing it out as a way to save 5,000.
Envelope.
Well, so you're saying the 34,000 total properties?
That's what he said.
But those are all residential properties in the county,
Mm-hmm.
not transient room tax
Correct.
payers. And you'd go for that larger number.
In the fear that we'd miss people and would be treating them, yeah, I would go for a large, well, I was trying to get it less than 34,000 by cutting out certain areas, but I don't, that's why I'm asking, is there a cheaper, what rate per mailing is that? I guess I could do the math. But it's almost,
We could save a couple $1,000s by using a black and white postcard.
Well, so you're going to send one to my house then, if we do all those rural properties?
That will be our test. It's always good to have a test, and when you get yours, we'll know everyone else got theirs, right?
Well, I was concluding the subset of transient room taxpayers, which is a lot smaller number. So I'm just making sure that you're going down that path. And I don't think I support that. I mean, let's get those transient room taxpayers, 700 email addresses. If you can pull out the subset that don't have email address and mail them a postcard, that's 150 postcards, and we spent $200 on the deal. Opposed to 24,000 or whatever the number was.
it seems awfully low to be able to,
Well, one thing about this, one unintended consequence benefit is that if we find someone has been renting their house out and they aren't part of our system, then they may show up. That the sheriff has to go to such and such restaurant, residence, and they're not in our system. So that's, that's the other side of the story. It's, so it's 139 letters that we would have to send out if you're just gonna hit the TRT people. But then again, some of those email addresses might be wrong too. So I think we're better off in just emailing them and sending a card out to the 867. Unless we know they're good emails.
So that 867 seems awful low to me.
Does it?
So I'm wondering if the ones that are part of a group like Vicasa or VRBO, if that counts as one for the, potentially several hundred clients they may have that they're. Do you know that, Greg?
I don't know that off the top of my head.
That would make sense.
I'll see if I can find out while we're on the phone.
Well, Vicasa's on your board, and it sounded like she had, last week when I listened to the meeting, it sounded like they have quite a few properties, so that, you're right, yeah.
So, yeah, I'm thinking that the majority of that 800 may be individual homeowners who don't operate through one of the big operators and pay their TRT directly to the county. That's an account versus, say, Vicasa or Bennington that is one account but is on behalf of several hundred individual property owners. So, I think that 800 is probably much larger in terms of the total individual properties that offer overnight rental in our county when you consider all the destination resorts and all the other.
Well, and I don't want to beat this to death, but it's great that we contact these middlemen that do the renting out of the units, but to me, the people that pay the taxes every year are the property owners. So maybe the request to a larger rental agency is, we want to get a message to all of the property owners that you deal with, for short-term rentals, how do we send that out? Because that's really who should know, not just the rental company. I know these, I've worked with a lot of these kind of people that have done it, and my guess, watching them build their houses, they would care if we'd passed a law like this and with penalties on it, and it seems like we owe that. They pay huge amount of taxes every year and they're aware of that. They're aware they pay huge amounts of taxes, and so if we spent 20 cents to get them a letter, that doesn't seem like very much to me, or 10 cents or whatever it is. I don't know how much it is per letter, but.
It's like
70.
50 cents shipping, 50-cent stamp plus 50
Well,
cents or $1 for whatever we send.
I don't know, mass mailings aren't that much. You can get a mass, I don't know, somebody has to look into it. I'm just saying somebody should look into this.
It's 67.6 cents of that one price, the 23,000. But if we went black and white, what he said, we'd save a couple $1,000. But I do agree that they deserve to be notified. I somehow remember that Mr. Bennington had 71 properties or something. That's what I remember seeing on Facebook the other day. So I don't know, that might be off, but I know, it's been a really rough time for some people that have worked really hard to get where they are, and to know that unless they rent something for a month, they're out of luck for a while. So guys,
I could offer.
Yes?
I could offer a potential solution here, based on what I'm hearing you say. We could get this email out today, an email blast out today. We could also proceed with a postcard that would reach out to the total 867 accounts. So there would be some duplication there with the emails, but that might be okay. And then come back and answer the question whether or not we're getting to all of the homeowners or not, or if it's just hitting the account holders. All the property owners, not just the account owners.
Okay.
So when we collect from TRT from a group that has multiple properties, do we know what the properties are, or do we just take it on face value, here's our money, or do we get entire reports?
We just collect straight from the third-party administrator.
So they may have 50 properties, and we don't really know what those properties are?
That's true.
Does everybody that's an overnight rental that pays those have to register somewhere in the county?
You mean as opposed to outside of their business relationship with the VRBO type organization? Greg, that's a question probably best for you.
Now we have it's called a DC number that each account payer pays. I'm not sure, though, whether or not if you're a property owner that's underneath a third-party administrator, whether you have the DC number or not.
Seems like we need to do some learning about this industry a little bit to find out how we cover it. Because I don't know, but if you want to reach all the contractors in Oregon or in Deschutes County, you have to find out who's registered contractor. I don't know if I'm Googling overnight rentals Deschutes County and see what comes up. Anyway.
Okay.
Well, I'm in favor of, sending out an email, but that's just the tip of the iceberg to me. Some of the ones that are local apparently already kind of aware of this and passed it on, but I was told that the ones to look at would be the ones that are bigger organizations that aren't just local to here. They're, I don't know what you call them, but.
Okay, so you're saying you're going to send an email out. Do you normally send out emails to them, Greg? I mean, do we know the email efficiency ratio? Is it like 100% of those emails are good?
I don't know that. We did send out the email a week or so ago and did receive quite a bit of feedback from that. So we know that it does reach some of the population, if not most.
Okay.
So if you just Google it in the cheap research, it says 2,048 vacation rentals in Sun River, 282 vacation rentals in River West, 237 in Century West. Bend has 2,900, but those are the top 5 quote destinations on one website. So I mean, there's thousands and thousands of them.
That's more than 800.
Yep.
Yeah.
Yeah, and that's, yeah.
Okay. All right.
So who do we put somebody in charge of this? Is it Tom, do you have somebody you're going to put in charge of this?
I'd say Greg Munn.
Greg Munn. Okay.
Thanks for dialing in today.
Thank you, Greg.
So if it makes sense, I'll work with Whitney on the communication, and we will get the email sent out today.
Great. All right.
Greg, this is Nick. We're here to help as well.
Super. Thanks, Nick.
Okay. Are we ready to go on?
Commissioners, Dave Doyle here. I did make those changes you asked for on the outdoor mass gathering order. I believe Samantha might have gotten those to you. The additional language should be highlighted in yellow. It was just one whereas clause and then the beginning of a sentence at the actual order itself.
I don't see the yellow.
There's no yellow, but okay.
Where is it? The yellow doesn't show on ours. Where does it supposed to be?
Okay, let me grab that. if you look on page 2, right dead in the middle, the whereas clause in the middle begins with whereas when reviewing. That entire clause is new. And then on page 3 in item number 2, the very first part of that clause, in context of ensuring adherence to public and environmental health standards, was added in front of what was already there.
So I'd move approval of,
And then it also reflects the June 30th date that you folks asked for.
Yes, and that's there twice. Thank you, Dave. So, I'm sorry, were you making?
I was just gonna move approval of order number 2020-022.
Any further discussion? Commissioner Henderson?
Yes.
Commissioner DeBonne? Yes. And the chair votes yes. Thank you, Dave. Thanks for stepping.
Thank you.
Okay, Chris Doty?
Yes, Commissioner. Good afternoon.
Good afternoon.
All right. Well, I'm here on the speakerphone at least to provide an update and present a scope and contract with Parametrics, local engineering firm, for the Terrebonne wastewater feasibility study. I remember discussing that here last fall. With the study, we'll be updating the 1999 study in Terrebonne, kind of taking the approach of also looking at cluster concepts within the community, any modern technology that's come into play since that 1999 study was put together. So there's resort-style systems we have here in Central Oregon that could possibly be employed as well. So looking at all sorts of different options on how to sewer Terrebonne. With that, in the study, we'll be estimating capital costs and then operating costs as well, with the goal of really determining what a sewer rate would look like coming out of the study, the feasibility aspect. We'll be evaluating governance options. So how does this sewer wastewater district move forward? Does it have to be a wastewater sanitary district or something of that nature? Also be looking at capital funding options. So what programs exist for the funding of the capital construction in terms of grants or low interest loans. We'll also be studying the effect of the existing, or I guess the extent of the existing systems in Terrebonne to a certain degree, to kind of give a sense of how existing septic systems are operating, how much life they may have left, what types of systems are there. I know there's a handful of drill holes in Terrebonne to really help the community understand the problems of the existing systems and any risk that may exist in moving forward. Out of this study, we'll also have what's called a preliminary engineering report, which is a document that the funding agencies and regulatory agencies like DEQ will need to see for this concept. So that's the scope. The consultant will be working with the stakeholders, and we'll be putting together an advisory committee to kind of oversee the process and take a little ownership and make some recommendations. And board, we're thinking of 5 to 7 property owners and business owners in the community, just that we could gather through our knowledge of who the stakeholders are in the community. I'd be interested in your thoughts on that. At the conclusion of the study, we hope to develop options for implementation of a municipal system, determine the capital and then the operating costs for the system options, and then ultimately what are the next steps going to be for Terrebonne. I think we're going to need a group of champions to step forward and really, take this to the community and potentially, develop that sanitary district and go through the processes to potentially vote in some funding options. And that's what the study will ultimately kind of determine, what options exist for that governance piece. So board, the fee for services for this work is $99,850, of which $20,000 will be funded via a grant that we've received from Business Oregon. That was the $20,000 grant we submitted for back in November as well. So that leaves us with about $80,000 left to fund. And we had talked a little bit about the general fund contribution, funding that delta. So with that, do you have any questions?
Thanks for getting through this process, getting to the kind of the commitment phase here. So the $80,000 is the general fund contribution, or 50,000? For some reason, I was thinking was a number that was in my head. So I mean, is it a full 80,000 from the general fund, or were there other funds from the county? Something.
So we submitted for 2 grants. One was a grant through I think a DLCD. I forget the acronym per se, but we were unsuccessful in that one. However, we were successful in Business Oregon. So we were hoping to get 40,000 in grant funding. We've got 20,000, and so that would leave us with 80,000 from the general fund or whatever source you'd like to attribute this to.
Yeah, that's fine. Yeah, I just figured there. I was thinking there was a different number there, but that's fine. So it's a $100,000 contract, and 80's the general fund.
Is there anything we can get through the, as far as applying for through the USDA? I remember that John Huffman's office had said that, I think when I talked to them last November, that they might be able to help us with this. Chris?
So we kind of drug a net pretty deep. We couldn't find any grant opportunities for feasibility study funding. Now, the USDA may be there for us for construction potentially, but not for feasibility study that we could at least find.
Okay.
When you said fine, Chris, has anybody contacted him directly and just said, do you have any funding that we might apply for? Because he's being a prior legislator, he's used to that, and it wouldn't surprise me if he knew about something that wasn't obvious or something like that.
So we didn't reach out to legislators or anything of that nature. We did kind of work our channels through Business Oregon. You know, they kind of work in coalition with the DQ and the other funding agencies, and they're pretty aware of what funding exists for this type of thing, and they weren't familiar with anybody else. And again, we weren't successful with the other state grant, unfortunately, that we submitted.
The only reason I was kind of following up with what Commissioner Adair said is because I've heard him present also, and he seems like he has lots of ideas to present, for grants. He's always wanting people to apply for them. So I'm just saying, because he's a former legislator, he's used to this kind of requesting and stuff, and he's been in the Dalles a long time, so he knows Terrebonne. Well, he represented Terrebonne, actually. He's the one that got, has been given the credit for the money for the refinement plan, so he would have a special interest in it, so might be worth calling him.
Okay.
So how many properties or homes would a system like this potentially impact, do you think?
I think I want to say the number 600 to 700 pops into mind as far as what is currently and potentially has a capacity within the unincorporated communities area.
Okay.
So probably less than 1,000 at build out.
And when you say it's negotiated in the amount of that much, what does it, we didn't have competitive bids, or we did, we obtained 3 proposals.
Yes. So the way it works is we get the proposals, we score them on criteria in terms of the team that they have in place, their understanding of the scope, and then we take the number 1 consultant and then negotiate a scope of work and then a fee for service. And so that's, ultimately there were a variety of things we wanted to see and add in the scope, the bullet points that just kind of went down with you there. And so it was a process of, hey, I'd like to see more effort here, or no, I don't think this is going to be necessary there. So that's the nature of the negotiation of the scope and then the fee associated with that.
I was like Commissioner DeBona, I had a 50,000 in my mind as well, so instead of 80.
So is this a fixed fee, or is there other expenses associated with it?
This would be a not to exceed amount.
Commissioners, I believe the initial figure that was presented to us by some of their stakeholders or consultants was around that $50,000 mark. But with things that were evidently added into the RFP, particularly with respect to community engagement and investigation of alternative systems, that I'm assuming is where the expanded cost came in to play.
Yeah, that's exactly right. So looking at the governance options, what I think the board received an unsolicited proposal for somewhere between 50 and 60,000. It was just basically to put together that preliminary engineering report. It didn't have any community engagement, as Tom mentioned. Didn't sell the fact that, hey, there's a problem that we need to research and provide the community a little bit more information. It checked some boxes, just not all we thought necessary to do full due diligence. Ultimately, the community is going to need to have a lot of confidence in this work product in order to, vote for something that would create basically a sanitary district and ultimately a sewer bill from the service that's provided. So we in our scope that we, I think, took to the board in November, kind of laid out all those items that we had added to those items that we wanted the consultant to explore, and that's what got us to this number.
Well, and I do support the reality of not just putting a engineering report on the shelf for another 20 years, because this is the third time this has been analyzed, basically generationally, and really putting direction to, okay, we're talking about a sanitary district. What does that mean? Is there community support? Is there leadership? Would there be a board? Because that's what happened to me. I went to the water district meeting, and they're like, man, we need this thing, but it's not going to be us. And it's like, okay, well, who's going to do it then? And then we do hear about failing systems or possibly failing systems right on the edge of being viable, and putting direction to it to get the community to really buy in. And yeah, somebody voting yes on a debt bond and creating a district is the goal here.
Yes, when I drive by and I know how impacted they are by their failing systems and a lot of the businesses, it's like time that we set it up.
Yep. Well, being an urban unincorporated community, having the opportunity to put in those cluster systems, or maybe it is a 4-quadrant something, it could really be exciting too, the next generation of what do those systems look like. There'll be some rock blasting if they put pipes in, though. That's a downside.
Rock blasting, okay. All right.
I guess my concern is just, we've entered a different environment now economically, so if this all of a sudden becomes general fund, 80,000 out of general fund that's directly from taxpayers, that's why the 50 sounded better than the 80. I wonder if we could do it in 2 parts.
Oh, somebody needs to clean?
Yeah.
Okay.
$142 per 700 properties.
Is that what it is?
Yeah.
But all the county's paying to do that study for those 600 or 700. I don't have any sense about the public support. It'd be different, I guess, than the road project, in the sense that we don't have a big budget already approved to do something. We're just this is really starting from scratch almost, in the sense does the community want it? Then could they fund it? And would it work? And
well, this is building on a previous engineering study and then taking it a lot farther also with community engagement.
You think it is building on the...
Well, there's previous versions of what would a large pipe sewer system look like. So somebody's already kind of figured out the elevation, the pipe diameter, and whatever for a version in the past. So this is just the next generation of the engineering. So I'm just saying there's previous work that's been done.
Yeah, it's been a topic in the community for a long time, since 1982, that studies have been done. And so I think, as the Commissioner said, this is something that seems to come around every 20 years for Terrebonne. Now's it just seems, based on some of the heightened level of failure and some almost catastrophic type failures in the community, that it has a more real sense about it at this point than it has in the past. They're getting very close.
Yes, catastrophic failure, I believe that's probably the best way to describe it at this moment. So then we actually need a motion.
Any thoughts about, just the full board, general fund?
Well, the only really other discretionary source of funds that the board could use for this would be the surplus TRT that we've collected over the years, over and above what's contractually obligated to COVA and what we've committed to the sheriff. So, then it's tourist as opposed to property taxpayer. So you do have that option.
And we have all the tourists that have gone to Smith Rock since, what is it?
Yeah, that's true.
Yeah.
And eating it there at
Yeah.
the store, or.
Yeah, all those tourists that has gone from 400 to 800,000 a year ago. So yeah, they've definitely, if we have some surplus funding there, that would really make sense. Because I'm sure it's going to impact.
Suggest splitting the revenue, the revenue stream in half or something, 40 from the general fund.
If I could chime in a little bit on options. The road department does receive payment in lieu of taxes as discretionary funding. That's money that doesn't necessarily have to be spent on road issues, whereas all of our state highway fund, gas tax, et cetera, does. PILT does not. And so to the extent that, we're doing a lot of work here to figure out, what the impact to Terrebonne could be on the transportation system, a lot of tearing up of roads, especially in advance of a lot of work that we're about to partner with on ODOT in the community. We could potentially fund this internally through the road department and highlight PILT usage of our PILT revenue specific to this work if it's a stumbling block.
So how about split it three ways?
3 ways?
You can offer us all over.
TRT and general fund. I like that.
That's fine with me.
That sounds very good. And I can also call John, call USDA and see if there's anything he can do
Okay. We'll give that, I'll move,
Thank you, Chris.
What an offer.
move to authorize the county administrator to enter into contract with Parametrics for the Terrebonne wastewater feasibility study, with revenue being split between PILT, general fund, and TRT reserve.
I'll second it.
Any further discussion?
Well, I'm just hopeful that we come up with something that we can really act on rather than another study. I mean, it's got to go one way or another if we're going to keep those systems and those businesses and residences in good shape. And I'm just hopeful we can go forward with some reasonable solution.
Well, we've built some relationship with some vocal community members, some outspoken community members recently. So we should keep those going, though, because, I'll offer to be at community meetings, and we can probably, offer at different times if they have a bunch of activity, just to kind of make sure they understand the outcome of this can be an engineering plan, but it really needs to be a local, on-the-ground, supported political district, so.
And I want to again recognize that Parker Vernon went to 100 homes, and I said we need to hear from the community, and the Vernons have been incredibly impactful as far as this goes. So I'm glad. Commissioner Henderson?
Oh, yes.
Commissioner DeBonne?
Yes.
And the chair votes yes. Thank you very much. Thank you, Chris. Do you want to go on to your next one, please?
Yeah, you bet. So hopefully on the line here with me is John Valley, our vegetation management supervisor. John, are you there?
Yes, I am.
All right, great. So, Commission, our vegetation management program provides contracted service to a variety of agencies in Deschutes County for noxious weed eradication. We do that because we have specialty equipment and trained personnel for application of herbicides and things of that nature. The Bureau of Land Management is one of those agencies, and they've historically hired us with internally budgeted funds within the BLM through kind of a small program they had for that sort of thing. However, it's the federal government. They've now moved those funds to a grant program and no longer have those available just to hire us for weed eradication. However, they have asked us to apply for grant funds that then they would direct us to apply basically the same type of service as directed where they're having noxious weed issues on BLM lands. Also, road rights-of-way, some Deschutes County rights-of-way through BLM land would be eligible for expenditure of this type of funding. Before you is a grant application for $70,000 to continue with noxious weed eradication on various BLM lands, as well as Deschutes County rights-of-way. The funding and the project essentially is a 3 to 3.5 year program. It's full cost recovery to Deschutes County. We wouldn't, not be compensated for anything that we would do here. We'd be 100% recovered in this program.
Excellent.
So with that, any questions?
I noticed it's like we get paid $2,000 a day for the work. So it covers 20, 21, 22, and 23. So it sounds like John could be very busy.
We're planning on it. What it is, we have no in-kind funding at all. So all we do is we charge them for time, material, and our equipment. And it's 100% our money back.
Excellent. Any further questions?
No, I'll move approval of application for BLM invasive and noxious weed plant management grant program.
I'll second it.
Any further discussion? Commissioner DeBonne?
Yes.
Commissioner Henderson?
Yes.
And the chair votes yes. Great. Thank you so
Thank you.
much.
Thank you, Board.
Thank you, John, and thank you, Chris.
Bye.
Thank you. My mother used to have her license for spraying weeds, so she did. Like, it was like, oh gosh, Mom. Okay, so now we have parole and probation. Okay, so we're only several hours late.
We did those last two pretty quick.
I tried. Okay. Oh my gosh, such a good idea. I'm realizing I've had all my iced tea almost. This isn't good. Whew. What is this? Okay.
No, I was just standing up.
We needed to.
So not an official break.
No, we were just standing up. You're supposed to, according to our doctors that we listen to. Okay, all right. Good afternoon.
Welcome to our boardroom.
Yes.
So Lee Randall, Facilities Director.
Ken Hales from the Community Justice Department.
So thank you very much for having us on the agenda today. As mentioned in the agenda, we're here to review with the board and give the board an opportunity to discuss the parole and probation expansion project. And we discussed some of the details of the two options under consideration with the board previously. And today we just wanted to review those again and seek direction for further developing one of those plans, which would allow us to get clearer scope of the work and refine the cost estimates in working with the construction manager, general contractor, and the design team. So at this point, we have a schematic design for an option A, which involves expanding the building out over the existing work center and some associated work with that, as well as option B, which is an addition adjacent to the building, which incorporates and reuses a portion of the existing lobby, but the bulk of the work is in a separate footprint from the existing building. So that's kind of a summary of the agenda request and the information that we've discussed with the board previously. And today we're here to give the board a chance to discuss that. And Ken has a few opening comments as well.
As you know, we talked through the different options, how they're laid out and their advantages and disadvantages. We think on balance, option B is preferable for a handful of reasons, but most importantly because it is $1 million plus less, the estimate, and it does provide us 900 square feet of unscheduled space that we can expand into. So it just provides us more space for future expansion, and it comes in at less.
So CMGC is in place, and this is that full-on decision about committing to one and letting the other one go at this point, the A and B decision.
So I'm generally, if we were to pick an option, in favor of B rather than A, but I'm really disappointed with the cost estimates here. And we've got 5.1 million of hard costs, and you got another million of soft costs. You're at $6 million for 8,151 square feet. I mean, that's $736 a square foot. I was thinking a building like this would be, we should get office space for, maybe a couple million or 3 million, but I just think I thought it was too much before the economy changed. Now we're gonna be in an economy that could be much different depending on how long this goes on, where we're, saving what we thought was kind of a capital expansion. I don't see it that way now. So I can't move forward on this or vote to move forward on it. Just doing the math, I mean, what bothers me with government spending is we don't look at it as like, well, what are we providing? We're providing office spaces. So it's $736 a foot. They're office spaces. So I know there's other things involved with it, but it's just too much. And I brought to, I guess it was Ken's attention, I thought it was Lee's memo, but I've never taken the position that starts out the fiscal implications that board's direction was staff seek to pursue completion of the project without undue delay. That's an urgency that I don't see. I did want to get the development and the estimates, but we need to figure out a way to build something cheaper than $6 million for office space, is my feeling. Particularly for parole and probation, which is not a public use facility at the same level. The courthouse, we're gonna have to do an expansion there, or other things that are really, a health building or something where we have a lot of people in it. So that's my feeling.
And I am available to make a motion to support this, so I don't know if that goes over.
Okay.
If I might, I'm obviously not an expert in construction, but I believe the consultants and the contractor and staff pursued this in a good faith manner, and the materials that we're using, my understanding was based on the county standard. Nothing extraordinary out of that. It's not like we have special generators and other things that the work center has. I do believe that it is a little bit larger than the original design. But overall, if you go with the total square feet provided to the agency, the cost is pretty close to what the original estimates were. But all that said, the only way I can imagine of finding opportunity to trim the cost is to engage in the next level of work where they can actually, the contractor can actually go in and apply value engineering to all aspects of it instead of relying on, design estimates.
Yeah, well, I've been in several meetings with the consultants, the architects, and I don't see any real emphasis by them or maybe experience in actually doing value engineering. And I think we're in a different market all of a sudden because of the coronavirus, and I think we could get it significantly cheaper because of the boom may go out. And so all of a sudden, people that had too much work won't have enough, and maybe it'd actually be cheaper to build a year from now than this year. But I just think we don't have that coming in. So the fact that they didn't really offer it up to me when we did the previous meetings, I don't think if they get it more refined, they're gonna cut another 2 million out of it. We had a few cuts, but some of they came to me, the budgets weren't even accurate. I mean, they had to redo them. I mean, that's not professionalism in my view of budgeting for construction projects. They had to explain it, they had to go back and change stuff, and then, so until we get that capacity,
Your observation about the impact of the virus, had kind of weighed on me a little bit too. Obviously, or not obviously, but we all anticipate coming through this and the economy returning to more like normal before the end of the year. And you said maybe next year would be better than this year. Well, we won't be able to build next year if we don't start the next stage of design this year. If we wait a year, then we're building 2 years from now, and then we'll be, as naive as I am about the process, I was hoping to get the design work done so we can get jobs bid before everybody gets real busy again.
Gosh, talking to someone in the real estate business yesterday, he had done one agreement in the last couple of weeks. He's never seen it so impacted, and knowing that so many of our businesses have really taken a major hit. I mean, people are going through their savings. They don't have the 4 months worth of. I just feel like this. I can hope that we're going to bounce back. But I honestly, today can't say that. Oh, sure, we're going to bounce back in 6 months. I really feel like we could get a much better option, perhaps. County does have. We have funding, but I still feel that this is excessively priced. You're saying $736 a square foot?
That was doing the simple math of 6 million divided by 8,151 square feet.
That's really up there.
So there are some minor remodels of the adjacent space that wouldn't capture, that would be at a lower rate. But in the general math, that's not questioning the math, but there's some additional scope of work there that's captured in the total price that's not reflected in the 8,151 square feet. So a minor remodel of the lobby of the second floor and some of the office space there is included in their cost estimate, but wouldn't necessarily be captured in that square footage.
Okay.
Do we have any comparable prices from completed buildings that are of the same type? Like, I don't know, like a school might be similar, or some kind of institutional type building that we can compare completed prices recently?
We could certainly look for that, and I can get that information. Early in this process, we looked at some comparisons that other entities were using for budget purposes, but we can look at completed projects too. I can get that information pretty quickly.
But I think you're gonna have to do it in the new world. I mean, it's a new world out there.
Yeah. And
so,
I think the other consideration.
Somebody in a boom economy, decide to pay for something is gonna be different now. If it's any, depending on how long this goes on, so.
One consideration is that the design process, we're at the very beginning of it, so we would expect that to take 8 to 10 months to get to the point where we have construction documents that then Skanska would competitively bid to subcontractors. So that final guaranteed maximum price that would come before the board would be based on competitively bid numbers at a future time. So the estimate certainly is based on what they know about the market pre-COVID-19. Going forward, when we actually have a competitively bid subcontractor work, which will be the majority of the work on this project, that would be based on whatever the economy is and the construction environment is at the time, which we would project would be 8 to 10 months in the future once this design work is taken on, completed.
So we're talking about committing to option B and getting to the next design stage. So, I mean, I'm enthusiastically supportive of trying to get there. I don't know if I can advocate enough for one of my commissioners to support me, or both of us here, both of you to support. We're in the time of transition. We made a commitment to the stabilization center, so now we've got a temporary facility out there, and we need to just keep this thing rolling forwards. Having a construction manager, general contractor means we have a partner in this who's going to look for those lower numbers. We're talking, and this is where, I don't see it the same as you as a construction person, but we're talking about government construction, high ceilings, elevator, public contracting. There's just a lot of reasons this goes big. Hopefully we're going to be able to bring that number down, and it looks like it will be down. But now is the time to make a commitment to our CMGC and getting this going forwards and not putting it on the back burner.
It's unclear to me, Commissioner, if your position is that you think the project costs more than it should cost, or even if that is the real cost of the project, it's too much and you think you don't want to support that.
Well, for me personally, it's both. I mean, we had a facility that had these same people in it that we gave to health to do a stabilization center. We spent $1 million remodeling a 5,000 square foot building for them. That's going to be good. Now we're going to go spend $6 million over here for the same people just to be in the same building and some extra space for the future. So we're going to spend 6 plus 1 to get what we used to. We could have given $2 million to the health department, go build a brand new building somewhere over at Courtney or wherever we wanted, and we would have saved, about what's that? That's $5 million there. So why are we spending this kind of money for office space? I mean, it just doesn't. So that doesn't make sense. The other part that I don't see is I don't see the ability to cost cut that I think we need to develop a culture of. And we need somebody to tell us how we can get that done for less money if we need offices. Because $700 a square foot offices to me is crazy. So I remember when the water department in Portland back, 6 or 8 years ago, did a new building, and how much criticism they got for spending $450 a square foot. Well, we're way beyond that. And then, so it's both really to me.
Well, if I could, I think one aspect of your initial comments are off the mark in the sense that we're not just replacing what was in the programs building, because the programs building plus the current space was simply inadequate of itself. And we're trying to build sufficient space for operations, which is more than the programs building, and build the space to address the needs in the future. I'm hoping to hire 2 staff this year, and we have funds to hire more, but I'll only ask for 2. And I couldn't ask for 4, even if it was needed, because I don't have any place to put 4. So our ability to expand service has been, for years, limited by our space. and that continues to be the case. And if we discontinue efforts to plan for it now, you know, it'll be even further down the line before it gets addressed.
There may be some buildings in Deschutes County that actually, per our report from EDCO the other day, 471 traded sector businesses have been caught by this pandemic. And there may be some buildings here that we could get for a lot less money in not that long of a time. I mean, I don't want that to happen, but I just think there's, it's really a serious situation that we're dealing with out here, and to spend, you know, $7 million on this building when there may be something available that would really be fit, and it wouldn't cost us $7 million.
If I might, we never seriously considered building a separate building, even though that was initially one of the ideas. Just build a new building for parole and probation. One, we didn't have the space on the campus, and if we move off campus, then there, you know, yeah, that could be done, and maybe it could be done cheaper, maybe not, I don't know, but we would no longer be on campus. And so all the systems we have that we do in partnership with everybody else on the campus would be different. Transporting offenders to and from the office to the jail would be different. So there'd be different logistics involved. Not that, you know, we're very fortunate in this county to have a public safety campus, to have all those like operations in the same locale. And we're not, you know, I wouldn't necessarily recommend we go off-site, but, you know, if that's the reality, that's something we'll look at. But
Well, so if you really were, if anybody here was serious about cutting $2 or $3 million out of this, what we might do is say, well, why don't you take over the downstairs of the building you're in, and we'll build a new sheriff's building for the things that we're doing down there. I mean, you got plenty of room downstairs to add capacity. So, I mean, the point is, nobody's really thinking outside the box about this stuff. We've proceeded down, and to me, the budget never got really cut. So that was one part. Now we're looking at a different marketplace, so we need to think outside the box about, well, maybe somebody else should get the new building. It might be cheaper. We could probably build, I don't know what the final cost of the county building came, or the building out for 4-H, OSU Extension came in, but it was certainly a lot less than this per square foot, and its offices, I don't know, it doesn't have the same security, whatever. But maybe we should be building a separate building. Maybe we've got a place we're talking about putting the Vets Village. Maybe we should be moving the sheriff's, you know, there's all sorts of things that are on the table. But I don't see what bothers me is nobody's thinking this seems like a lot of money except two commissioners. And really the staff, you as staff people should be thinking that, in my view, that you should be, and I don't hear it, so.
There's 3 commissioners, and we've got 2 saying no, but we're sending our staff out to study, analyze. We've done a CMGC.
Yeah, well,
we've made the commitment to the Stabilization Center. And you're just sitting there saying, go do a better job. They need guidance from a board of commissioners, 3 people setting direction to this, not just magic, go make it better. I mean, you've got to be careful here, because we're going to waste a lot of people's time and money by going in circles.
Well, we're going to waste a lot of money if we spend $7 million. That's what I worry about, and especially in this economy.
That's fine if the majority feels that way, but don't just get mad and say, go do better. Give some specific guidance.
Well,
I mean, this is frustrating for everybody.
People are
and I'm
talking
sitting here
depression now. We
thinking
weren't
this
talking
differently.
depression a month ago, were we? I mean, people are talking recession, depression. When can we get out of this? And we're looking at spending $740 a square foot on a parole and probation, when hopefully we'll need to work on the courthouse too. So, you know, it's definitely changed.
Well, yeah, I mean, I
Seriously
think people get the idea, but if we don't make a decision today and just say, go do better, where do people
Well,
go?
we'll make a decision. The decision was whether we go forward, and for me, it's no. So, you know, nobody's asked me what we should do different.
Well,
I mean,
as
if
I
that's
said,
what you're
that's
asking,
my
I
point.
could come
This
up
is
with a
a
lot of
three-person board of
ideas.
commissioners with
Okay,
authority to
I'm
make
just,
decisions.
when I talk, I'm talking for my 1/3. And I'm just saying, for my 1/3, if somebody wanted to ask me how to do it, which has not been the case, I'd be happy to give ideas to it. But I'm not gonna, I mean, I just threw out about 4, and I
Well, yeah, and I'm
think
just
like
pointing
that.
out, I mean, if you're.
But I've done that in a similar kind of mentality, and when people come back and say, we can't build this building, you say, what could we do? And then we talk about it, but we're still talking about this building, and I just don't see it at this price level, and I don't think it makes sense to design the rest of it. In my experience, designing the rest of it doesn't result in cutting another $2 or $3 million out of something.
So we're spending money with an architect, we're spending money.
We
with
have spent it, yeah.
GC people.
Whether
And, I mean, yeah, it sounds like your statements are very clear about, let's just back way up and figure out where we're gonna go with this and not even think that we're gonna spend this much money. So what are the parameters we're working under? And as I say, I'm just trying to say, let's make a decision, not just tell people to go do better in a generic fashion. That's kind of what I'm seeing here, which bothers me.
If I
So,
could follow up on one thing the commissioner mentioned, and that was related to using the space at the lower level, which, if you remember, the long-term plan is to use that space for P&P and move the sheriff out to their other facilities they'll build for the work center. If that's the direction, if you want us to use consultants to help us identify how to retrofit the lower level, we can do that. It'll cost us to do it, and I don't know if it will be cheaper or not, but that's an alternative direction if that's what you want us to pursue.
Well, and that would have to include what it would cost to stand up a new work center.
Right.
Whether that's,
And the delay in standing up the work center before moving in there. What that option would do would basically pony up the long-term, part of the long-term solution to right now.
One, I'll just mention the fact that it is on the public safety campus. One of the upsides to that is citing something like parole and probation, and that's something that we've run into when we've looked for temporary spaces for PMP and for that type of function, or for new buildings. And that was also a challenge that we ran into when citing the stabilization center, which is why we eventually landed on citing it at the public safety campus, was because of that challenge of finding a neighborhood or an area in the city with similar and like uses where it fit with the other adjacent businesses and operations. And we can look at that if that's the board's direction. We're happy to see what's available out there and formulate a different plan going forward. But I'll just mention that when it comes to public safety functions or behavioral health functions, that's been a challenge that we run into.
So Lee, you're saying then that this, a PNP building would not be welcome elsewhere in Deschutes County? You're saying that this is really where it has to go?
Well, I think I just want to point out that has been a challenge in the past. For instance, in Redmond, when we did a remodel of the Redmond Services Building, and we were looking for temporary space for that year, it was very challenging to find a place where working with offenders and people in post supervision, where that function fit with the other functions in the neighborhood. It's a challenge. I'm not saying it's insurmountable, but it's something that's we'll want to consider going into that. When we're looking for temporary space to potentially lease, either for the stabilization, both for the stabilization center and adult parole and probation, as part of how we would knit together public safety campus improvements. We were, at the time, James Lewis did a review of potential spaces, and we came up empty in terms of the type of building, the zoning, and the location. And so we can certainly, that's not something, we can certainly look at that. It's not something that has to be off the table, but those are challenges we've run into in the past.
Just back to the basics for today. So staff to report back with updated budget and plan information at the 50% design stage. What kind of time frame would we be looking at if we got there today?
Just in terms of an estimate, probably 3 to 4 months, give or take, to get the design to that stage, to give the contractor opportunity to price the finished design. So each of those would be a step kind of linearly to get to the point where we would have information to report back to the board. And there would be a cost involved both for pre-construction services for the CMGC as well as design costs for the design team.
Yeah. So, I mean, that's good, 3 or 4 months from now, and I'm just.
So my vote is to not go forward for the next, spend all the money right now. I mean, we've had, for many months, we've had a design and rough budgeting, and to me, there hasn't been much of a cut. We've bet, the option B is better than option A, but for today, I'm not gonna approve going forward on option B. And so that's me, and it doesn't make sense to keep designing it. I mean, they do have to go back to the drawing board. I guess I didn't see it as the scope of today. Well, Phil, if you don't want to go forward with this, it's your job to tell them today what they should do. I don't know. I think we should talk about it at a meeting and talk about it maybe individually. I do feel there's a need for more office space because they're in trailers, but I do think we need to look at what can we do for less, and it may get even worse. I mean, we may have to postpone more because of we don't really know where the economy's going, but this is a huge, loss to lots of people. So I don't see us, I guess we wait a couple months on that, but I don't see going forward with this design hoping that they cut it. So that was what I thought the decision space today was that much.
Well, but as I say, I mean, we got to a point where you were saying, why didn't you do this, or why don't we go there? So, I mean, those are some of the words you were using. That's what I was reacting to, because, as I say, if we're not gonna make this decision, so then what's the statement? It's going on the back burner, or it's being unplugged?
For me, the statement would be well, we need to have another meeting and talk about what else is possible and what the goals are going in. We didn't really go in saying, how much do you want to spend for X number of offices?
Well,
and that's how I think we should do
so
it.
One step then. So
you're asking me what I want to do, and I'm
let's break that up. So, I mean, let's make sure to have a good, brain-filled, deep meeting about that. So I've been watching staff kind of try to get to this point. Let's get it on an agenda, and now it's the end of a long day, and it's just frustrating, and it looks like it may not move forward. So, I mean, if we're gonna have a meeting, let's have a meeting on it and really get to it. And, get to professional decisions and big picture items on this.
A professional decision today would be from an economist that would say, county, maybe you shouldn't be thinking about spending $7 million.
I was advocating for making sure we have a good agenda item and not to put at the end of the meeting in the near future.
Okay, well, we had a busy day. I just think that economy is taking precedent over, and our costs are excessive. So, in today's economy, they're triply expensive. So what is it we can do for parole and probation that we're not going to spend $7 million or $8 million doing? And surely there's something.
So, I mean, the way I would interpret a no vote at this point is that this project is abandoned because it's not moving.
Seriously.
This project if that's what you want, if that's 2 votes, that's what it is.
Well, we didn't actually ask for the economy to fall apart.
I'm not.
No, I mean, and that is a serious consideration. And we're also talking about spending taxpayers' money on a parole and probation when in the future, we're going to need to do something with our courthouse. And that's going to take a lot. We've got to be really frugal, especially now, our gas revenues are going down, our TRT are going down. I mean, what kind of quarter are we going to have? And who knows if it's going to jump back in July or September or next December, I just really think it's a scary time.
I recognize what you're saying. I'm just seeking direction.
Okay,
we either move or we don't.
No, I don't think we move with this right now. I think we need to we could come back to it in 3 months, but I really think you have to think about the kind of money you're talking about spending on a building that is just for parole and probation. We don't have the public going in and out, we have parole and probation. We don't want you in trailers, but you know what, I just think, you've kind of been caught.
Well, and bear with me to ask a question of understanding. When you say right now, is that right now? What I'm hearing is this project's dead. We need to look at a whole new way of figuring out how we're going to solve our future space needs. There's no more coming back to this project. Is there? I mean, if the commission leads me to believe that maybe in 3 months they'll feel differently about the viability of the project, then okay. But if
I don't feel viable at $7 million. I just don't. I've always thought it was a lot of money to spend, honestly. And apparently hasn't been heard, but it really is. It's taxpayer money. And I just think that it could have been done, with cost-wise less than $5.1 million. And then it's another million on top of that. So we're talking a lot of money. And then, I do believe that the economy is going to it's going to decrease our building costs probably in the future. But I still think that whatever we've done design-wise here is really expensive.
If I could, I think it would be, I do think it would be useful to have some kind of comparison to other buildings, of the same type, just for a reality check, if nothing else. But I also hear that, and I appreciate what Commissioner Henderson said about, going back to look at, not necessarily abandoning this one at this time, but to look at, what other, truly different types of projects might be possible in terms of, the one idea that he did suggest was if he had the downstairs in and of itself, what kind of a rough order of magnitude that may cost, with then some kind of an idea of what a new work center would be somewhere, versus other completely. If we had built a standalone building with a different footprint, or a 1-story versus 2-story, or a some other kind of, even if we look at, say, an expansion of the Unger building in Redmond versus retaining the same, other just, anything we can think of in terms of alternative ways that this might be done with rough order of magnitude cost, just to, provide a broader, more in-depth context of, that we've, where we've arrived with option B on this particular design is the best compared to others that we may not have thought of. And we take some time to do that, come back, we'll have a better sense of what the, economic fallout of the pandemic will be, locally in the state. Maybe that might be a worthwhile next step.
So Tom, you just mentioned the Unger building. I'm not familiar with that. So what happens at the Unger building?
That's in Redmond.
Mm-hmm.
That's our North County facility for parole and probation, and juvenile is there as well. It's a single-story, pretty Spartan building there in the just a block or two north of Redmond City Hall.
Okay. How many square feet is it? Do you know?
Approximately, it's between 6,000 and 7,000 square feet. I don't have that number in front of me at the moment.
Okay, and we use the whole building as it is now?
They are truly shoehorned in there now. They have very small offices, and it's not something you'd build from scratch, but they made do with what we had.
Okay, so small offices. All right, is there land around it then to add on to it?
No, there's
no space.
Yeah, it's right downtown. It serves the current needs well, I would say. Again, the upside to that building being where it is and it being able to function for P&P operations in Redmond is that it's been there a long time and they've been operating out of that building. So it's an accepted use in the neighborhood, and we have good relationships with the neighbors at that building.
It's large enough for the amount of business generated in the Redmond area.
Okay.
But, you know, if, to follow up with what Tom said, we could do some analysis maybe and understand if we build something new, we're not building 8,000 square feet, we're building 1,600 square
16,000.
16,000 square feet, because we have to replace the square feet we already have.
We're not gonna do that.
Then we can't build a new building.
You can why can't you build a building to take care of the people that are in the modular units now? I mean, they were in a separate building, and we'll give them a better building than what they're in, which the separate building wasn't that nice. We have another, you know, we put it close to where you are.
You're proposing we build some form of satellite facility for a subcomponent of the operations. That's something we could perhaps.
Yeah, I'd think about that as one of the options, but, you know,
Even at like $350 a square foot, I don't know if that's possible, but that's half of what we're talking about here. 16,000 square feet is 5.6 million. So, you know,
well,
I just feel
I
like.
don't see us building a brand-new
No.
parole and probation just so we can get everybody in the same building, and.
Yeah.
All right.
Especially in this economy, I just don't.
In this economy, it just doesn't. It's like.
What, I think we should back off a little bit and do what Tom suggested of just looking at some other options and figuring out what we need to do for, you know, the future and planning wise. And I think, like you said, we'll have a little more clarity maybe on this pandemic situation, how much it affects our economy going forward. But I like that idea. I didn't really, I thought the issue today was whether you've kind of finished a cycle of budgeting, revised budgeting, you've gone back to the sheriff's office, we asked them what they want, and you've given us that budget, so now we have all the figures that you have as of now, and I don't see a pathway that you get to significantly less money or a system or approach to do that from anybody I've heard from, so unless so I'm good with going back and looking at that and seeing what else there is with our, and maybe we have a brainstorming meeting, and this really shouldn't be, you come up with a proposal and when we approve it, maybe we could help work on the proposal of what we do and talk about options rather than present it and, so that's what I'd suggest is we figure out some way to exchange some ideas on it. Sound like Tom's idea.
Considering the situation that we're dealing with at the start of our fourth quarter, I like Tom's idea too.
Okay, do we need to keep going on with this? It seems like we resolved it.
Will become a dead horse, you mean?
Mm-hmm.
Okay, all right.
Thank you.
All right, so is Cynthia available? Cynthia?
Yours.
Commissioners, this is Peter Gutowski, Deschutes County Planning Manager. We're currently tracking her down.
She came in the office.
She made it across the street.
Was ghosting somewhere.
Yeah.
Thank you.
I had my supervisor a little.
She's here, don't
Out
worry,
over there.
Peter. Thank you, Cynthia, for joining us this afternoon. I'm sorry it's 3:30.
Oh, that's okay. You ready?
Yes.
Proceed. Okay, so Cynthia Smith with the County Planning Division. We're here for Thornburg Destination Resort. They received a recent approval for a golf course and artificial lakes. This is part of Phase 1. Cameron DeLashmuth and Central Land and Cattle Company are the applicant and the property owner in this case. So what we have here is an administrative decision. Staff issued an approval for this. Like I said, it's for a golf course and artificial lakes. There's a potential appeal, and we have a dedicated opponent or opponents. There's no appeal received as of today, but we have had an inquiry about this. So a little background, as most of you know, Thornburg Resort has a lengthy and complex history that began about 15 years ago. Each aspect of the resort includes decisions from every level: hearings officer, board, Land Use Board of Appeals, Court of Appeals, and the Supreme Court. Currently, we do have a pending review at LUBA. It is pending a Oregon Supreme Court outcome. Those are in kind of holding status. But staff found that the golf course and the lakes do not depend on the outcome of those. So just a little background there. So as I indicated, administrative decision was issued on the 1st. The 12-day appeal period is on the 13th, Monday, 1 week from today. Like I said, no appeals, but we have had an inquiry from an attorney of a dedicated opponent. So we're expecting an appeal. Standard procedure here through Title 22 includes the first appeal, and public hearings go before a hearings officer. This has applied to all Thornburg matters in the last 15 years. It hasn't diverted from that at all. However, we do have the applicant requesting the board initiate a review if there is appeal and hold a hearing of the administrative decision if it's appealed. As indicated, this has not been the process in the past. But I'm here on behalf of or for the applicant to make this request, and that's what's before you right now. Excuse me.
Oh, yes. I was going to say, do you need something to drink? But you have your water.
Water.
Great. Okay. All right.
So that's all I have to report. I'm just, like I said, we have issued a decision, and we have an appeal that is a potential appeal within the next 7 days or 1 week.
So even if I guess if we made this decision today, we don't know if it actually will happen, but we think it will, and we could make it next Monday, and it could still go to 5 p.m. Monday night, right?
Correct.
If that could, the appeal could be filed by then.
Correct, yes.
Okay, and let's see, how long of a period do we need then? Are we given after the next Monday night in order to determine this? I mean, do we need to determine this today?
We need to determine it within the 12-day appeal period.
Okay.
And that's why we're here before the 12-day appeal period.
All right.
Goes through.
Commissioner DeBon?
I'd be supportive of calling this up if it was timely appealed, in support of just a long history of this and the determined appellant that kind of uses anything that's out there.
Okay. Mr. Henderson?
So as I understand, we're just missing, we're moving it through one step, so we don't do the hearings officer. And why was the request made before there's an appeal filed? For us to make a decision, it seemed.
Well, the
trying to think
request
of other
needed to
cases.
they wanted to make the request so it would go to the board before the 12-day appeal period came through. The applicant understood that there was going to be an approval coming forward, which it was issued on the 1st. And so they, nothing more than that, just the request to get it into you before this decision is appealed and before it becomes final after that 12-day period.
So we would be probably hearing this, if we heard it, the appeal, we'd be hearing it before the Supreme Court's decided the issue on the.
There is that potential, yes.
Yeah.
The applicant has.
Legal, I would say that's
far more than a potential. I can't imagine with all the delayed schedules all the courts in Oregon are under now that we're going to hear anything from the Supreme Court. So I think you take it as pretty much a certainty you'd be hearing it before the Supreme Court would be issuing any kind of final decision.
So as I understood that the Supreme Court decision we're waiting for could undo what we did there, right?
That's correct.
And so would it have an impact on this if we make decisions here?
We think so. Adam and I have had a brief discussion on this point. We do have concerns. I know legal's recommendation would be to let this go to a hearings officer rather than to call it up, in part because of the timing and in part to further vet out the what would probably be some pretty high-level legal issues.
Would community development have to eat the cost then of the hearings officer in that scenario because it was an administrative decision? Or would, barring some other support for that cost? Yes.
Who files, if we hear it, who pays the fees, or are there fees?
Cost of us doing business.
So neither the applicant or the appellant?
The appellant has a hearings officer, or an appeal fee, the real basic $250 fee.
So nobody.
$250, right?
$250.
Well, I think I'm in favor of going and hearing this if need be. It seems like everything we do at this level is kind of just the middle of the process, and throw a hearing officer in, and then it gets appealed to us, then it gets to LUBA. It's all going to be decided at LUBA anyway. So, I mean, we're just doing our job.
Right. But legal is saying that we should have it go to the hearings officer? That's what you just said, Dave?
Well, certainly our concern, as Commissioner Henderson pointed out, there's a real question about some of the jurisdictional issues in the Supreme Court matter that's pending there could have the impact of maybe undoing or in essence mooting or voiding a lot of what potentially you folks have done. Plus, what we've typically found is a lot of these arguments are becoming more and more legalistic, and the hearings officer does a pretty good job of pulling a lot of those out. So when they do make it to you, they're a little better defined and a little better disclosed. And so generally, that's, I believe, what our, the basis for our recommendation. I agree with Commissioner Henderson. Ultimately, it's going to end up in front of you folks at the local level anyway. Our thought is, though, if it goes through the hearings officer, it's maybe a better refined product, and that additional timing might allow for the Supreme Court decision to come down and provide additional guidance and direction. But certainly it's well within the board's discretion to hear it or not hear it, and we recognize there's pros and cons on both sides.
Okay, so Commissioner DeBonne, did you say you would be willing to hear it? And Commissioner Henderson, you said the same thing?
Well, I'm thinking about it in light of what Dave was saying. I mean, that was my first blush, is it runs up the legal fees for both the applicant and the appellant to litigate it all in front of a hearings officer, then litigate it all in front of us. And I see what legal's saying about if we get a better case. I think all this could be. Is there no ability to toll all this while we wait? Or would there be no agreement on tolling or something? Or
I defer to Cynthia. I don't know what discussions they've had with the party.
So the applicant is in control of the clock. They have extended it 90 days thus far. So it would be up to the applicant to agree to toll that clock.
Well, that's the one that you're saying now runs out on September 6, 2020?
Correct.
I'm just wondering if there's this overlying issue of if the Supreme Court reverses something we've done, we're going to have to go back and rehear something else. We might have to rehear this, so we we keep working forward, and then does, but then we have to go back and do it. But it looks like we're getting disagreement back there that we're gonna have to hear this again, but I don't know.
I support hearing it.
What is it? It's only gone on for 15 years?
Yeah.
Yeah. And we're just trying to save a bit of time. Okay, all right, so, can you make a motion?
Approving order number 2020-016, calling up review of administrative decision file 24719-881-SP.
So I'll second it, but I do want to discuss just a little more.
Okay, there's a motion and a second, and Commissioner, further discussion.
Yeah. So Dave, so how strongly do you feel that it should go to hearings officer first? I mean, I think what we're saying is from a point of efficiency and spending resources, both the applicant, appellant, but, you know, from the county spending resources, because we're involved at both levels there too. Maybe just hear it here.
Well, I think it will certainly, coming directly to the board, definitely triggers quite a bit more direct work from legal, that we're going to do the work that the hearings officer would have done in many respects. And so, full disclosure there, that's certainly a concern in this current environment we're in, with all hands on deck for the virus and all the associated impacts. So, I think we're also factoring in this matter's been around for a decade or more, and so, another 90 days or 30 days or 60 days that it gets pushed out on account of running it through the hearings officer, in the scheme of things, is really a speck in all this. But we also recognize what you folks have just articulated, that there is some pragmatic reasons to have it come directly to the board. We're just giving you our recommendation. We recognize that there's pros and cons on both sides, and obviously are supporting whatever decision you folks come up with.
Tom, what did you figure out about the hearings officer? Who pays it?
Because it was an administrative decision, the statutory appeal fee for an administrative decision is $250, and the appeal would, by our code, go to a hearings officer following that. So because we essentially lost our opportunity to request the hearings officer deposit when we chose to do it administratively, then CDD would have to eat the cost of the hearings officer.
And how much is that?
Probably $3,000, $4,000, $5,000, something like that.
I think I'm good to hear it.
Okay, all right. So.
Right, legal.
Okay, we've heard from everyone. Commissioner DeBonne?
Yes.
Commissioner Henderson?
Yes.
And the chair votes yes. So-
Well, if I can, I was just kind of
You were going to say something?
led to believe that the applicant may have offered to pay for the hearings officer if you choose to go that route.
Well,
The applicant's the one that wanted us to hear it.
Yes. That's what we just,
so communicating with the applicant here, is that appropriate at this
no,
moment?
I don't think so.
Yeah. No, let's just leave it the way it is.
We made a decision.
Yep.
We've already amended one decision today, and I don't want to amend another one.
It was an emergency order, too.
And that was an emergency, but we changed the date, so I feel better about it. Okay.
So we're going to hear it then.
Yeah, we are going to hear it. Thank you, Cynthia. If there is an appeal, right? If. Okay. Great. Thank you so much.
Hopefully everybody will be happy.
Laura. Okay, Laura, 3:45. Okay.
Ready
Yes.
for me?
Yes, we're ready.
All right, Laura Skundrick with Administrative Services. I am here today to walk through the video lottery fund allocation discussion with you all. We are in a bit of a unique situation, as you all know. We have made our most educated guess on our funding from the state lottery. I've been in contact with the state lottery quite a bit, but they have not confirmed their projections even for this quarter. So,
What's your projection?
well,
Yes.
I can explain.
I'll tell you what mine is if you tell you.
Okay, I'd love to hear that. We chose to project a 1/3 decrease in the third quarter, which ended in March because bars and restaurants were closed, starting in March, and then a 2/3 decrease in the fourth quarter payment from the lottery, and then a 1/3 decrease in quarter one of fiscal year 21. So essentially, hoping that that's a conservative.
So what was your one for the first quarter of 2021?
For the first quarter would be 1/3 decrease.
Okay.
That'd be the month of July.
July, August, there, okay.
What, I'm kind of curious, do you know what percentage of the lottery funds come from the store lottery stuff versus the lottery machines that are in the bars and little things like that?
Don't know. I can.
You know what I'm saying? So because it seems like the store stuff is still going pretty strong. People can go there, although their economy, they're off. What's that?
Scratch tickets?
Scratch tickets. Although the economy's also maybe nobody's buying those either.
Yeah,
So
hard to say.
This is just video lottery, isn't it?
Yes.
So this money doesn't, so we don't get money from scratch tickets and things?
I believe so.
That's for the schools, I'm sure.
So where do you, in the second quarter, or this next quarter, the one we're in right now, you say it's gonna go down 2/3. Who's gonna buy the 1/3 and where are they gonna buy it at?
Well, we're hoping that by the end of the quarter four, in June, that things start to reopen and people can visit restaurants and bars again. Yeah, hard to say.
Did you find out whether the online version is considered video lottery or not?
It is not. That money does not get distributed. So there is online gaming still happening, but that money does not come to us. So I'm happy to.
It could get interesting politically, remember, because the commitment, the Association of Oregon Counties always reminds us that there's a commitment that no local gaming will happen in cities or counties. It'll be a state function, but there'll be a partnership and we'll have revenue that comes back. My understanding is the Governor's Solution Committee is funded by this before it even comes off. So we're a partner with the Regional Solutions also by helping pay for that. By hearing that online gaming system isn't part of this agreement, we may be getting farther away from an agreement that was intended on being a full partnership. So I just hadn't thought about that before, and we should keep an eye on that.
So if you'd like, I'm happy to walk through the exercise of allocating today, obviously.
Sure.
Okay.
Let's do.
I can bring up, if you'd like, I can bring up the spreadsheet on the screen if you're able to.
I don't know if we can even, can we see them?
Is that best to follow?
don't know.
Can you see that one? That's the best way.
That might be, yeah.
Okay.
And Laura and I had chatted about a few options for, as you do run through this, either taking it from the top, or if you want to start with certain categories, that's also an option as well. So I don't know if the board has a preference in the order in which you'd like to tackle the categories that are in the worksheets.
So is our goal today to do a first draft of the 2021 budget? Is that?
For video lottery allocations, that was the hope, and obviously, today has been a very long day and a busy agenda, and I think last year you did this over the course of a couple meetings, so
Right.
to the extent the board wants to begin the conversation or tackle certain chunks of this worksheet, we're happy to do whatever works best for you.
And then I'm looking at page 638 in our package, which is the graph of what, or it's the chart of everything we've spent or committed to spend. And it showed us spending 847,000 this year. But if we're down a third in the third quarter and 2/3 in the fourth quarter, that's the equivalent of we're down about a quarter. So does that mean we have 200,000? What is it, about 215,000 less than we thought we were gonna have?
So Laura can.
Or is that in the presentation?
What is that?
So I do believe, based on what I have found, I believe there was a conservative budgeting done last year as well. So a little bit of a buffer in there to account for things like this that would come up we were not expecting. So I did carry that forward as well. I think that was about 150,000, which is not showing in here.
It's not on this sheet. So there's 150 that you've just, that makes up what we're missing or something, or part of it?
Yes. And I believe the state video lottery revenue budgeted last year was pretty conservative as well. And so I believe even with our projected reductions, we would be receiving more than that.
Is this state video lottery revenue for the year 2020, that 750,000?
Yes, that is what was budgeted for.
That was the original budget? And so,
Fiscal year 20.
okay, so, and yet now you've added another 50,000 for 21?
Yes, because it was so conservative last year.
Oh, I think you better make it more conservative.
Okay, I'm happy to.
Yeah, like, I wouldn't be bumping that up 50,000. I mean, if it happens, fabulous, but that's not conservative in this.
Absolutely.
Yeah, I'm sorry, unfortunately.
Do you feel comfortable with staying with the 750?
I hope, let's hope so, but.
Well, see, I think the thing that you're saying that I've thought about is that it's, say we return to normal, the pandemic's over, but if investments don't go back up, everybody's lost a quarter of their worth, and I think even the real estate market's gonna lose it. So how fast that comes back, and then there's all these people who've lost jobs, so people aren't gonna, people won't be buying as much, but these habits get imprinted every day. I kind of feel like every day we stay in this mode adds 2 days at the other end of people not getting, or maybe it's a week. I don't actually know how many days, but these habits become built in. But we don't just go back to roaring. I mean, even like the recession in 2008 and 2009, it took 6 or 7 years to get back to where people felt good like they did, I guess. I mean, a lot of people. So I think maybe estimating even 700,000 next year's, or 650. I mean, I would be really conservative because we'll see. And were this just the first draft that we eventually approve in June? Is it part of the budget cycle?
I believe
We have,
was it last year? Yeah.
Yes.
And so, that's definitely feasible. And one of the things we had, and I apologize for Laura might have covered this right at the beginning, but we were going to kind of chat with you about, did you want to take that approach and be conservative from the start? And then if we get more than we expect, we can add to
Easy to spend
allocations,
it.
or did
Yeah.
you want to?
Yes.
So that sounds like the correct path forward.
Yes.
it'd be interesting, does anybody know what revenues we got 3 years ago, for instance?
It's definitely something we could work with finance.
It'd be interesting to look back, and it's probably grown over the last couple of years, hasn't it? I don't remember. You?
Yeah, it's growing.
Is it? Yeah.
I don't know the numbers on that. Well, so And 10, 12, 15 years ago, because this is what I hear, there used to be, big carryovers. There used to be big chunks of money, and it was kind of awkward to keep giving it away. There was money. So that was a different point in time, 10, 12 years ago. So I've never seen that, but I mean, it went through a decline, and then it dropped, and now it's, came back.
Yeah, maybe we could do a chart of what it's been over the last 10 years. I mean, what was it in the last recession?
Yeah, definitely.
History does repeat itself, so. that
Well,
would be
more
great.
than 10 years ago would be fun to look at, too. If we can.
Yeah, we're up for it.
Yeah, whatever.
Let's see, but one
2000,
thing though,
2000 on.
20 years.
the problem is this one, our tourist dollars were never really that impacted in the last recession. People still were coming here. You could see that it came down a teeny bit, but it wasn't horrible for tourist dollars.
Yeah.
Well,
We
this
didn't
one, our
create a
tourist dollars.
violation for them, a penalty if they came.
Yeah. So this one's gonna be quite a bit different. And if they're not coming here, they're not driving here, and we're not getting the gas revenue. So it goes together.
Okay.
Would the board's preference be taking
Okay.
this from the top or taking it section by section? You could start with service partner agreements or economic development, or we could just run through from the top to the bottom. It's really,
So my goal before the end of the day would be to get X amount of dollars out to Mountain Star Relief Nursery, LaPine Senior Center, and Reach in Redmond. I'm just saying, if we could commit to some kind of number out to a few organizations today, that's really the action item I'd like to see, because we could study this all afternoon.
So those are.
I'm just saying,
Is that?
if we spend a half hour on this, I still want to get something done. You said you were going to leave at 4 o'clock, Commissioner, so.
Yeah, I guess I don't have to now.
Okay.
I'm good.
I was kind of
I
cutting to the
should,
chase.
but you're gonna use me as a way to get out of here. Are those those three you mentioned, are those in here?
Well, remember, we had some COVID requests on Monday, and we have our discretionary grant program, so that's the
So-
next agenda item.
Could we do the discretionary grant? I think it would be a lot easier today, unless you're saying, can we do that? Is Mountain Star on the discretionary grant? No, it's not.
So, yeah,
They're not,
we're gonna
and
switch gears here. and
weren't
just
they
talk
needing-
about discretionary grants.
Okay, they were needing what? Weren't they asking for like 5,000?
That's the black notebook, right? So you're saying we don't go any further with lottery funding today until we find out a little more about how much we might have, or is that what we're saying?
I think what I hear Commissioner DeBonne saying is it'd be good to make the discretionary grant allocations for Q3 since
Right.
those are a little bit more immediate, and then we could, with time remaining or at a later date, revisit the broader
Okay.
video lottery allocation
I'm
discussion.
good with that.
I think it makes more sense.
We can do it at a meeting
Everyone's
that's
worked
not
pretty
quite
hard
so
today.
jam-packed.
So Mountain Star was a funding request on Monday, and it was in our packet, and it was $5,000. And I remember I mentioned, let's just roll it over to the next week, because I knew we were gonna have this discussion. So they were asking for $5,000.
Which is a match with.
Yeah, matching for sure. And it's full-on capital. They made a commitment to purchase a facility, and they're gonna just need to maintain it and do everything. So, if it's $5,000 or some amount less, that's probably okay, but I do support coming up with something. So I'm just letting you know. It's one of my.
What's the source of that funding?
Right.
Well,
The discretionary grant, is that the,
That could be included on this worksheet under either economic development or project support. It could be.
It's under project support. No increase requested. They had 18,000 last year, but they're asking for the special 5,000?
So that is their service partner agreement, and that's actually a separate request.
Oh, it is
That's
separate.
operational. This
Okay,
is capital.
so where's this one gonna come from then?
the one-time project fund affordable, is that, or?
Yes, I believe last year you used a one-time project fund line with the idea of using it for affordable housing. We could do something similar like that for Mountain Star's request.
It's just a one-time request.
Okay. All right. So can we have a motion to do it for Mountain Star from the one-time project fund affordable? It's not gonna be affordable, it'll be Mountain Star?
So we're really changing the use of that money. That would have been something we would use that 20,000 like for a vet village or something like that. This is, we don't have any other funds we could use, or is that?
It could be an additional line, one-time project fund Mountain Star, I can add, rather than taking.
Okay.
This year, so to keep track of it for this year's expenses.
Okay. So in order to do that one, can someone make a motion then?
So I'll move approval of $5,000 for Mountain Star for capital from the funds as discussed.
Project support, one-time projects.
Thanks, I wasn't looking at that.
Okay, and is there a second?
Second.
Further discussion? Commissioner Henderson?
Yes.
Oh, sorry, Commissioner DeBonne.
It doesn't have to be in the order that.
Well,
We do it that way, though.
I respond to my
It
name.
helps me a lot more. It's a better deal. Okay, so that's all we're gonna do here. Now we're gonna go to the, we're gonna go to the discretionary fourth quarter because these people are all asking for help.
Did we vote?
Oh, all in favor?
Yeah, I think we did. She was calling our names back.
I called them backwards,
I know,
remember?
I didn't know if I got some.
Well, that's what
I
happened.
said yes when she called my name.
And you said yes when I called your
I
name,
know.
and the chair voted yes. Thank you, Samantha. Okay, Laura, back to you. It must be 7 o'clock somewhere, right?
So for quarter four of fiscal year 20, we received 10 discretionary grant requests and 2 fundraising requests. 7 of those 10 are specifically noted for COVID-19, either impacts or their community response. So I'm happy to, if you'd like, go through each application.
Well, real quick, don't we have, let's see, we have about $22,000 available for this $27,000 worth of asks? Is that right?
About 29, including the fundraising.
We have it, that's a different
But
category.
between ours,
Oh,
though,
I'm sorry, yes.
for R3. So we can almost do everything. I did have one question. The Bethlehem Inn, on that page, you've got 19 repeated twice, so I'm thinking
Oh, the May.
May 8th, like, so is that, one's 18 and one's 19, or what's that?
I can look into that. I'm not sure off the top of my head.
Okay, all right, I just saw that.
Yes, thank you.
So 29K kind of scheduled in, this is the fourth quarter, so this is the last time we're doing it in an organized quarterly fashion. And that amount is covered, even if we have, the estimates that you came up with. So we can think of that full amount right now, basically.
Almost.
How do you say that it's covered? It looks to me like it's a little bit, we have a little.
Oh, no, I meant, the money, the estimate for the fund is available for that allocation of 29,000.
We only have 21,718 for R3 commissioners ones, which would,
I'm just referring to money in the account that we're talking about, not spending it yet. I was referring to the first half of that equation.
Which was allocated for discretionary grants,
Yeah.
yes.
okay, so we're actually like, we're, so we're actually like 5,200 short if we were gonna fund all of them, all 10. So then we need to go through each one. Can you do that?
Of course. All right, so starting with Bethlehem Inn, this is.
But that's the fundraiser portion of it.
Oh, yes, I'm sorry, I was starting just first.
We started the, yeah.
Right side. Okay, so, Right Side Animal Shelter, Animal Center, excuse me, they have been impacted by COVID-19. They've closed their thrift store. Their shelters are closed to the public, and they've suspended their recycling program, and those 3 funding streams account for 75% of their income. So they have seen a lower budget than they had expected. They've canceled fundraiser events. They're down in donations due to the impacts on everyone else. So they are requesting $5,000, which would go toward general overhead and operating expenses.
So, just as a curiosity, when I ever looked at this, it was like, Well, why would you stop the bottle and can recycling? Why can't you, I mean, I'm gonna take my bottles and cans back
No,
if I couldn't.
they're still doing that. I'm still taking my bottles to Brightside in Sisters. They have a trailer there.
Really?
Yeah.
Okay.
And when you say close at shelter, you mean they're not taking in dogs or cats or anything, or what's that mean?
They are not allowing people to come in and adopt animals. So close to the public.
That's interesting because all the shelters in New York City are out of animals because everyone has realized having a pet
Yeah,
is
that's just
such a nurturing thing.
Yeah, that's right, they are.
Yeah.
That's right.
Yeah. Yeah, I mean, I would think they would be.
Maybe it's changed since they submitted their application.
It says that April 1st they have
Yeah.
applied, that's only a few days ago.
They had originally, yes, they had originally applied for a different reason, and then they just,
Do they have other sources of charitable funding, or, I mean, they've closed their income generating things, I guess, but,
They usually have a fundraiser, and I think
It's-
they had to cancel that too. Wasn't it like it's supposed to be in March?
they postponed it, I believe, and I
Yeah.
think they'll be applying for next quarter for funding for that.
It was on March 14th and it had to be canceled. So, and last.
well, I would do 1,000.
Okay,
1,000.
okay, so so 3,000 there?
1,000 each, okay. I'll listen as we go.
Because we're gonna get more asks before this is over.
Okay, so now where are we at? Next one?
Cool.
Okay, so Council on Aging, they're also responding to the COVID-19 crisis. They are hoping to provide shelf-stable meals to their clients. They've had an increased demand due to everything going on. And they, along with their normal meal service, also would like to provide shelf-stable meals to clients in case of a disruption in service in the future. So these essentially be meals that they could stock up and have for emergencies.
1,000.
Okay.
So, we'll
So
do
everybody does 1,000,
750.
we'll round it up to $3,000.
No, they're asking for 2,500.
I'll do 750.
Okay,
That gets us to 2,500.
okay.
We don't have any money to round up.
I'll do.
Let's try it.
I'll do 750 also.
It's great that we can help them.
Okay, so the next request is from Equine Outreach Incorporated. This is not related to COVID-19. They are a physical rescue, rehab, and rehoming shelter for horses. They are asking for $2,500 to establish a community outreach specialist to provide community education, advocacy, and oversee their grants and fundraisers. So the funds would be used to pay the costs of that position.
So this is to lower the number of law enforcement interventions and seizures.
So I know Gene, the applicant here, but I'm not going to be supportive at this time. I'd rather be doing emergency food and shelter for some of these other organizations at this time. This is hiring somebody to expand their mission.
And this is also for a conference, they say. Horse
Yeah, so I
rescue
mean, that
conference.
doesn't sound like the right activities at this time.
I know unfortunately, and the Oregon Youth National Guard works there for them. Anyway, but I know they can't work there right now, I don't believe.
I'd be responsive because it's during bad times that people don't take care of their horses. But
That's gonna definitely be happening, so.
I wouldn't do it for a horse rescue conference.
Okay, so,
Oh, wait, maybe no, that isn't this year. I'm sorry. I'm reading what we have done. Okay. So they want 2,500. Well, I'd do 1,000.
I'll do 500. So now we have the family kitchen.
Yes. So the Family Kitchen provides free meals to anyone who needs them, and the funds would likely be used in July. They're requesting $2,500. July is when their donations typically go down throughout the year, and they would provide 694 Family Kitchen meals with that money, alongside with food donations from the Fort Market. So they operate under the Trinity.
Episcopal Church.
Episcopal Church.
Thank
I
you.
know that.
So it'd be 800 a piece would give us $2,400.
Okay,
I'll do that, 800.
Okay.
right.
So Friends of the Children are requesting $2,500. They provide mentors who build relationships with youth in Central Oregon. They are currently not able to do their in-person visits with students in the schools and the communities, but they are now delivering academic supplies, food, and essential supplies to families in response to COVID-19. So the funds would help continue supporting the supply of essential needs to families and support the operations for staff and volunteers for the program.
I can do 1,000 for them.
I'll do 500.
I'll do 500.
Okay, next is Jericho Road. This is also providing emergency assistance due to COVID-19. They provide services in the Redmond area. They give hot meals and weekend food packs, as well as essential supplies to the homeless and the hungry. So they're requesting $2,000. These funds would provide about 250 to 300 meals for those needing emergency assistance in Redmond.
And that's where we just gave the vehicle to, correct?
Yeah.
Okay, so,
I'll do 1,000 on that one, so then we can do different things.
I'll do 500 or whatever. Probably
okay, I can do
doesn't work.
500.
There you go.
Okay, we received a request from the Lapine Senior Center. They have closed due to COVID-19 and are seeing the budget impacts from that. So all activities have been canceled, but they are still providing meals to seniors. So they average about 68 to 75 seniors per day. They do the drive-through service for them, and the city of Lapine has offered to match the $1,000, which would provide just over 3 weeks of the service.
Well, I'll do 500. Let's give them 1,500 instead of
There you go.
1,000.
I'll do 500 too.
Okay.
I just bought them $170 worth of cookies.
Oh.
No, I did, when I did the meals the other day.
Well, you're in for another 500.
No, I'm not.
Yeah, sure.
I don't know if I can or not. I want to help Shepherd's House, and
That's
I
fine.
I don't
Not a
know
problem.
if I can do that.
Yep, not a problem.
I mean, I did buy cookies. I did do that.
Good job.
Yeah, well, it was like,
I helped deliver some meals.
Well, I'll give 750 then.
Okay.
okay.
Well, yeah, me too then.
Okay, you guys give 750, and then I'll have money for Shepherd's House. Okay, thanks.
You're keeping track of us, right? So you know how much we have
We're
left?
keeping track of ourselves.
I'm not keeping track of myself.
Yes, you are.
I have no idea what I've spent.
I know exactly how much I have left.
All right, so.
Well, you get a gold star. As my,
Well, I have
as
to.
my mother would say, you deserve a gold star.
Well, I don't want to overspend.
Next, for non-fundraising would be the Redmond Rod and Gun Club. They are requesting $2,500. They provide a safe firearm shooting facility, and they provide instruction on handling. And these funds would provide a permanent landing to establish restrooms for ADA clients.
So full disclosure, I'm a member of this.
Okay.
And I do like them. It's kind of a, it's got a lot of activities. They had a good function earlier for fundraising. I'd do 500 if.
Do 500.
I can do 500.
There you go.
Okay.
Partially there.
Thank you. Next up would be Saving Grace. They are applying for COVID-19 relief. They're requesting $2,500. They provide services for domestic violence and sexual assault victims. And their fundraisers have been canceled. Donations have been delayed that they depend on from other businesses and individuals.
Saving Grace?
I'll do 1,000.
Wait, is that the one? I went to a fundraiser. I thought it was for Saving Grace. It was a huge fundraiser. They did a lunch at Tether Row and a dinner. And yeah. And it was like right before everything crashed. Yes.
Yeah, it said all fundraisers have been canceled for the remainder of the year.
For the remainder of the year. But, okay. I really thought that's what I was at. Okay. All right.
Sorry.
I know I wrote a check.
1,000, okay.
500.
Okay, I have to wait and see how much I have left.
How much do I have left?
How much do I have left?
You said you were on top of it.
I didn't add them up, I just wrote them
I
down.
assume that she's,
Commissioner DeBonne, $1,227, and Commissioner Henderson, $484.
And what do I have left?
2,107.
Well, I want to help Shepherd's House, so.
Okay, so we can talk about Shepherd's House. They provide long-term recovery and community and emergency services to the homeless. They are requesting $4,000. These funds would help provide emergency food boxes and health and hygiene supplies.
so I want to fund them too, and I don't have enough left. So I'm going to reduce my Saving Grace to 750.
Well, and another way to do this is just to kind of round out the numbers with the balance in the fund and not really worry about the specific line item by commissioner. I'm just saying, we can just kind of
Okay.
get there and not have to worry about slicing.
Because I'd like to do it closer to 1,000 for Shepherd's House as a minimum.
I support that.
Maybe I could take down something else I've
Okay.
given.
I can do 1,607 to Shepherd's House, and I can then do 500 to Saving Grace. Does that help you out?
Shepherd's House.
You,
Commissioner,
Well, it doesn't help me with Shepherd's House.
Commissioners, I know in the past when we talked about the Shepherd's House, they didn't meet the guidelines of the,
Nonprofit.
yeah, but I mean, it's just something we may want to revisit or,
What is it?
Faith-based community not coming in as a 501c3, it's a church. So it just kind of jumps out of one of the parameters we've imposed.
here's it's a public charity status 170B, 1A.
Yeah, so I mean, they do good work. And
They do incredible work, and
we've been in that spot where.
you know what? The work they do, I hear about it all over the state. People that come and graduate from their programs. If we can't support them in our local community,
I'm willing to support them.
good, okay.
So I could take something out of one of my other ones to get to 1,000.
Okay, so
I
we're
don't
just
know.
over by about 516 for you.
Well, I reduced Saving Grace by 250, so I should
wanna
have
do that,
6
okay.
something. And there's something else back here I can probably,
Well, and then Jenny O'Keefe from Reach in Redmond sent an email saying they are just upside down right now. So if we could help them, and I know they didn't get an application in, but they've tried to keep their doors open. Everything stopped. She's got all kinds of commitments. So I don't know if we could come up with X amount. Anything's going to help. I think she was saying $30,000 in the next month just to keep her doors open. So, and she's not going to be able to keep doing that, but I think she's got commitments. So I'd support with if there's something.
now the source of all these funds is what? Lottery also, video lottery. So it's the same thing we were talking about before, it's just this is this year's.
So,
Okay, that's that's right, it's the
yeah,
bottom,
spend every dollar, right?
the bottom items down here where we each have.
Reallocated too, 'cause we're at the end of
Right.
So Commissioner,
$1,000 for.
Okay, Commissioner
Shepherd's House, okay,
Henderson
thank
needs to
you.
get clarified.
so then Commissioner DeBonne has an extra $227, and Commissioner Henderson is over by 266.
Oh, there you go. Well, and then as I say, fundraising is two requests for, some X amount, and then that's another, this is the last quarter for.
Well, several of these people have said we're replacing fundraising. I mean,
Right.
so I guess in an emergency time, that would be a reasonable thing to do, is say, so we could allocate some of our fundraising to those.
So, as $5,000 to reach is a number. I'm just throwing it out. And that's after school or.
Well, I wouldn't be surprised if we get some other, we're just starting the fourth quarter, so if we left a little bit in somewhere, it'd be good.
Just remember, in January, when we did this, there was hardly any applications. Just look what we will be
Yeah,
going
it's
to.
booming.
And I told everyone to get it in now. I said, because it's the last day. I mean, that was the rule. And our program's been around for a long time. So, yeah, I know. Remember, we just hardly had any third quarter. It was really light. So, and now we have all this. So can we go through the fundraising then? Of course. So we actually have a balance for fundraising of $7,600.
Yes, that is correct.
So do we give, okay, go ahead, sorry. I know, I'm just trying to
So Bethlehem Inn has requested $500 to $5,000. They're an emergency shelter serving adults and children experiencing homelessness. They hold an annual fundraiser aimed to raise funds and support general operations and raise awareness. So this is the Spotlight on Homelessness fundraising dinner that is scheduled in May.
Well, they won't probably have it.
How about $2,500 to use however they want?
And then we could use the other $2,500 for, would Reach qualify for that? Or we don't have an application for them?
Well,
I don't have that information.
it would be a non-standard application by the email I received, so I can help go back and fill it out if you want.
But I think, I'll bet we're gonna get some others, and I
We're
would
gonna get
be-
some others, and it wouldn't be fair if we, yeah.
Maybe part of the,
But if we open up.
one of
another
these
round,
other, yeah.
It'll be bad possibly. I mean, maybe it's better to close it up right now too.
So the Latino
Is this
community.
the only source of funds we can use to fund these agencies and nonprofits?
No. Actually, as we had the discussion earlier when we were talking about Terrebonne, you do have some discretionary money. You elected contribute $250,000 towards an emergency fund for other things related to the pandemic. You could elect to do something similar for struggling nonprofits or even businesses. It's just
And they also have funding available through the government.
Nonprofits.
Yes, so
Yeah, that's
that's,
something, do you know to tell them that, Laura? Have you been
Yeah,
talking to them about the federal funding? Yeah.
because they've opened it up to 501c3s at least. So is Reach a 501c3?
I think we've funded them before. It was just an email I got.
Okay, well, anyway, I mean, so before we gave the Latino community, we gave them 1,500, 1,600, then we gave them 500. So now they want 2,500 for their fundraiser. So if, we can't really miss this money up, can we? I mean, if we have 7,600 and if we gave them the whole 2,500, we'd still have 2,600 that we can't pop that up to somebody above, can we? That's really like making a fundraising issue.
These are lottery dollars. Somebody already risked it and gave it away. It came to us. These are the most flexible dollars we have. We put it in the spreadsheet and we allocate it this way. So we have full authority to spend it however we want. So that's just our accounting system, as an accounting.
Nobody's telling us that some of it has to be fundraising and some has to be just other stuff. It's just we've created that system.
Okay.
Or our forefathers.
Just full disclosure, the original objective of lottery fund dollars was for economic development. So that's the sort of the general backdrop. This board long ago made the determination that assisting service partners, social-based nonprofits, does contribute it to the economy by getting people back on their feet again or getting people stabilized. And we've written that or documented that in our annual report to the state each year, and it has never been questioned. So just in terms of the full parameters of what we do,
As
that's.
I say, the spreadsheet is where we do those main, and, line items for the chambers, or not chambers, but EDCO and all that activity too.
Can you-
So that's big money.
Can you tell us quickly, what have we done for, like on the first page, where we have the request of 5,000 for Brightside? What are we giving Brightside total?
3,000.
Okay, Bright Sides gets 3. Central Oregon Aging, what are they getting?
2,500.
Okay, so Equine Outreach.
1,500.
Okay, Family Kitchen?
2,400.
24. Okay, so Friends?
2,000.
Okay, Jericho?
2,000.
Okay, Senior Center got 1,000, right? Redmond Rod and Gun?
I have. Yeah, for senior center, I have
1,500?
750 from.
Oh, okay, oh, that's great, so we went over there. Okay, or you guys did. So Redmond Rod and Gun?
Is 1,500.
Okay, Saving Grace?
Is 1,750.
Okay, and the Shepherd's House, how much did they get?
3,607.
Okay, they're right.
Although, with those totals, we still have Commissioner DeBonne with 227 left, and Commissioner Henderson 266 over.
Okay, so he's still over, and Tony, what do you want to do with your other $200?
See, I'm advocating for $3,000 for reach, so I'm talking deficit numbers here too.
Okay. Well, I think, if we do need to open it up, I think we need to make it open for more people than just reach, honestly. Well,
Put a message out to the community if you need money.
well, call the federal government because they have a huge,
Yeah, but
yeah.
I can't, that's just an awkward situation because a lot of people would spend a lot of time filling out and then, just like every bank right now, how many applications can we handle? It's wonderful we're closing this process up.
Okay, well, they didn't follow the rules and they didn't get it in by the end of when they were supposed to, so I don't.
Reach, you're saying.
Yeah,
That's fine.
I'm
No,
just
I'm
saying
not-
like,
yeah.
but if we can have other funding available, maybe Tom, you can tell us what the surplus funding is, maybe we can help the community.
Let's close this process up.
Yeah.
And have that discussion.
Yeah,
So
I do,
would offer to put that money to Shepherd's House is fine.
Okay. Did I also hear for the fundraising requests, did we land on 2,500 for each?
is that
Or
okay?
are we-
Yes.
Okay,
To be, and not that, with less requirements than fundraising right now too.
so we still have $2,600 there that we can
Exactly.
spend, so do we spend it above? Everything is. We did a pretty good job of helping out the community. So Tony's is plus like 200, is that what you said?
He just suggested adding that to Shepherd's House, so I did
Right,
that.
so how much is that?
To Shepherd's House?
Yeah, what's that total then?
20,
or 38 something?
Threw it all in her head.
yeah. I need a calculator.
She's got it on the spreadsheet, but it's not all.
I'm sorry.
No, you're fine. Commissioner Dare was 1,607,
Yes,
and Commissioner DeBonne was 1,227.
okay,
Commissioner Henderson was 1,000.
all right. So,
And he did suggest he wanted to take away from somewhere else.
okay, so we're talking 3834 for Shepherd's House, so that's really good.
Yeah.
Okay, so that's great. So what about leaving that other 2,600 there right now for the second? Do we want to do something with, is that okay? We still have $2,600, well, Phil's got to get something down, but we still have the 2,600 under fundraising. Because that has 76,
I would support his deficit to be covered by the other fund.
okay.
Okay.
So we'll take that from the other fund.
Okay, perfect.
So then we're good, right?
And then there will be a surplus in fundraising. Okay.
Right, and what was his, he was 260? 266 over, okay. Great,
Okay.
okay. So,
All right. Thank you very much.
so that's 2334 then is what we have left in that fund.
Oh, thank you for doing that.
Oh, you're very welcome.
So if Reach sent a
Yeah.
application in right away,
Yeah, just tell him that we're gonna look at our surplus funding and, if somebody else calls us and says, we,
next week or
Right. Yes, of course.
Would you say surplus funding? Who's got over
here, is that right?
23, we took your, from the, no, we just made you positive. We took it from fundraising over to you so that you're in the positive.
You're at zero.
Everybody's at zero now.
I could change something up above.
No, you're okay. We still have 2334 in the fund. So, if we find some more surplus funds,
Well, so I'd like maybe a little bit more direction on that. It's not like we have surplus in the sense that we got money laying around. So anything, whether we're talking property tax or TRT, that would be designated for something else as part of our budget process, whether that's our capital reserve or other things that we fund. So rather than just saying how much surplus do we have, it would be useful if the board kind of decided on a number, an
Okay.
additional amount that you'd like to make available to nonprofits under the pandemic umbrella, whether that's, 20, 30, 50, $100,000, and then Greg and I work together and we'll come back with a proposal on, or a concept of where that money could come from, which you can weigh in on and decide if you're comfortable with that, and then we could, do some kind of a solicitation where you could invite applications for emergency funding.
So part of that, though, to me is how much are we going to fall off in revenues on other things? So,
Right.
I mean, are we going to have to backstop the money we're not making at the Fair and Expo? Or are we going to have to, other things like that might be going down? I don't know if the road department won't be, we probably have enough built up there for the short term, but maybe we don't, maybe we have to, I don't know, I think we have to go through all the departments and look at that. I'll bet you by the time this quarter's done, CDD will have less revenues coming in than we anticipated, because people are gonna stop doing stuff. If it continues, all the
Right.
people with money are not gonna build their houses they're gonna wait just like we are and say, wait a minute, what's this mean to me?
How about if we just act like there's a fifth quarter? What was the number that we used originally to do the discretionary grants?
Isn't it 80 and 20 or something?
60,000.
Oh, 60 and 20?
4.6, so it was 20, so for another $1,500 or $15,000. $15,000 round, so it's just make it look like 5 quarters this fiscal year.
That's a good idea.
Which would be the extra 15,000. You like that, Commissioner?
Fine.
Yeah, good. Well, so there's direction for Tom then, 15,000 to
Yeah.
make it an extra round.
Yeah.
Just like we did the other 4 rounds.
15,000 in case people,
So would you like Laura and/or Whitney to put together a new solicitation?
Yes.
Without waiting for, 15,000, it's pretty easy to identify where that could come from.
15,000, it might make a difference for somebody, but we've got to be really careful for us.
Well, 15,000 is the total, or 15,000 a person?
Total.
Total.
So it's not that much.
Yeah, so it'll
No.
be a few, 2,500, 3,000.
Well, why don't we start with that, but see what we get in the next month. We may get more.
Not do a solicitation or just wait till they come in or
I'm sure I'll get 3 calls tonight when I'm driving home from people who go like, oh my gosh. You see some of the amazing programs that are going on and the history of the programs, it's really unbelievable. And it was like Brightside actually had not applied for years, and I remember when they came in with a proposal not too long ago, and I said, oh my God, why aren't you guys applying? Historically, they had, and so it's good to see that they, got in this time. And definitely the fact that they didn't have their fundraiser, which brought in 18,000 net last year for them, but I know I'm still recycling to them, so.
I'll look into that.
Well, it doesn't say don't drop it off. at the recycling center, so, you know, they're in Sisters and Tumalo, and they're all over. Okay, great.
420,
So-
440, I mean, 435.
Okay, so is there,
So we are not moving forward with the fifth quarter and offering a solicitation, is that correct?
Sounded like they wanted to make 15,000 available. and we can
15
decide
available.
for those. So the question was whether we ask people or invite people to apply or just wait and see what comes in.
What are we gonna do when we
we
get
have to make it fair.
$100,000 worth of requests?
Yeah. 15 will seem like a drop, but maybe.
I don't know, but I think we need to know if we can
Well,
do more or not.
We could go down the list of anybody we've ever partnered with in the past and just kind of do some specific outreach. Because you're saying you'll get some calls, and I've got some relationships too. So I may just be a little strategic about, you know, food, emergency food and shelter, which is that other opportunity that we're trying to fill, so we
I'm-
can stabilize lives, so then they can, you know.
I'm very aware of charity because I did an analysis of for my taxes, and somehow it flipped. And, you know, there's a lot of really important things like Assistance League, you know, what they do for kids. There's a lot of really good programs here that definitely deserve, and they're not, everybody's numbers are gonna be down. And, you know, and you just have to think.
But we're just, you know, other than the lottery funds, we're spending just taxpayer money.
Right, and we can't do
So-
that. I get that.
So what, I guess, I don't know, I wouldn't put out a solicitation yet until we have a better idea where we are and stuff, because,
People might be listening to this meeting now.
yeah,
You know, you, just as a reminder, last week you authorized United Way to go ahead with the emergency food and shelter process. That's $75,000, I believe, that they're doing now on your behalf with your money. So that, it's not like the money that you allocated today was it. There was a whole nother pot that is being distributed now under that same umbrella.
And that's next year's money, right?
That's this year's.
Fiscal year, it just went out a little early.
well, what I'd propose is we revisit this next week after we dealt with a lot of stuff today, we've got it in our heads, let's think about it a little bit and see where we are on stuff. That'd be my suggestion, not make a decision today.
Okay, Whitney, did you have something you wanted to add?
No, not at this time.
Almost.
Okay.
Okay, thank you, Laura. Laura, and what I'd suggest, if you could possibly do this, if you talk to people, please help them fill out the federal forms. If you can get really familiar with that process for them. I heard today that it's taking for the $10,000 grant forgiveness thing, they were told 8 weeks in order to get that check for that 10,000. Which, you know, is kind of like a lifeline for a lot of like smaller businesses. So I have Congressman Walden's office working on that. I'm like, 8 weeks, that seems,
You know, that's the one I went online to look at, and the form's pretty simple, so.
yeah.
it-
But they're telling them 8 weeks to
Yeah.
wait for that money. And so I just think we need to be so helpful to people.
Well,
It's
so that's a
overwhelming.
different question of would the best way we could spend money be to hire somebody to help, or have somebody we already have, their job become helping people fill out applications or directing them. I mean, I've always thought that would be a valuable service that, I don't know who does it now, but, I mean, that would be something we could use staff
I don't know
power
if you
for.
have any time to do that, but I just think you're the compassionate person. No, really, you are. And if you aren't, you will be, right? Anyway, I just think if you could be really helpful to people, they're just really overwhelmed.
Yeah, I'm happy to help.
And it fits with, and normally the federal government does not give out money to 501c3s.
Well, you know, in some of the counties, like Mark Bennett from Baker County was talking about, they call it a economic recovery resource center or something that they've set up in their county that's really more focused on helping people financially by, you know, you could do that with the $10,000 thing, and you could do that with the PPP stuff and I mean, I don't know who's doing all that now, but, I mean, I thought you could do it as a business really for people to offer to fill out their forms for them.
I know,
It's a
and I'm
pain.
sure there's people out there that would really appreciate that.
Yeah,
So,
but,
well, can you give us feedback? Just say, oh gosh, I just talked to so-and-so and I told them, so that we know we are making a difference.
Yep, absolutely.
Thank you. So, is there any other further business for today?
Well, so we had an executive session.
That's
scheduled.
right.
So I don't know if you will have time to jump into that. We also had two quick follow-up items related to coronavirus.
Okay.
And I have a couple questions too related to coronavirus.
All right.
So would you like to do coronavirus?
Sure, why not?
Do you think you'll still have time to do the executive session, or should we cut them loose for next week?
What do you think? Cut them loose?
Well, it says property in Redmond, right? So I can tell you what I'm gonna say is I wanna hear about it, but then I'm gonna wanna go see it. So I've never even seen it. They've been working on it for 2 months, and so if they wanna come in and give an overview, we could ask a few questions, but really, I'm gonna wanna go see the buildings, 'cause I don't even know where it is. So I'm game to spend 15 minutes talking about it.
Okay, fine.
Are you guys? I mean, I am. I've looked at the documents, so.
All right. Whitney, did you want to talk about the virus?
Yes, can I take that first other item? Oh,
You jumped in front of Eric very well.
He's, just quickly on the email that we had discussed sending, notifying property owners of the enforcement actions that would be put in place related to the order on short-term rentals. I've been working offline with CDD and the sheriff's office and a couple other folks, and I wanted to check back in with the board and see if you would be comfortable with us delaying a day on that email. I think the main question that we're going to get when we issue some kind of a note to the media and also an email to property owners is, how do I report if I think a neighbor is in violation of this? What are the steps I take? What's the phone number? What's the website? And I just want to make sure that we have that information in place before we issue the communication, and that we also have circulated that draft with the law enforcement agencies, Sun River, Black Butte, and also obviously the sheriff's office. But that would be a delay from not sending it today and holding it for tomorrow. Would that be okay with the board?
Well, so that's, how do people report a violation? I'm mostly concerned with the people that might be on the hook for a violation, knowing that we even passed a law. So they're two different issues. Are you just trying to get them both in the same email?
I'm worried.
So if you're a bad guy, we want you to know we passed this law, but if you're a good guy, this is how you report your neighbor?
Essentially, yeah. I think if we send out the initial communication without the how do I report piece in it, we're going to get a lot of follow-up questions and calls with that exact
Well,
question.
I'll bet we already have some reported people.
I think.
I'll bet I have emails up there already that,
Right.
so I'm not very worried about whether people are gonna figure out how to complain.
Okay.
But I guess the whole point of giving it till Friday is get the word out, so we're gonna lose a day till Tuesday. You're
Well,
saying just do it tomorrow?
I think we can get it done tomorrow late morning and make sure that we.
11 o'clock, I heard, was the best time to release things.
Yes, 11 a.m.
Okay. If that works for the board, we'll plan on that and get all our ducks in a row.
Thank you.
I'd be interested to see the message you're sending out.
I anticipated that you would, and I'll get you a draft before the end of the day today.
Well, or in the morning's fine too, so.
Thank you.
Thank you, Whitney. Yes, all right.
About a week and a half ago, the board approved partial closure of county buildings with a mark to revisit it on April 10th, which is this Friday, so I just wanted to bring that up. Does the board want to extend that?
I did hear that the federal government is saying, quit applying for passports. We don't want you going anywhere. And so I have of course, in Oregon, we don't have driver's licenses that are recognized. So, I just thought that was kind of an interesting government decree from the federal government regarding passports. So it could cut down our business a little bit.
Well, I thought the clerk's office quit doing passports.
That's correct.
Oh, they did?
I don't understand why, but, because we do need them for our driver's license.
Yeah.
Alternative.
I think two main reasons. One is it's not really a central function for the clerk's office. Yes, it's an important function of the federal government, but not necessarily an essential function of the clerk's office. And the second is the amount of time and in-person interaction it takes to walk somebody through the passport process. It's about 20 to 30 minutes.
So I support us extending, but at this point, a week or two, because at some point, just like we're talking about the masks at the grocery stores, people are gonna just need to put a mask on and go do your business, wash your hands and go do your business, and I don't know that we're gonna
Well,
hold
May
this for a
1st
long
is
time.
is a Friday, so how about till May
That's fine.
1st?
Yep.
That's
Okay.
3 more
Rest of this
weeks.
month.
Yeah, I'm in favor of it. 3 more weeks.
That's
Yeah.
a Friday?
I mean, if something changes, we'll know, and we can, it's easy to open it.
Yes,
Okay.
and that's not too far out.
We have a minutes motion for that.
Could I have a motion, please?
You said May 1st?
Yes, May 1st,
Weeks.
Friday, May 1st.
I'll make it.
Yeah.
Oh, you make it?
To keep our facilities, doors closed to the public. Partially access till May 1st.
A second.
Further discussion? Commissioner Henderson?
Yes.
No, I'm looking at DeBonne.
I can vote first.
I just stared you down on that one and you did it.
I can't. Commissioner DeBonne?
Yes.
Commissioner Henderson?
Yes.
The chair votes yes. Must have been a long day. All right.
So I have a COVID thing. So I'm a little confused on who speaks for who within the health department. So we got this email from Dave. I don't know. Dave, are you still on the line?
Yes, sir, I'm here.
So he clarified part of what we've been wondering is that we're the local public health authority. Dr. Conway is a local public health administrator. And then what is Dr. Fawcett?
The deputy public director or something.
Chief Medical Officer, I believe.
Yeah.
So, as you probably tell in some of these meetings, I have some problems with George being the one that's always speaking for the department. And so I'm wondering, I thought Dr. Fawcett was really good today. It was really clear, simple. And then I would like us to speak sometimes for the public health, as a public health authority, and it related to that one, to just communications. And so I don't know, I've never been in this situation, but a lot more people know the three of us than know Dr. Conway. Dr. Fawcett's probably pretty well known among his clientele, but I don't understand quite who makes what decisions. And so, I don't know, I guess I'm looking to understand that better, but, anyway.
Well, I think that one-on-one meetings have been set up with the three of you this week with health staff. So that's number one, an opportunity for you all to ask direct questions that maybe you've not gotten the answers you have sought so far in terms of specific demographics and affected individuals. So those are coming in terms of, you are the health authority, so you could very well have a expanded role in terms of messaging. So I don't know if you'd like to have, kind of just tell us what you'd like, or have more of a group discussion on what areas that you would like to speak on.
Well, as that's great, we have meetings with it, but that really isn't the issue. The issue is being able to speak out in some way. And so I feel this resistance about talking about things that everybody else is already talking about. And it's like, I watch what everybody does at every other level of government, and people are talking all the time to the people about elected officials. So I think part of it's having good sources of information, but Commissioner Bone brought up at the beginning of the meeting how everything confidentiality is being, and I don't know what's caused you to bring that up at the meeting, but I've never been interested in who has coronavirus where, or what, but I am in some other things, and I'm not getting the answers very easily, but But there's things I think we should be speaking out on at times that we could do a great job speaking out on. So I guess I don't know what's typical and,
These are the folks for the executive session.
okay. So, I guess I'll go this way, has the local public health authority ever spoke as a local public health authority
I honestly don't.
since you've been here?
No.
Commissioner, this is Dave. I'm not aware since 1994 of the local public health authority ever being out in front on any issue. But then again, we've never had anything like this. So I think this is all bets are off. This is new ground.
So, well, example, Dave, to me is we repeatedly asked questions about, we were told early on that when somebody was identified as having the COVID-19, there would be kind of research into the circle of people that person might have contacted, and thinking like an investigator, I assume that they would be looking for is other people that maybe had been contacted that also got it. I've never heard whether or not that's true, but I think that would be something that would be interesting to people. Another would be the number of people recovered. And this email you sent us kind of clarified, we have the right to these same information. The confidentiality to me under HIPAA is about a specific patient with a specific, disease or whatever, but it's not about, are we learning anything? And what are we learning? And I've talked to somebody pretty high up in the hospital, and they felt like they're only tracking the people, apparently, that go to the hospital and end up being patients there. So once they don't take somebody in, those other people that have been positive, which is probably the majority of people that have been positive but don't go to the hospital, our health department is tracking them. But we're not getting any information about any of that. It's 3 weeks after we started doing this or whatever, and so I think that'd be the kind of stuff it'd be nice as the public health authority to be able to say, here's some of the things we're finding, the kind of common things that people ask us about, that people talk about.
Remember the measles epidemic? I mean, maybe this is a totally different situation, but we knew that somebody was at the gym and he was there at Friday at 5, and because that's so highly contagious, but we really had some details there.
Yeah,
Whereas, remember, and so in this case, we don't know if, okay, so we found a person and they're positive, and we've checked with them and we've contacted all the people that were around them, and just to let you know, they were shopping in Bend that day, and if you, just, be sure and wear your mask, wear your gloves, just kind of a positive reinforcement. But we did really learn a lot with the measles.
Yeah. Now we have 39 cases, and there's a lot we don't know whether they're connected to each other. We've heard people have come in from travel from other places, but we've never heard where. But those are things other people think about and ask me about, and so I'd like to be able to speak on it. Sounds like from Dave that we can, so.
Yeah, I was gonna say, I mean, that's the kind of information you can ask and get information about in these private meetings, and then.
But we work.
So we've been at this public meeting. You've asked this question. That's how I came to this. It's like, what is this confidentiality thing? And it's based in a reportable disease and sharing information as something has started. That was
Well, I think I could get some of these general questions answered in a public meeting. Now, we can sit down and try to get it out, get somebody to talk to us about it privately. But frankly, some of these are not confidentiality issues, in my opinion. And so we're having to fish to get this stuff and figure out the right way to do it, as opposed to the public health department, which we're the public health authority, just telling us. Like the head of the hospital probably can find out how many people are in the hospital today. He can probably find out how many are on ventilators. He's not a doctor. He doesn't have, so I'm just saying, you don't have to be a doctor to get all this stuff, and that's all
Well, okay, so we have 39 cases. Did we get any more today? I haven't looked at, I haven't seen anything. Usually it comes through early. So, okay, so those 39, where the majority of those travel, what is the breakdown of those? Is it still, is it like balanced, like men and women? You know, those are some of the things that we have heard off and
Getting a
on.
little bit of that in the reports.
Right.
But there's other follow-ups that we're not getting.
Right, so we heard today from Dr. Fawcett that several of them are on ventilators, some of them were in ICU. So that was, you know, that tells people, you know, what's happening.
So one idea, you've got communications people here, both Whitney and Morgan Emerson does that on behalf of health. She could, or both of them could, reach out to you directly to find out what information you'd like to express or you'd like to know more about, and can help you sort of craft some talking points that get at the kind of information that you think would be helpful for the public. And you could do that in whatever form you'd like. If you'd like to set up media interviews, if you'd like to issue a release, if you'd like to do a joint statement, filmed or not, you know, whatever of those, you know, you think would be most effective, I could task those two to work with you to help craft a message, and that could be an ongoing thing. It could be, you know, in whatever timing you'd like.
Okay, well, I think it's good that we're having our private meetings this week. And I think Dr. Fawcett will definitely try and get back to us with the testing that seems to be in a dark hole from St. Charles to the University of Washington. So, because I would like to see what that number really is. And we're not talking like New York City here. This is Deschutes County. You know, it's not like 4,000 people that they've got to determine if they're from Crook or Jefferson or Deschutes. So hopefully somebody's gotten that for us so that, you know, the people that live here are feeling a little better. That, okay, now we're down to 6%. We were at 9, now we're at 6, but really, should we be at 4? You know, for the positives over the entire testing. So, you know, that number I think will make people.
Well, I appreciate that he was willing to, and he was going to look into how many people have, left the facility.
The people that are recovered. Too.
Recovered, yeah, that'll be reassuring if it's half the people. Because I keep thinking there's 39 people out there that are, today have COVID-19. Because I've never heard anybody isn't part of that group, so maybe it's only 10 or have it right now. We don't know. Okay. So we can follow up with Whitney or Morgan. Do you have anything else to add, Dave?
You know, I think it's important to just, you know, keep in mind there's sort of 3 parallel tracks as I see in this area. You've got the restrictions on infectious disease reporting that kind of have some impacts. Apart from that, you have the HIPAA confidentiality rules that are applicable. And then I think you also have the sort of best practices that I think CDC and some of the others have put out. And so I know Dr. George, as your public health administrator, is trying to juggle and manage all of those. And certainly in the context of a public meeting, I think he's erring to the side of not disclosing, as you know, to make sure he doesn't cross over any of those boundaries. So hopefully one-on-one meetings with you folks as the local public health authority will provide some of that background information and detail that you want, and then you can determine on your own how to navigate those governors that are kind of placed out there and still be able to communicate with your constituents.
Thank you. Okay.
Okay.
Oh, you need to wait for your one-on-ones or anything you'd like me to?
Well, I don't know what the one-on-ones are, if it's just more trying to get fish, you know. My concern is if I get in a one-on-one and I just don't get any answers, I'm not any further than I was today. And I guess I want some clarity, maybe it's from Dave, about what we have a right to. I mean, I don't really think it's always essential that our public health administrator follows the CDC guidelines when we've clearly seen that CDC guidelines have been challenged on a bunch of stuff. So maybe that's what he has to go by, but he doesn't work for the federal CDC, he works for us. So, you know, and I hear doctors, I mean, even Dr. Fawcett said some things differently about masks, or, you know, so, anyway, that's just, I don't know what the individual meetings are, but, just an FYI for the future, if, it would've been nice to know 3 weeks ago is, here's the scope of information I'm able to give you in a public meeting. Why don't we have a private meeting and I can bring you up to speed on some of this, if that was a right we had 3 weeks ago, because we'd be fishing less in the dark, you know, in the dark, so. Okay,
Thank you.
thank you.
So now, we need to close our regular meeting now. Thank you very much, Samantha. If you want to close that, we need to open up our executive. Do you want a picture of this? That's the breakdown of everything on the original order.
Oh, yeah, let's see. Oh, from, yeah. I think I've got this.
You probably do. I just,
Or do you mean your notes?
all my notes.